Okay, so we are live now. A very good morning to everyone. Okay, thank you for tuning in. For everyone's information, today is the presentation day for informative speeches, or rather, informative presentation by all PSA degree students. So we have many coming up. All right, and I hope everyone will stay tuned to support them and feel free to use the live chat to comment on their presentation. Okay, so let us begin, all right, with the first group with their informative presentation. And these students are all from the medical electronic department. All right, so over to you, first group.
Thank you, Miss, for the lovely introduction. Aina, could you please share the screen? All right, thanks, Aina. A very good morning I bid to our beloved lecturer, Miss Shirin, and all of my fellow friends from BEU students and also BSM's class. Now, for today's task, we are going to present an informative speech titled How to Increase Your Lung Capacity. But first of all, it will be our pleasure to introduce ourselves first. I am Nur Balkis Rahana binti Baso as speaker number 1.
I'm Anis Rais Nabila binti Abdul Razak as a speaker 2.
And I am Aina Shafika binti Muhammad Rosli as a speaker 3.
Next, please.
I'm sorry.
Okay, now, sorry for technical errors, but first, let me begin this presentation by asking you a question. Have you ever wondering how did professional swimmers hold their breath when swimming? How did they manage to hold their breath for minutes? Now, people, the answer is their lung capacity helps them to swim without needing a glimpse of breath in such amount of time. My dear good friend Aina will explain to you what is lung capacity. Aina, your turn.
Okay, so what is lung capacity? According to healthline.com, lung capacity is a total amount of air that your lung can hold. Lung capacity is a total amount of air that your lungs can hold. Over time, our lungs and lung function typically decrease slowly as we age after our mid-20s. Same condition like chronic obstructive pulmonary disease, or known as COPD, can significantly speed up this reduction in lung capacity and functioning. And with that, I think we can jump to the next slide, and I will pass it on Balkis.
Okay, thanks, Aina. Since we took anatomy lessons this semester and did some heavy research about this topic for today's speech, thus, the three of us would like to share to all of you on ways to increase your lung capacity, starting with breathing exercises, next, physical staying active, and lastly, living on a healthy lifestyle. Now, let's begin on first point. Ladies and gentlemen, lung capacity can be increased with breathing exercises. Yes, people, breathing also has its own exercises. Now, according to Mark Courtney, a respiratory therapist, he pictured our lung as the screen door with a spring. He said, our lungs are springy like the door. Over time though, with asthma and especially with COPD, our lungs lose that springiness. They don't return to the same level as when you start breathing and air gets trapped in our lungs. Thus, practicing regularly, breathing exercises can help rid the lungs of accumulated cell air, increase oxygen levels, and get the diaphragm to return to its job of helping you breathing. Now, people, here are some useful tips on how to increase lung capacity by breathing exercises recommended by the healthline.com. First exercise, diaphragm breathing, or also known as belly breathing. It is to strengthen the diaphragm as it is the heavy lifter in breathing. It is most beneficial to people with OCPD. Now, next slide, please. Recommended by the COPD Foundation, here are the steps on belly breathing, and you guys can try too. First step, relax your shoulders and sit back or lie down, just like in the picture. Second, place one hand on your belly and one on your chest, like this, belly and chest. Third step, inhale through your nose for 2 seconds, feeling the air move into your abdomen and feeling your stomach move out. Now, last but not least, breathe out for 2 seconds to press abdomen by pressing on your abdomen. Now, you might repeat all of these steps to increase your breathing. Next exercise is first deep breathing. The purpose of this exercise is first deep breathing can slow down your breathing, reducing the work of breathing by keeping your airways open longer. This makes it easier for the lungs to function and improves the exchange of oxygen and carbon dioxide. Now, moving on to steps for first deep breathing technique. You guys can try too. First one, you need to inhale slowly through your nostrils. Second step is you need to purse your lips as if pouting or about to blow on something. Or simply, you can just do the duck face like this. Step number 3, breathe out as slowly as possible through first lips. And step 4, repeat, like what Jack did on this picture you can see. You guys can try too. So, ladies and gentlemen, now that we have tackled the breathing exercises, let us move on to Anis as she will share some interesting info that might change your life. Anis, the slide is on you.
Thank you, Balkis. Okay.
Welcome.
Active in physical sport is one way to increase our lung capacity. One of the larger differences between an exerciser and a non-exerciser is the heart's ability to pump blood and consequently deliver oxygen to working muscle. Once the lungs are damaged, lung function loss cannot be reversed, but lung capacity can be restored and even enhance the lung capacity. So, as you all know, lung capacity is the maximum amount of oxygen your body can use. So, exercising can increase heart rate and makes your breathe hard. Next. Okay. Next, I would like to tell you some of exercises that can help increase the lung capacity. First is cardiovascular exercise. Cardio exercise is exercise that gets your heart rate up and raises oxygen and blood flow throughout the body. According to the National Heart, Lung and Blood Institute, a build-up carbon dioxide in your lungs can be harmful to your body's organ that lead to respiratory failure. So, for example of cardio exercise is jogging, cycling, and swimming. A stronger cardio exercise vascular system means more capillaries delivering more oxygen to our cell in your muscle. And for your information, our heart is also a muscle too. So the American Heart Association recommends a minimum of 30 minutes of some form of cardiovascular exercise 5 to 7 days per week. These can be broken up into 10-minute time periods. Next. Okay, besides keeping your lungs smoke-free, practicing yoga is one of the best things you can do for the health of your lungs. Yoga will increase your lung capacity and boost oxygen intake. The deep inhalation and slow exhalation will aid in more oxygen going in and more carbon dioxide being expelled. It is also improve the muscular action involved in our breathing. Next. So, celebrity yoga expert Sunaina Reki recommends some poses that improve the functioning of your lungs. This posture will boost the blood flow to the lungs while washing out the toxin from the lung tissues. Next. Okay. So, this is a simple process of the yoga that we can practice in our daily life. First, sit in Sukhasana or easy pose. Second, hold your left wrist and with your right hand behind your back. And third, inhale and pull your shoulder behind and expand your chest. Fourth, when you exhale, you need to bend forward, then touch your forehead to your right knee. And the next step is inhale and return to the starting position. Lastly, you need to repeat the steps and touch your forehead to your left knee. Okay, next. Okay, now I will pass to our third speaker, Aina Shafika.
Alright, so another way to increase lung capacity is to live on a healthy lifestyle. The first good lifestyle is stop smoking. As we all know, smoking damages the lung, causing all sorts of problems from lung cancer to respiratory disease. Our lungs are one of the organs that is most impacted by cigarette. There are major differences here between a smoker and a non-smoker in terms of their lung health. It's understood that smokers are much more likely than non-smokers to develop all forms of lung cancer. Men who are smoked are 23 times more likely to develop lung cancer than men who have never smoked. Smoking can also hurt your athletic performance in several ways. For example, blood hurt lungs. Smoking hurts your lung capacity. The tar in cigarette smoke coats your lung and makes the air sacs less elastic. Smoking even a few cigarettes a day can decrease test. Hello? Can you hear me?
Continue. Yes, Anis. Continue. I can hear you, Aina.
Okay. For
Continue.
smoker, all right. For smoker, one of the best way to keep smoking is to exercise. When you quit, your heart rate will decrease, your blood circulation will increase, and your lung function will improve, making your workout performance better too. Another way is to prevent yourself from being a secondhand smoker as well. A secondhand smoker may also put the lungs at risk. For non-smoker, breathing secondhand smoke has immediate harmful effects on the heart and blood vessel. Next is stay hydrated. One easy way to improve our lung capacity is to drink more water. Drinking water helps you breathe easier. Water makes up approximately 60% of your body weight. The water keeps blood flowing to and from the lungs, allowing them to function at full capacity. The National Academy of Science, Engineering and Medicine suggests that man needs 125 ounces of fluid a day and a woman needs 90 ounces of fluid a day. You must drink at least 8 to 10 glasses of water to keep your body hydrated because dry lungs are more affected to inflammation and irritation. This is because when the airways become too dry, the risk of breathing problems or breathing-related problem increases. According to dietitian Jaslyn Kaur, there are few drinks that can help cleanse your lung, which a detox drink. Firstly is green tea. Green tea is commonly used these days and it's coming into our habits. It is rich in antioxidant which may help prevent or reduce the inflammation in the lungs. Taking 2 to 3 cups of green tea per day is a great way to cleanse the lungs. Next drink is cinnamon. Cinnamon is loaded with antioxidant which can help reduce inflammation in the lungs, lower blood pressure and control blood sugar levels. Research shows that cinnamon can especially be beneficial for people with lung cancer before and after treatment. Last but not least, to improve your posture. Studies have shown that slump sitting decreases lung capacity and expiratory flow. So, the tip is to keep your spine straight and your chest open, and you will improve the airflow of your lungs. Be sure to sit up straight.
Okay, okay, Aina.
I'm sorry. Be sure to sit up straight while taking deep breath. A healthy posture can also lead to back pain. For better posture, first you do not slump at your desk. Sit all the way back in your chair to protect your spine's natural curve. Bend your knees at the right angle to keep them the same height or a bit higher than your hips. Second, sleep on the good bed. A mattress that is too soft can be bad for your back. Next is regular exercise. Not only does this help to keep the weight down, it tones the muscle and helps to keep you flexible, so it's easier to maintain the right stance. And now, as we are already end of the last point, I will hand it over to Anis and take it from here.
So in conclusion, it is advisable to follow this way in increasing your lung capacity. Lung capacity predicts health and longevity. Giovanni Papini once said, breathing is the greatest pleasure in life, but many people underestimate it until the pleasure is taken away. Okay, that's all from us. So thank you. And
Thank you.
now we are open to question and session.
Thank
Morning,
you so much.
everyone. Hi, good morning, everyone. I want to
Good
ask a
morning, Adiba.
question. All right. I want to ask a question. Other than the two exercise that you have told, there are there any other breathing exercise that is beneficial to our lungs?
Good question, Adiba. And yes, there are some other exercises you can do too. You can check on the roll breathing and morning breathing. Check out on Google for more details.
All right. Thank you, Balkis.
Thanks very much, Adiba. Any more questions? Oh, time's out now. So again, thank you so much for all of your attention and all of your for and sorry for all the technical errors that we did. So pass to you, Miss Shireen. Thank you so much.
Okay, thank you so much to Group 1 for the wonderful presentation on how to increase our lung capacity. I think this is extremely important, especially during the time of pandemic now. Everyone has to learn to increase your lung capacity so that we can cope with all the changing and challenging times. All right, so this is what we're going to do, students. Once you are done with the presentation, you are going to introduce the next group. Okay, so one of the first speaker or any of the speaker in the group can do that by introducing the next group and their topic. All right, so this is how you do it. All right, following that, okay, would you like to know how COVID-19 affect the respiratory system? Yeah.
We do.
Okay, so coming up is group 2. Uh, by Nurul Aini Shazlin, Adiba, and Zulaika with their informative presentation on how COVID-19 affects the respiratory system. Okay, so take it away, Group 2. So Group 2 next, we'll introduce Group 3 once you're done with your presentation, okay?
Shall we start?
Thank you, sir.
Good morning, Miss Sherry and my entire virtual friends. Let me introduce my group mate first. My name is Adiba binti Azmi. Second is Nurul Aini Shazlin binti Muhammad. And the third is Nur Zulaika binti Zubair. Today, we plan to speak about how our respiratory system works and how COVID-19 affects our respiratory system. Malaysia, on Wednesday, January 20, reported its highest daily COVID-19 cases since the pandemic exists in our country with 4,009 new cases. Coronavirus has now become an important pandemic that gripped the entire world. It is important to understand the transmission and the effects of the virus. Coronavirus cause respiratory illness, so the lungs are usually affected first. So let's see how this virus affects our respiratory system. Before we start our presentation, let us start with a breathing exercise. Follow the breathing box below. Inhale, hold for a minute. When exhale, hold. Okay, we can repeat it. Hold, exhale, and hold. Alright, for your information, breathing exercises are a good way to relax, to reduce tension, and relieve stress. You can do them whenever you want, and you do not need any special tools or equipment to do them. Now, I will turn the floor over to the next speaker, Nur Aini Shazin, to talk about how the respiratory system works.
Okay, thank you, Adiba. Before we start in detail about the main topic today, I want to introduce you guys about the what is the respiratory system. Okay, the respiratory system is the network of organ and tissue that help you breathe. Breathing is the first step in a respiratory system. It includes your airway, lung, and blood vessel. The muscle that power of your lung are also a part of the respiratory system. Okay, their part work together to move oxygen without the body and clean our waste gas like carbon dioxide. Okay, breathing, normal breathing. Okay, normal respiratory is it bring oxygen into our bodies, which we need for our cell to live and function properly, and it help us get rid of carbon dioxide, which is a waste product of cellular function. The nose, perineum, larynx, trachea, and bronchi all work like a system of pipe tooth with the L is final down into the lung. Okay. Before I will detail about the process of I will go detail about the process of respiratory system. Now, first I want to introduce you guys about. I want to show you guys about the part of the component of respiratory system. Okay, this one is the whole part of respiratory system. Okay, the first picture show the nose and mouth. Okay, the nose and the mouth will connected with perineum and larynx. And the second picture is the respiratory component, which is trachea, bronchial, and the booth of the lung, and the last one is the diaphragm. Okay, the third picture is bronchial and alveoli, and the last one is capillary. Okay, let's now we go to about the respiratory system process. Okay, respiratory system process start when you breathing in. Okay, the air flush in to your nose and mouth, go to the perineum and larynx, and after that go to the trachea, and the air travel down into the lung, pass to the bronchial, and after that the air travel around the bronchial, and the air enter the alveoli. In alveoli, oxygen in air pass to the oxygen will pass to the surrounding capillary, and the oxygen absorbed together with the red blood cell, and the red blood cell will travel the whole body. After blood travel the whole body, the carbon dioxide produced. When breathing out, carbon dioxide produced, and carbon dioxide move from capillary into the alveoli, and the carbon dioxide travel again in alveoli in bronchiole, and meet together from left and right bronchi, and go to the trachea. Um, after that, perinats and larynx. And that process happen when breathing out happen. Uh, so, okay, from inhalation, diaphragm and construct and move downward, and the chest space increase. When exhalation happen, diaphragm relax and move outward into the chest. Okay, let's move on with respiratory system process. Now I will pass to the next presenter, Zulaika, to talk about coronavirus can affect the upper respiratory system.
Thank you, Shazlin. Okay, the new coronavirus can infect the upper and lower part of your respiratory system. Think of your respiratory system as an upside down tree. The trunk is your trachea, and then it splits into smaller and smaller branches in your lungs. At the end of each branch, there are tiny air sacs called alveoli. This is where oxygen goes into your blood and carbon dioxide comes out. The coronavirus can travel down into your airways, and the lining can become irritated and inflamed. In some cases, the infection can reach all the way down into your alveoli. Okay, next. Coronavirus can affect the upper respiratory system, which is your nose and throat. If you breathe in the virus droplets or touch surfaces and then you touch your face, the virus can enter your body and infect you. Once inside the body, the virus begin to replicate and invading your upper respiratory system, which is your nose and throat. Next. But if a patient has a weak immune system or an especially aggressive infection, the virus can invade the lower respiratory system, which is the lungs. As you can see on the screen, the GIF on the right shows infected alveoli. The alveoli tissue in the lung itself will become swollen and filled with fluid, which is clinically referred as pneumonia, thus reducing the lung ability to transfer oxygen into the blood and then the whole body. Okay, next. One of the biggest, most life-threatening is when the virus causes hypoxia. It is a condition when oxygen levels in the body are abnormally low, which can damage vital organs if gone undetected for too long. Your organs need oxygen. Without enough oxygen, some organs start to fail. In these severe cases, a patient may need ventilator to support to breathe. Next, I will pass to Adiba Azmi to share to us how to improve our lungs health.
All right, thank you, Zulaika. Everyone knows healthy lungs and a good respiratory system will make sure that you stay healthy. Why? A poor respiratory health can affect your quality of life. It's hard to enjoy life when you are sick. A way to improve your lung health is don't smoke use tobacco products. If you heard it a million times before, smoking is not good for your lung and your health. There is a reason why every health organization says this over and over again. Avoiding or quitting a smoking habit is the most effective way to keep your respiratory system strong and healthy. Smoking can disrupt our lung function and it makes harder to your body to fight off COVID-19. Available research suggests that smokers are at the higher risk of developing COVID-19 outcomes and deaths. There are several tips to reduce the risk of infection for you and your family during the COVID-19 outbreak. Firstly, wash your hand oftenly, especially after sneezing or coughing, helps to protect you and other from disease. Washing your hand 20 seconds with soap of warm water with warm water. Never touch your mouth, your nose, and your eyes without washing your hands. By using proper hand washing technique regularly, the risk of infection is greatly reduced. Secondly, sneezing into your elbow like this can stop the spread of respiratory illness like the flu. If you sneeze into your hands, you may spread germs when you touch any surfaces. Third, avoid contact with other when you are sick. Do not go any public place when you are sick. You may spreading your illness to the others. By eating healthy foods, getting enough sleep, and being active every day, it can keep your respiratory system, cardiovascular system, and immune system strong. Getting enough exercise make your lungs stronger and better at giving your body the exercise to give your body the oxygen needed. And of course, your skeletal and muscular system strong. Now, I will invite Nur Zulaika to take the floor to make a conclusion to our speech.
In a nutshell, respiratory system is very important because it is responsible for obtaining oxygen, which we need for our cells to live and function properly, and also to getting rid of carbon dioxide, which is a waste product. So please take a good care of your respiratory system, and during this pandemic, make sure that you always cover your nose and mouth when you cough. Seek medical attention if you are sick, wear a mask, maintain a safe distance, stay at home if you feel unwell, and last but not least, clean your hand with soap or use alcohol base to rub your hand. That's all from us. Any question?
Hi, my name is Muhammad Abdul Aziz bin Cemat from Group 3. I want to ask a question from Group 2. Why symptoms like shortness of breath for coronavirus patient appear at different time?
Okay, Aziz. I will answer your question. Okay, why symptom like shortness of breath for coronavirus patient appear at different time, right? Okay, it because people have a different immune system. For example, other people don't have a strong immune like younger people. Okay, that's why the under people have a high potential to get the coronavirus disease. That's all.
Thank you, Shazlin.
Okay,
Thank
thank
you,
you,
Aziz and
Aziz.
Shazlin. Any other question?
Hello, can you hear me?
Yes, yes.
Hello, test.
Hello,
Okay,
yes.
my name is Nur Safia Zoana. I want to ask you a question about how do masks help stop the spread of the virus? My question is, how do masks help stop the spread of the virus? That's all.
Okay. Thank you, Safia. Let me answer the
Clear?
question. Yes, clear. Thank you,
Okay.
Safia. Okay. The main benefit of wearing a mask is preventing spread of the virus. If you are infected yourself and you wear a mask, the mask largely will block those droplets from coming in contact with other people when you talk or you cough. And also, if you wear a mask and you are around someone who is infected, fewer droplets will get to your mask. And in that case, you are probably getting a lower dose of virus. And any other questions? Okay, if there's no other question, I guess that is all from us. Thank you so much for listening and stay safe and healthy. Thank you.
All right, people. Do you want to know about your hormones? Do you see your hormones right now? No, right? Okay, let me invite Group 3 to give their speech about natural way to balance hormones. Welcome, guys. Do you hear me?
Yes. Okay.
All right.
Okay. Hi. We are from Group 3. Hello to my fellow friends and my beloved lecturer. So our informative for today is natural ways to balance hormone. So we have three members here. The first is Ahmad Shafiq Arif bin Shabi. Please say hi.
Hi.
Okay. And the second member is Mama Abdul Aziz bin Cekmat. Aziz, say hi.
Hi.
And the last member is not least is me, Ani Haris Muhammad bin Im Haris. Okay, so we will move to our intro to next speaker, Aziz.
Okay, hi. For introduction, hormone. What is hormone? Hormone have profound effect on your mental, physical, and emotional health. This chemical messenger play a major role in controlling your appetite, with and mood, among other things. Normally, your endocrine gland produce the precise amount of each hormone need for various process in your body. However, hormonal imbalance have become increasingly common with today fast-paced modern lifestyle. In addition, certain hormone decline with age, and some people experience a more dramatic decrease than others. Fortunately, a nutritious diet and other healthy lifestyle behavior may help improve your hormonal health and allow you to feel and perform your best. Okay, that's all for me for introduction. I will uh, get to Ahmad Shafiq for the next speaker.
Okay, thank you, Aziz, to give me a chance. Okay, so I'm sure we can see hormone is very important to our body. Okay, back to the topic. The first point of a natural way to balance your hormone is eat enough protein at every meal. Okay, consume an adequate amount of protein is extremely important. Why? Because dietary protein provide essential amino acid that your body can make on its own and must be consumed every day in order to maintain your muscle, your bone, and skin health. That's why we must to take a protein at every meal because we can doing a photosynthesis, right? Okay. In addition, protein influence that release the of hormone that control appetite and food intake. In another research, women who are consume a diet contain 30% of protein experience in increased GLP-1 and a greater feeling of fullness than when their diet contain 10% of protein. Okay, what is a GLP-1? Okay, GLP-1 is the hormone. When the function is when the sugar is high, so GLP-1 stimulate insulin secretion. So we can consume the adequate protein can trigger the production of hormone. Okay, for the second point is avoiding a sugar, refined carbohydrate. I'm sure everyone know when avoiding or minimizing their food may be instrumental in optimize hormone function and avoiding obesity, diabetes, and other disease. Because this is a major problem if we take a lot of sugar and carbohydrate, right? And okay, maybe we can look for the fructose because have a research that show fructose can increase insulin level and promote insulin resistance, especially in overweight and obese people with diabetes and diabetes. Okay, fructose is like glucose, but naturally we can find in fruit, honey, and most root vegetable. In addition, following a low moderate can diet based on whole food maybe reduce insulin level, overweight, and obese people with the prediabetes and other insulin resistant condition like polycystic ovary syndrome. So I will pass for the next speaker, Aziz.
Hi, we come back to me. Okay, for the third point is drink green tea. What is green tea? Green tea is one the healthiest beverage around. Two metabolism, boosting caffeine. It contain an antioxidant known as epigallocatechin gallate, for example, EGCG, which has been credited with several health benefits. For what we research for green tea is that to that consume tea green tea may increase insulin sensitivity and lower insulin level in both healthy people and those with insulin resistant condition like obesity and diabetes. In one detail for what we study about green tea, um,
link green tea to significantly lower fasting insulin level. A few control what we study found that green tea didn't seem to reduce insulin resistance or insulin level when compared to placebo. However, this result may have been due to individual response. Since green tea has other health benefit and most studies suggest that it may provide some improvement in insulin response, you may want to consider drinking 1 to 3 cup per day. Okay. Okay, and then for fourth point, eat fatty fish often. Fatty fish is by far the best source of long-chain omega-3 fatty acid, which have impressive anti-inflammatory properties. What we research about eat fatty fish often, they may also have a beneficial effect on hormonal health, including reducing level of the stress hormone, cortisol, and adrenaline. A small study, what we get observe the effect of consumed omega-3 fat on men performance on a mental stress test. The study, what we get about eat fatty fish often, the man consume a diet rich in omega-3 fatty for 3 weeks. They experience significantly smaller increase in cortisol and epinephrine during the test than when they follow the regular diet. And then what we get about fatty fish after that, some student what we get found increasing your intake of long chain omega-3 fatty acid may reduce insulin resistance related to obesity, polycystic ovary syndrome, and gestational diabetes. Gestational diabetes occur during pregnancy in women who did not have diabetes prior to becoming pregnant, like type 2 diabetes. It characterized by insulin resistance and elevated blood sugar level. And then for the lastly, for eat fatty fish often, what we get if women with gestational diabetes took 1000 milligram of omega-3 fatty acid daily for 6 weeks, the omega-3 group experienced significant reduction in insulin level, resistance, and the inflammatory marker C reactive protein, for example CPR, compared to women who received the placebo. For optimal health, include 2 or more serving per week of fatty fish like salmon, sardine, herring, and mackerel. That's all for me. And then I would like to, next speaker is Nick Haris
Okay.
Muhammad.
Thank you, Aziz, for passing to me. Okay, the fifth point is consume a high fiber diet. What is high fiber diet? High fiber diet is a food such as grain, fruit, vegetable, nuts, and seed. It's good for our respiratory, for our stomach. Okay. The fiber diet, it help you to eat slower and savor your meals and prevent overreacting. So fiber actually have two types. Okay, the first type is soluble, and the second type is insoluble. Okay, insoluble fiber is found in oat grain, barley, nuts, seed, beans, and some other fruits and vegetable. And insoluble fiber is found in food such as wheat grain, vegetable like cabbage, like that. Okay, so the both soluble and insoluble are important component of healthy diet. Okay, study have found that it increase insulin sensitivity that stimulate the production of hormone that make you feel full and satisfied. Okay, first thing, what is actually insulin? Okay, insulin is a peptide hormone in our body. It helps to regulate blood sugar level. After you eat, carbohydrate breaks down into glucose. Glucose is like sugar, okay? That in our body as a primary source of energy. Although soluble fiber tends to produce the strongest effect on a peptide and eating, insoluble fiber may also play a role. Both type of fiber cause a reduction in appetite. To protect against insulin resistance and overreacting, make sure you eat fiber-rich food on your daily basis. Okay, we go to the last point. Eat eggs at any time. As we know, eggs are one of the most nutrition food on the planet. Sorry, mostly bodybuilder eat eggs. I have my friends who are a bodybuilder. He eat 5 raw eggs every morning to get the protein. So eggs, the research been shown that to beneficially affect hormone that regulate the food intake, including a lowering level of insulin. Like I say, insulin is in one study, men had a lower insulin level after eating eggs at breakfast than after eating a bagel for breakfast. Bagel is technically is a bread, okay? Importantly, this positive effect on hormones seem to occur when people eat both the egg yolk and the egg white. So, for instance, another study found that eating whole egg as part of a low carbohydrate diet increased insulin sensitivity and improved several health marks more than a low carbohydrate diet that include only egg whites. Eating the egg white and yolk together in a whole egg provide the right balance of protein, fat, and calories. Most studies have looked at the effect of eating eggs at breakfast because that is when people typically consume them. However, this nutrition powerhouse can be eaten by any meal, and hard-boiled egg make a great portable snack. So we move. So our conclusion is for ways to balance our hormone are involved in every aspect of our health. We need them in every specific amount of our body to function optimally. Hormonal imbalance may increase your risk of like obesity, diabetes, heart disease, and other health problems. So our diets, our daily food intake is very important to stabilize our hormone. Deep side that fact that uh, another fact, aging and the other factor are beyond your control. There are many steps you can take to help your hormone function optimally. Consuming nutrition, food, exercise, on a regular basis, engaging in other healthy behavior can go a long way toward improving your hormonal health. Okay, so as we can see, during MCO, many cannot exercise. So our diet is the is the way our health, our food is the way to balance our hormone. So that is for us. Thank you. Any question from another for any question?
Hi, my name is Ahmad Rafiki. I am from group 13. So I want to ask about how much protein that we need per day. Thank you.
Okay. Thank you, Ahmad Rafiki. Okay. I want to answer this question. Okay. How much protein is needed in per day? My opinion regarding how much protein we need actually no specific number. By the way, most official nutritional organization recommend a fairly modest protein intake. The DRI, dietary reference intake, for example, is DRI, suggests 0.8 gram per kilogram of body weight. This amount to 56 grams per day for the average sedentary man, and then 46 gram per day of average sedentary for women. This may be enough to prevent deficiency, but the amount you need depends on many factors, including your activity level, age, muscle mass, physical goals, and overall health. That's all for me. Thank you for asking me. Any question?
Any question?
Any question?
Okay, I have a question.
Okay.
Okay, I'm Nurul Aini Shazlin.
Okay, Shalin.
Okay, my question is, what sign or symptom of a hormone imbalance?
Okay, I will answer your question, Shalin. Okay, hormone we have many type of symptom or hormone. One of it is mood swing. Okay, mood swing. Okay, many women experience like anger, depression, anxiety before a doing period, right? So mostly women lah. Okay, this caused by estrogen level rise and fall dramatically because estrogen has an effect on neurotransmitter in our brain, including a chemical that boosts our mood. So that's why when period, most of the women is not in a good mood. But most of the men doesn't understand. But yeah, we as the men we have to know about a woman period and about her mood. Okay, that's all for me. Thank you. Any question?
Hi, good morning, everyone.
Okay.
My name is Adiba from BU3A. I want to ask a question. How much fiber do I need for each day?
Okay, thank you. So I will answer your question. Okay, how much fiber do I need each day, right? Okay, fiber is a complex carbohydrate that found in the cell wall of all the plant-based food. Okay, the American Heart Association eating plan suggests eating a variation of food fiber source. Total dietary fiber intake should be 25 to 30 milligram 30 gram of the day for food and not supplement. Okay, a great source of whole fruit and vegetable, whole grain and beans. Fiber appear to reduce the risk developing various condition, including the heart disease, diabetes, diverticular disease, and constipation. Despite the benefit, fiber probably has a little, if any, effect on colon cancer risk. By the way, so you must take at least 25 to 30 gram per day of fiber. They answer your question.
Oh, I see.
Okay.
Yes, yes. Thank
Any
you.
question?
Thank you, Shafiq.
Hello.
No question?
Hello. Can you hear me?
Yeah.
Okay. Like of all us, that we can get a protein through like a meat and some of protein like from a fish. So what a protein, recommended protein that we for the vegan people, the minority vegan people. So what do you think about it? What food that they can get for them about the protein?
Okay. Yeah. Okay. Hello. Okay. Thank you for asking a question. Protein what we get we need to men. That's right.
No, not to the man, but to the vegan people, the vegetarian
Oh,
people.
vegetarian.
What the best food for them to get a protein?
Okay.
Okay, I will answer the question. Okay, so for vegetarian people, the you know tofu. Tofu is containing protein. So because he have soybeans. So soybeans technically have a protein. So it's it's a good it's a one of the protein that vegetarian can take lah. So but I know vegetarian cannot eat meat. So one of these is tofu because I have soybean inside. Chicken peas, I take chickpeas like nuts like that. I is what is the green color if I remember. It's a bean. So the beans also have protein, so vegetarian can take to get the protein. The yeast, you know, yeast, natural yeast also have a protein inside. I and that's all I think. As far as I know, that is all the vegetarian can take for as a protein to gain the protein like tofu.
And then you can eat for vegetarian you can eat a cocoa crunch, anista, and that's so many protein but we for vegetarian get.
Because he has wheat inside, so is have a like natural protein. Okay, that's did we answer your question? Sorry.
Yes.
Thank you.
Thank you.
Okay, so that's all. Okay, we are moving to our next the next group is, if I'm not mistaken, is No Safi Hazawana. It's about diabetes. We all want to know what is diabetes, right? So we moving on to No Safi Hazawana.
Okay, thank you.
Okay, would the present group care to introduce the next one?
Can you see the slide?
Yes, Trisha.
Yes.
Okay. Aisha, are you ready?
Yes.
Okay. Yes. Okay. Good morning to Miss Sharon and all my friends. Okay, first I want to introduce our teams. Let's start with me, Patricia, as our first speaker. And the second speaker is Siti Aisha. And the third speaker is Safia Zawana. Okay, before I start with my speech, can I ask a question? Can all of you raise up your hand if you have or know someone with diabetes? I assume most of us know about the diabetes. So let me explain a bit detail about the diabetes. Diabetes is a major public health that concern in the Malaysia. The prevalence of the type 2 diabetes has escalated to 20.8% adults at the age above of 50 and affecting 2.8 million individuals. Although we may not all have in this class have a diabetes, but diabetes a huge threat in the global health that becoming a rapid epidemic throughout the world that touch all age groups. According to the IDF, which is International Diabetes Federation, there are approximately 463 million adults in range age between 20 to 79 years old that living with the diabetes. By 2045, this will rise to several hundred million. So we can see several hundred million is big number, right? So I could sit here all day and tell all of us that none of us will contract with any kind of diabetes, but there will be a lie. So after our group made some research about the diabetes, so
we conclude that diabetes is a serious trait that engulf a vast of population today. So, in order to be informed about the diabetes, there are a few things that we have to understand. So, today our group wants to look at the three aspects, which is the first aspect is background of the information of diabetes, and the second aspect is complication of diabetes, and third is the what we can do to prevent and maintain the blood glucose levels. So, let's we see what is the diabetes and what the meaning of diabetes. Diabetes is caused due to excessive sugar in the blood circulation. So, diabetes occurs when your blood glucose or blood sugar is too high. And how this happen? So the glucose is the glucose in our body is come from what we eat every day. So the insulin, which is a hormone that produced by pancreas that helps to glucose to get into the body cell and change to the energy to our body. Sometimes our body cannot make the insulin enough and use the insulin proper. This will occur the diabetes. So let's see what the causes of diabetes. So the first is genetic, and the second obesity, third high blood pressure, and last prescription medications. So let's see what are the symptoms of the diabetes. The first is fatigue, yang second no healing, and less weight loss. So I will pass to the Siti Aisyah to continue to explain about the type of diabetes.
Okay, thank you, Patricia. So we already know what diabetes is. So do you know how many type of diabetes? Maybe we just know diabetes has one or two type, but actually diabetes has four type, which is namely pre-diabetes, type 1, type 2, and gestational diabetes. So, pre-diabetes is when your blood glucose level are higher than doctor would normally like, but not high enough to be diagnosed as diabetes. This is a disease that occurs when your body doesn't make or use the hormone insulin properly. It causes too much glucose to build up in the blood. Too much glucose in your blood can be harmful to your body over time. And the second is type 1. Type 1 diabetes is also called insulin dependent diabetes. It used to be called juvenile onset diabetes because it often began in childhood. Type 1 diabetes is an autoimmune condition. It happens when your body attack your pancreas with antibodies. The organ is damaged and doesn't make insulin. Your genes might cause this type of diabetes. It could also happen because of problem with cell in your pancreas that make insulin. And next, type 2. Type 2 diabetes used to be called non-insulin diabetes and non-insulin dependent or adult onset diabetes. But it's become more common in children and teens over the past 20 years, largely because more young people are overweight and obese. So about 90% of people with diabetes have type 2. When you have type 2 diabetes, your pancreas usually create some insulin, but either it's not enough or your body doesn't use it like it should. Insulin resistant when your cell not respond to insulin usually happen in fat, liver, and muscle cells. And the last type is gestational diabetes. Pregnancy usually causes some form of insulin resistance If this become diabetes, it's called gestational. So doctors often spot it in middle or late pregnancy because a woman's blood sugar travel through their placenta and to the baby. It's important to control gestational diabetes to protect the baby's growth and development. Doctors report the gestational diabetes in 2% to 10% of pregnancies. It usually goes away after birth, but up to 10% of women who have gestational diabetes get type 2 weeks or even years later. Uncontrolled diabetes can lead to a few short and long-term complications. Most of these diabetes-related condition occurs as a result of uncontrolled blood glucose level, particularly increased blood sugar over a prolonged period. So, next, complication of diabetes. There are many associated risks with diabetes that are serious and can sometimes result in death. Just to name a few, like stroke, heart disease, nervous system disease, blindness, and foot amputation. 65% of death occurs from heart disease and stroke among adults with diabetes. So it is obvious that the complication associated with diabetes can be scary and life-threatening, but there are many ways to keep your diabetes under control and prevent diabetes from entering your lifestyle. So I will pass to next our last presenter, Nur Safia, to continue our presentation.
Okay, thank you, Presenter Aisha. Okay, at present, type 1 diabetes cannot be prevented. When it comes to type 2 diabetes, it is important to be prevented. It is especially important to make a diabetes prevention a priority if you are at increased risk of diabetes. Diabetes prevention is as basic as eating more healthfully, becoming more physically active, and living a round. To start, making a few simple changes in your lifestyle now may help you avoid the complications, the health serious complications, such as nerve, kidney, and heart damage. Consider this diabetes prevention tip from the American Diabetes Association and the International Diabetes Federation. To get more physical activity can give us more benefits. Exercise can help you to lose weight, lower your blood sugar, and boost your sensitivity to insulin, which helps keep your blood sugar within a range, within a normal range. Aerobic exercise and resistance training can help control the diabetes. The greatest benefit come from a fitness program that includes both. The IDF have recommend for a healthy diet for the general population. Eating at least 3 servings of vegetables, including green leafy vegetables, and eating to 3 servings of fresh fruits every day. Choosing nuts, a piece of fresh fruit, or unsweetened yogurt for our snacks. And another recommendation is by choosing water, coffee, and tea instead of fruit juice, soda, or other beverage. The IDF also recommend to limit the alcohol intake to maximum of 2 standard drinks per day. Lose extra weight if you are overweight. Diabetes prevention may hang on weight loss. Every pound you lose can improve your health, and you may be surprised by how much you improve. Participants in one large study who lose a modest amount of weight, around 7% of initial body weight, and exercise regularly can reduce the risk of developing diabetes by almost 60%. It is no secret that smoking is bad for your health. Smoking hurts your lungs and your heart. amount of oxygen that gets to your organ, raises your bad cholesterol and raises your blood pressure. All of these can raise your risk of heart attack and stroke. If you don't smoke, that's great. Make a plan to never start. If you do smoke, there is something you can do, which is challenge yourself to quit smoking. Here are some steps to help you do it. Step 1, realize the benefits of quitting. Quitting helps your heart and lungs, and it lowers the risk of hurting your blood vessels, eyes, nerve, and other organs. Step 2 is prepare to quit. Quitting is hard work, like project such as throw away your cigarettes, matches, lighters, and extras. For the step 3, choose a quitting strategy like taper off, which is quit smoking gradually by cutting back over several weeks. Or you can ask your doctor about counseling, acupuncture, or hypnosis to quit smoking. You can use one of these steps or a combination of them. When you do, you will feel healthier right away and you will be healthier for the rest of your life. By better understanding diabetes and becoming knowledgeable on the consequence of diabetes, we can prevent and maintain our blood control. Next is I want to share how to test our blood sugar. Firstly, prepare your glucose testing kit, and if you don't have it at home, you can buy it at pharmacy. And make sure to wash your hand first before using it. Secondly, prick the side of your fingertip with your test kit. And thirdly, gently squeeze your or massage your finger until a drop of blood forms. And next, we insert the test strip into your meter. And the last one is the monitor will show you the results after a few seconds. If it takes longer than a minute, you may have done something wrong. Go back and read the instructions of your monitor to see if you need to do something differently. Diabetes is an incurable disease that affects a large amount of our population today. But if we are well informed, we can make
Sorry,
smart
presenter.
decisions to prevent and maintain this disease.
Sorry,
Yes?
presenter. Your time is up.
Oh, so
The
okay.
time.
Okay. I will
Okay. You have
conclude.
3 minutes
Okay.
to. Okay.
Okay.
3 more minutes
Okay.
for your question and answer.
Okay. I will conclude our presentation. Okay. Diabetes is an incurable disease that affects a large amount of our population today. But if we are well informed, we can make smart decisions to prevent and maintain this disease. There is no cure for diabetes, but thus far, the diagnosed can still live a long, healthy lifestyle if they take care of themselves. To better understand diabetes, we need to recognize the four different types of diabetes, which is pre-diabetes, the type 1 diabetes, the type 2 diabetes, and the gestational diabetes. And we should know the complication of diabetes and release what we can do to prevent and maintain the diabetes. I hope that this presentation provided you with some good information about the diabetes. My suggestion to you is to take a look at your lifestyle and see if you can maintain a healthy lifestyle and a balanced lifestyle. That's all from our group. Thank you. Do you have any question? Do you have any question?
Hello. Okay, I want to ask about the
Yes.
artificial sugar and the diabetes. For the diabetes, what do you think about it? Because some of people that have diabetes that they can eat some sugar, but some of artificial sugar they can take.
means right. Seven.
Okay, I will try answer your question. You can use most sugar substitutes if you have diabetes. If you are including saccharin, sucralose, or stevia, artificial sweeteners or so-called sugar substitute, low-calorie sweeteners or non-nutritive sweeteners offer the sweetness of sugar without the calories. So patients with diabetes can eat the artificial sweeteners without any worry. Is it clear?
Clear, clear. Thank you.
Clear. Okay. All right. Any question? If no, we will pass our presentation to the next group, which will prevent about urinary system.
Okay, thank you to all presenters so far. Just a little reminder to the next group onwards. Okay, please make sure that your faces can be seen. All right, and not just that, please also keep to the time limit. Okay, and you have 3 minutes for question and answer. Please make sure that all your group members attempt to answer the question given by the audience. Okay, failing to do so, the question and answer marks will only be given to the person who speaks. Okay, which means you will lose 10% altogether. So make sure you do that. All right, and good luck to the rest of the groups. Okay, so feel free to also log on to our YouTube live to comment, to drop a word of encouragement to all the presenters, and to ask questions if you do have as well. All right, thank you everyone. Looking forward to the next group.
So, hi everyone, we are from Group 5. Today we will present informative speech about what does our kidney do in the urinary system. So first, I will introduce my group member. First is Sri Hausa, that is me, will be first presenter, and second is Khairul Nisa Izati, that will be the second presenter, and the last one is Muhammad Ali Hakimi, that will be the last presenter for today. So this is our main point for this topic. But before we go through the by one main topic, I will tell you what is kidney and what is urinary system. So kidney are a pair of bean-shaped organs that are located on either of your spine, below your ribs and behind your belly. Each kidney is about 4 or 5 inch long, roughly the size of a large fish. The kidney's job is to filter our blood. They remove waste, control the body fluid balance, and keep the right levels of electrolyte. All of the blood in our body passes through the kidney several times a day. So the second one is, what is urinary system? The urinary system, also known as the renal system or urinary tract, consists of a kidney, ureters, bladders, and urethra. And the purpose of the urinary system is to eliminate waste from the body, regulate blood volume and blood pressure. It also control levels of electrolyte and metabolites, and, and regulated blood pH in our body. So, for the first main point, let's talk about the function of the kidney in the urinary system. The kidney are responsible for getting rid of waste products, drugs, and toxins through our urine. The kidney works by remove waste and extra fluid from our body. Our kidney also remove acid that is produced by the cells of our body and maintain a healthy balance of water,
salts and minerals such as sodium, calcium, phosphorus, and potassium in our blood. Next point is our kidney also make hormones that help control our blood pressure, make red blood cells, and keep our bones strong and healthy. So, according to McClure's magazine, whether you are well or ill, you should know about your kidney. If you are well, to stay well. If you are fit, to get well. And he also asked, do you know what your kidney are for? The answer is they are for filter your blood in your body. So, as the conclusion for my point, the kidney is one of the most important organ in our body with its function that can make our body stay fit and healthy. The care of kidney should be emphasized for make sure we can enjoy our daily life smoothly and healthily. So I will pass to the next presenter, Karuni Saizati, for the second main point.
Okay, thank you, Hafsa. Okay, let's move on to the next point, which is the urinary system parts and function. The urinary system function is to filter blood and create urine as a waste byproduct. The organ of the urinary system include the kidney, renal pelvis, ureters, bladder, and urethra. The kidney and urinary system helps the body to eliminate liquid waste called urea and to keep chemicals such as potassium and sodium and water in balance. So what is urea? Urea is a waste product that is excreted by the kidney when you urinate. Urea is produced when food containing protein such as meat, poultry, and certain vegetables are broken down in the body. So it will be carried in the bloodstream to the kidney where it is removed along with water and other waste in the form of urine. As you guys can see, there are two ureters, so each of them attached to each kidney. So this thin tube of muscle that connects your kidney to the bladder and carry urine to the bladder. So our urethra is about 10 to 12 inches long in the average adult. So after ureter is a bladder. So this triangle shape is located in our lower abdomen. So it is held in place by ligaments that are attached to other organs and the pelvic bones. The bladder walls relax and expand to store urine and contract and flatten to empty urine through the urethra. So furthermore, the typical healthy adult bladder can store 2 cups of urine for 2 to 5 hours. The nerve in the bladder will alert a person when it is time to urinate or empty the bladder. So lastly is the urethra. So this tube located at the bottom of the bladder that allows urine to exit the body during urination. It also allows urine to pass outside the body. So in conclusion for my main point, so we already know a little bit about what the kidney is in terms of its function, urinary system part, and how it works, and also the relationship of the kidney with the urinary system. So that's all from me. So I will pass to the last presenter, Muhammad Alif Hakimi.
So thank you to the second speaker, Mr. Izzati. So hi everyone, my name is Muhammad Ali Fatimi. As a guest speaker or last speaker, I will talk about the causes and failure of kidney. So what is the kidney failure? Okay, kidney failure occur when your kidney can don't work as well as they should. So the kidney failure, the kidney can be damaged by the physical injury or disease such as the diabetes, high blood pressure, and other disorders. So, so the kidney failure occur when your kidney loses the ability to sufficiently filter the waste product from your blood. Okay. People who are the most at the risk usually have one or more causes such as lost blood flow from to your kidney and urine elimination problem. So next, I will explain to you the type of causes which are first loss of blood flow to the kidney. So sudden loss of the blood flow to the kidney can be from the kidney failure. The condition that cause loss of the blood flow, such as the heart attack, dehydration, and liver failure. So it will block your blood flow to the kidney. Okay, next causes is the urine elimination problem. Urine elimination problem occur when your body can eliminate the urine. Okay, when your body can eliminate the urine, the toxin or the waste product will clot in the kidney and apa tu? And overload the kidney. So when urine can eliminate, the waste product will clot in the kidney and make someone hard to please. Some cancer also can block the way of the urine. So in addition, I will talk about the type color of the urine. So first color is the pale yellow or clear. Okay, pale color or this color show you are well hydrated, and that means you are healthy, stay healthy. And the second color is the dark yellow. This color show you are dehydrated and you need to drink more water for avoid the dehydrated in your body. And the last color is pinkish or red. That means there is a blood in your urine. So when someone has the blood in the urine, someone have a possibility for facing the kidney disease. Okay, so in conclusion, we know that the kidney disease does not only come from the unhealthy diet, but the other disease such as the diabetes, okay, high blood pressure, and the others also can give a bad effect to our kidney. So that's all from me. That's all from us. Thank you. So any question?
Do you hear me?
Yes,
Yes.
yes, I'm here.
Okay. My question is, what are the common causes in the kidney?
Okay, thank you, Siti Aisha. Okay, I will answer your question. So the common causes of kidney disease such is, for example, is high blood pressure, diabetes, and obesity are the most common causes of kidney disease. That's one of
Any
the.
question?
Hi, good morning, everyone. My name is Adiba from BUTGA. I want to ask a question. My question is, urine is made in the kidney?
Thank you, Adiba, for asking. Yes, urine is made in the kidney. Each day, the kidney filter to 150 quarts of blood and produce 1 to 2 quarts of urine, which is composed of body waste and extra water. Is it clear?
Okay, it's clear. Thank you, Sri Afsa.
Okay, thank you,
Good
Adiba.
explanation.
Invitation. So that's all from our group. Thank you.
Thank you.
So
Thank you. So next,
I will pass the next I will pass to the next group to present effect food consumption on health.
Hello group. Group 5, can you stop sharing the screen? Thank you.
Faye, can we start?
Yes. Okay. Good morning to my lecturer, Miss Lee Yong Yong, and my BU and BFN friends. And today we would like to present about the impact of the food consumption on health. And I am Lai Fong Yi from BU 3A, and my group mates, Dresa Kacha.
Hi, my name is Teresa.
Hi, my name is Fatina Kila.
Okay. Let us start. Okay, what is digestive system? Okay, digestive system is the system of our organs that are responsible for getting food into and out of our body. And when we chew the food, our mouth will chew the food into the smaller size between before entering the esophagus. And this is the mechanism digestion. After that, the food enter our stomach, which is the chemical digestion. After the food is swallowed, the stomach squeeze the gastric juice, which is hydrochloric acid in pH of 2 to 3, to break down the food proteins. Next. Okay, why do we need food? Every day we eat the food, and do you think that why do we eat the food for what purpose? Okay, number first. Okay, food is converted by oxygen into energy for our body. When we can say that we consume the food for keeping our body to have energy to breathe, to work, and so on. And secondly, food helps us to maintain our strength and fitness. Thirdly, we need food to promote a healthy immune system for our life. And next, let us see. Um, if we are having trouble with heart attack, do you think that you remember what we ate before what we ate for 10 years ago? No, is it? Okay. Actually, we can see that there is a connection between the food and the disease. Next. Okay. The connection between food and disease. Number one, and drinking 8 glasses of water of a day. And as we can know that our body is composed of about 70% of the water. So this is necessary to support us to for the body functions such as digestion, blood circulation, and the to maintain our body temperature. So we are recommended to drink 8 glasses of water a day. So this also can maintain our kidney health. And next, eating habit also relate to our healthy. This is the most important point to connect between food and disease. Okay. Uh, we are recommended we must increase the amount of the plant food such as vegetable, fruit, and whole grain. Because these foods they are rich in fiber, and fiber can make our intestine easy to form the stool. And if not, we will be in the category of constipation. I'm sure that you all must familiar in the constipations, right? And while this constipation will cause the colon cancer, this is how the food and the disease, the connection between the food and disease. And we will see that the increase less cholesterol of daily intake. Okay, let's see. If we take a lot of food with fried food and fast food, and this will cause our the form of the formation of the blood. This is to block our blood vessel to pass the blood. So this will cause us heart attack and stroke. This is the common of the cardiovascular disease. And the lastly, increase the body in high in protein, and protein are the food of the cell, so we must if we don't consume enough protein, so we are prone to lose our hair, muscle sagging. um okay, let me ask the next speaker, Teresa. um uh how does the food impact our health?
Okay. Okay. Thank you for the question. So the food that we eat is, sorry, let me control that. Okay. The food that we eat give our body the information and materials we need to function properly. If we don't get a right information, our metabolic processor suffer and our health declines. If we get too much food or food that we give our body with the wrong constructions, we can become overweight, undernourished, or at the risk the development disease and conditions such as arthritis, sorry, arthritis, diabetes, and heart disease. In short, we eat in short, what we eat is in central of our health, not center of the earth. It's considered in the light of Webster definition of medicine is that the science and art dealing with the maintenance of health and the preventions, alleviations, or cure of the disease. It means food is like our medicine to maintain and to prevent from the disease. Okay, next. The nutrients in food enable the cells in our body to perform their necessary function. This quote from a popular textbook describes how the nutrients in food are essential for our physical functionings. It also nutrients are the nurturing substance in food that are essential for the growth, development, and maintaining of our body functions. Essentials meanings that if the nutrients is not present aspect of function and therefore body health sorry body sorry the therefore human health decline with the nutrients intake does not regularly meet the nutrients need dedicates by the cell activity and the metabolic processes slow down or never stop. In other words, nutrients give our body instruction how to function. In this sense, food can be seen as a source of the information of the body, like I just said in the beginning. So, Fatin, can I ask you, so what is the effect of the what is the effect of the fast food in our body?
Okay, thank you for the question, Teresa. The effect of fast food on our body is number one, the term of fast food generally refer to food that we intend to consume quickly. There are plenty well research evidence demonstrate the various negative health effects of eating or overeating fast food. Fast food is typically very poor in the term of nutrition. Next is okay. There is two term of the side effect. The side effect of on eating fast food on our body. There is two terms. The first one is the short term and long term. For the short term, the side effect is we will increase hunger because studies have suggested that eating high sugar first in our morning will make a person feel hunger because it will rise our insulin, and insulin is our hunger hormone. Number two is water retention. We all know that fast food is a very high level of salt, and salt will make our body, and if food is too salty, then our body need to delight the salt with water, and then we will feel thirsty. The number 3 is craving for high carb of food, because when we eat fast food, it is highly processed, and it will be rapidly broken down, and it will make we will craving for processed food. For the long term is high risk of condition, because and we all know that fast food is very low in nutrition, and and it will place you in the high risk of digestion condition, because sometimes long term will make your insulin resistance increase and make you obesity. Number 2 is lower immunity. In the long term, there is lower immunity that's high effect, because causing increasing inflammation and increasing infection. It will make high rate of cancer and increase risk of allergy. Lastly, obesity. With fast food, we will always feel hungry for carbohydrate, and it's no surprise it will lead to obesity. Next. Okay, the conclusion. We all know that we are eating. If people think about their health, they will not eat genetically, modify their food, and will do their best for the change of their life. And instead of viewing food as enemy, we look to food as way to create health and reduce disease by helping the body maintain function. And it is need just to understand that it's impossible to eat healthy food a few times a month and to think that you will be healthy. It is need to be eaten every day, and after you will see change. You will get stronger health, and you will sleep better, and it will be possible for you to work better. That's all for our group. And is there any question for our topic today?
Sorry, my name is Muhammad Shikar Hakim. Do you hear me?
Yes, okay.
Thank you for the informative presentation. May I ask some question, which is, what is the meaning of nutrition?
Thank you for the question, Shakir. So the meaning of nutrition is defined that the process of taking a food to carry out from different function of body that need for the survival of the mechanism of the organism. Is that clear, Shakir?
Yes, thank you, Teresa.
Oh, welcome. Any question?
Hi.
Hi.
My name is Aina. By the way, thank you for your informative presentation. My question of the day is, should I eat late at night or should I just wait until the next morning?
Faye, I leave it to you.
Can you repeat the question, because my line is suddenly interrupt.
Okay, should I eat late at night or should I just wait until the next morning?
Thank you for your question. In my opinion, if you are hungry, you just eat. But don't overeat, because eating too much before we going to bed can also cause us trouble in dreamland. You know that the dreamland this will affect our sleep quality and lead to poor health. I hope this may question your answer. Your question. I hope my answer can reach to your question.
Yes. Okay. Thank you.
Okay, that's all from our group, group 6. Now, may I welcome for group 7 that what do you know what part or which part of our respiratory system, and let me welcome Hazira and Azra for the next present.
Thank you for
Okay.
Okay, may I just
Thank you
interrupt for
for
a while?
previous
May I
group
just
for
interrupt for a while?
inviting us. Wait, yeah.
Okay, all right. So thank you so much to all the six groups which have presented. Okay, congratulations on doing your best. Okay, so following, we are going to listen to Group 7's presentation before we go for a 15 minutes break. Okay, is that all right? So once we're done with the break, Group 7 will next introduce Group 8. Okay, so you have beautiful slides which are up, Group 7, so
Wait,
all the
yeah.
best.
Okay. Um, First of all, you can see our slide. Okay. Um, Good morning and good morning to Miss Sharon's and BU friends, also BFM friends. Okay, I Azra Shakira binti Azmi and my partner here is Hazira from Group 7. We will present about part of respiratory system. Okay. First of all, our introduction. Our cells need oxygen to survive. Let's understand the human respiratory system. Inhale and exhale together are also known as a breathing. Okay, we breathe in oxygen which move to the lung through the respiratory tract. Through the lung, it goes to entire body and return, the metabolic waste such as carbon dioxide from cell is removed out of the body. The main organ of the respiratory system is the lungs. Other respiratory system wait. Other respiratory organ include the nose, larynx, pharynx, trachea, and bronchi. Okay. Uh, Nose. Breathing starts with your inhale air with the nose. It is the structure present between the eyes. It has two cavities separated by the cartilage. It is the passage for the air to move inside. It has the presence of the mucous membranes with smaller hair which prevent the dirt from going inside. Okay. Uh, now let's we understand about the pharynx and larynx. It is the part of the throat and present at the back of the nose and nasal cavity. The pharynx is part digestive system as well as the respiration as well as the respiratory system because it delivers the food to the esophagus and air to the larynx. Okay, and now from the pharynx, the air moves to the larynx. Larynx, also known as a voice box, is present at the top of the neck. Larynx is the top part of the air only pipe. This short tube contains a pair of vocal cords which vibrate to make a sound. Okay. Next, now I will pass to the next presenter, Hazira, to explain more about part of respiratory system.
Okay, thank you, Azra, for your invitation. Okay, so we start from trachea. Okay, move to the next slide. Okay, trachea, or we call it windpipe, is a cartilaginous tube that joins the pharynx and larynx to the bronchi of the lungs. Okay, now let's understand about the primary organ of the respiration. Okay, move to the next slide. Okay, we start from the trachea. Okay, we start from the trachea. The air gets passed into the left and right bronchi. Okay, did you see the picture? Okay, we have the bronchi over there, which is bronchi is a part that inside of the lungs. Okay, the lungs are pair of spongy that air-filled organ located on either side of the chest inside the rib. So when the air gets past the bronchi, then from the bronchi it will go to bronchiole until the air will be reached at alveoli. Okay, alveoli is the end of the bronchi. So we know that the end of the bronchi is the alveoli. So alveoli are the basic structure present in the lungs for gases exchange. So in this alveoli, make a process exchange from oxygen to carbon dioxide. Okay, for your information, the alveoli bag has many blood vessels on the outer side, which is filled with deoxygenated blood. Okay, what is deoxygenated blood? That the condition blood low in oxygen and high in carbon dioxide. When the air gets filled into the alveoli bag, the deoxygenated blood will take up oxygen. So, from the alveoli, the blood that full of oxygen will be sent to our body. Okay, so we get the oxygen from the alveoli blood. So for your information, that number of alveoli reach until 600 million in our body. Okay, there's a lot of alveoli in our lungs. So we move to conclusion in our part for part in respiratory system. Okay, in conclusion, we already know that the respiratory system in our life, which is the system, is very important in our body, such as our brain. Our brain is important in our body. So this is the second part that most important because without respiratory system, we cannot breathe usually right now. Okay. Other than that, we also need to know that the alveoli are the part of gases exchange in our lung. So without the alveoli, we cannot exchange from the oxygen to carbon dioxide, and from the carbon dioxide to oxygen in our body. Okay, and the last one of our conclusion, to protect our lung, we need to avoid ourselves from something that can harm or damage our lungs, such as smoking, vaping, or other else. Okay. Move to the next slide. Okay, this is we take just one quote from Emil Emil that what oxygen is to the lung, such is hope to the meaning of life. So just protect our lung, like we protect our hope to future. Okay, so that's all from us. Okay, now question season, Q&A season. So if any question you can ask. Any question about part of respiratory system?
Hello.
Oh yes.
Hello, hello, my name is Nur Safia Zawana.
Okay.
Thank you for your speech. I want to ask you a question, which is are both lungs the same size?
What? Please repeat.
Are are our both lungs are
Yes.
the same size?
Okay. Thank you for the question. Are our lung it's same size? Okay. Because we know that the lung have two, one on the left and one on the right. But do you know, friends, it turns out that the lungs on the left are smaller than the right because the left lung should share a place with the heart. So it fits snugly in the chest cavity. The lungs are placed near to the heart and also has a purpose. Okay, the purpose is in order to work well together and what can be protected and surrounded by ribs. Okay, so that's my answer. So our lung is different, not the same size.
Okay, another question.
Okay, thank you for the informative presentation. So may I ask, uh, what is the main organ of respiratory system?
Okay, thank you, Vicky, for the question. The primary organ of the respiratory system are the lungs, which carry out this exchange of gases as we breathe. That's clear, Vicky?
Is it clear of our answer?
Okay, that's all from us. Thank you.
Okay, thank you, Group 7, and thank you to the rest of the first half of the group for all your wonderful presentations. Okay, we will now go for a 15 minutes break. Let's see. Okay, and come back, let's say 10:30 in the morning. Okay, 10:30. All right, so we will now go for our break and come back. Oh, 15 minutes will be, okay, 10:35. Okay, we now go for a break and come back at 10:35, and we will begin with group 8 on respiratory system. Okay, so group 7, please don't forget to introduce group 8. All right, so if all of you have actually stayed tuned to watch all the presentation, you will notice that all the presentations from the medical electronic students have one thing in common, which is all hovers around the topics on health. Okay, that is because we have tied a partnership with their department, okay, for all these students to present on anatomy and physiology. Okay, so following that, you will still hear from another 1, 2, 3, 4, 5, 6, okay, 6 more groups, okay, on health as well, on anatomy specifically, and we can't wait to see what the others will bring in for us. Okay, so enjoy your break, everyone.
Thank you,
Okay,
Miss.
thank you, Miss.
Thank you, Miss.
Hello, hello. Test, test. Tes,
Gagal
tes.
mau nak muncul.
Tes, tes.
Okay, we're now back to our next half of the presentation for BEU 3 class. All right, so let's continue. Group 7, would you like to introduce group 8? Okay, take it over.
Okay, Miss. Okay, guys. Hello, friends. So we continue to our presentation, which is the title "Same Like Us," but maybe a lot of um, things that you can learn about respiratory system. So I call for Fikri and Amir to present right now.
Okay, thank you for group 7. I want to say. Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Fikri bin Anwar and my
And
partner.
my name is Amir Aizat bin Abdul Wahid.
Okay. Today I want to share with you one of the most system in the body of human. Can you guess that? That was respiratory system for human. In life, we have many respiratory systems, humans, animal, plants, but me and my partner want to focus for the respiratory system of human. Before we go to the process of respiratory system, I want to share you a basic function of respiratory system. First, to provide oxygen to the bloodstream and remove carbon dioxide. It means the body needs oxygen and make the carbon dioxide. The body didn't want carbon dioxide. So the respiratory system is action to take the oxygen and remove the carbon dioxide. Second is control acid base balance. In life, in the blood, we have lot of acid, lot of bacteria, and lot of water. So to control it, oxygen is most control the basic base. Second, the third is control the blood pH to not too high, not too low. So oxygen is control the basic blood pH. Now they have two process respiratory system. There is two: inhalation and exhalation. Inhalation is you take the air come to the body. Exhalation is you take out the air out of the body. Before I go to the inhalation, I want to share you who is control the respiratory system. Respiratory system controlled by 2 points. First point and medulla oblongata. Okay, this picture show to you the brains that have many types. First, the bigger one is fourth brain, and the fourth brain is fourth brain is the control the what you can see to analyze what you hear, analyze what you want to talk, analyze what you want to do anything. Second is hand brain. Hand brain is control the balance your body. And the third one is medulla oblongata to control unknown action. Uh, Example, respiratory system, breathing. So adjust the rate of deep and breathing content of oxygen carbon dioxide level. Of this connection of the hand brain stem, hypothalamus limit system and signal to respiratory control the center. This is a process of inhalation process. First, during the inspiration, when you breathing, can you see my hand? When you this is your imaging, this is your rib. When you doing inspiration, intercostal is here, is constant and external is relaxed. So the rib out and from this like this, from this like this, and the diaphragm is goes down So many value of in this. If so many oxygen can come in to the respiratory, come into the lung. So the difference of pressure in and out, so so the air come into the lung. Okay, this is the process. Air flow from the respiratory system. The air come to the mouth, and something comes to the mouth. Why something comes to the mouth? Something. So for example, when we after we run, the body needs some air to relax the cell, to relax some muscle. So the body needs some oxygen. So the lung must to make a lot of oxygen. So we for the oxygen can come into the mouth through the trachea and bronchus, and then bronchial, and the at the end of the alveolus. In alveolus, we can see a lot of respiratory system. Lot of capillary. This 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 place is the exchange or transport oxygen to the blood and carbon dioxide to the outside. Then I give to my partner to share for information about exchange or transport the oxygen in the blood.
Okay, thank you, Fikri. I will continue the slide. Gas and exchange transport. So how it works? Gas exchange take place in a million of alveoli in the lung and the capillaries to envelop them. Inhale oxygen move from the alveoli to the blood in the capillaries. Carbon dioxide move from the blood in the capillary to the air in the alveoli. Alveolar gas exchange. The loading of oxygen and the unloading of carbon dioxide in the lung. During gas exchange, oxygen move from the lung to the bloodstream. At the same time, carbon dioxide passes through from the blood to the lung. This happens in the lung between the alveoli and a network of tiny blood vessels called capillaries, which are located in the wall of the alveoli. Uh, Oxygen is carried in the blood bound to the hemoglobin 98.5% and dissolved in plasma 1.5%. Carbon dioxide is transported in the three forms. The first one is carbonic acid. 90% of carbon dioxide react with the water to form carbonic acid. The second one is carbonian compound. 5% bind to the plasma, protein, and hemoglobin. The lastly is dissolved gas. 5% carry in the blood as a dissolved gas. Okay, next slide. Okay, systemic gas exchange. So how it works? Gas exchange occur in alveoli so that oxygen is loaded into the bloodstream and carbon dioxide is unloaded from the bloodstream. Afterward, oxygen is brought to the left side and of the heart via the pulmonary vein, which pump it into systemic circulation. So this is two process involved in this carbon dioxide loading, the handle effect. The lower the partial pressure of oxygen and saturation of it in hemoglobin, the more carbon dioxide can be carried in the blood. The second one is is oxygen unloading from hemoglobin molecule. So this is the process in the picture that show. Next slide. So exhaling process. So how it works in exhaling? the diaphragm moves upward and the chest wall muscle relax, causing the chest cavity to get smaller and push out of respiratory system through nose and mouth. Every few seconds, with each inhalation, air fill a large proportion of the million of alveoli. So the internal intercostal muscle contract. Due to the contraction of the internal intercostal muscle, hip are pulled back to their normal position. The muscle of diaphragm relax and come to the original dome shape. As a result, the size of thoracic cative, cavity decrease and the size of lung also decrease, due to which the air pressure increase in the lung. In order to equalize the air pressure, air is expelled out from the lung to the atmosphere through the respiratory tract. The smoking and respiratory disease. What are the risks linked to the smoking? Smoking increase the risk of lung disease, include lung cancer, but they also increase the risk of the illness such as heart disease, stroke, and mouth cancer. Risk from smoking as they related to the lung disease include the following: chronic obstructive pulmonary disease (COPD). This include chronic bronchitis. This is a long-term chronic inflammation of the large airway bronchi. Symptoms include coughing, mucus over a long period. The second one is emphysema. This chronic lung condition affect the air sacs in the alveoli in the lung. Symptoms include shortness of breath, coughing, fatigue, sleep, and heart problem. Weight loss, and depression. Next slide. That's all from us. Any question?
Hello.
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 My name is Nur Safia Zawana. Thank you for your informative speech. I want to ask you a question. How to avoid fluid in lung?
Okay. How to avoid fluid in lung? The first thing, avoid shower at night, because at night the temperature will drop and your body will produce uh, heat, and it can cause a vapor in your lung. The second one is avoid smoke or vape. That act is dangerous because it can cause lung cancer. And the third one is get regular exercise, eat healthy food, and lastly is maintain a normal weight. Another question?
Question?
Any question?
Any question?
Sorry, I have one more question.
Okay.
Can we live with one lung?
Oh, thank you for the question. Yes, for me, we can live in one lung, but better can, because the lung is perfect too, because the cell in the body needs a lot of oxygen. If one lung, I don't know how the pressure of the one lung is to take a lot of oxygen, to work a lot of work to give the oxygen to all the body. So I hope it's better two learn than one learn. If not, what can we do? That's all. Any question?
Thank you, presenter.
Okay, thank you.
Thank you for everyone who listened to my good presentation. Before that, do you want to know about the cell? About the cell is very important also very important. So I give you the next group from the group 9 to present about the cell. So next group. Thank you.
Thank you.
Thank you, Fikri.
Thank you, Group Fikri.
Okay. You ready, guys? Daniel, Mustafa?
Yeah.
Okay.
Ready.
Free for the good presentation. A month ago, Madam Masarah, which is my anatomy lecture, give us task to research some case study, and my group doing some research about cell. Coincidentally, Ms. Sharon also give us some tasks about informative presentation related to our anatomy subject. After all of us discuss what are our topic, and we agree to choose cell as our topic. Good morning to Ms. Sharon and our fellow friends. What is cell? Cell doctrine states that all organism are composed of similar unit of organization called cell. The cell is the smallest unit of life. The cell was discovered by Robert Hooke in 1665. He remarked that it looked strangely similar to cellula, a small room which monk inhabited, thus deriving the name. However, what Hooke actually saw was a dead cell wall of plant cell, which is cork as it appears under the microscope. There are four main types of cell. The first one is epithelial cell. The second one is nerve cell. The third one is muscle cell, and the last one is connective tissue cell. We're going through the from the first cell, epithelial cell. These cells are tightly attached to one another. They cover over the interior of hollow organ like blood vessel or digestive organ, or else from surface from things like our skin. There are dozens of types of epithelial cell. Without epithelial cell, you will not have skin to protect your body from injury. Okay, we move for the next one is nerve cell. Nerve cell, these cells are specialized for communication. They send signal from brain to muscle and gland to control their function. For example, if we touch a hot water and we suddenly remove our hand, that is the response. Part from our body that touch the hot water will send signal through the cell to our brain. That's why we suddenly remove our hand. They also receive sensory information from the skin, eyes, and ears, and send all those information to the brain. There are dozens of variety of nerve cells in our body, each with their own shape and function. Okay, that's for nerve cell. We move to the muscle cell. These cells are specialized for contraction. Without muscle cell, you will not able to move. There are three kinds of muscle cell as we see at the picture. Okay, the first one is skeletal muscle. The second one is smooth muscle, and the last one is a cardiac muscle. These cells are pulled and tugged on bone and tendons to produce motion. They also form a thick outer wall to hollow organ like blood vessel and digestive organ, and can contract to regulate the diameter of this hollow organ. Okay, we move for the last one, which is connective tissue cell. These cells provide structural strength to the body and also defend us from foreign invader like bacteria. Two types of cell, which is the first one is fibroblast and fat cell, are native to connective tissue. Other cells migrate into the connective tissue from the bloodstream to fight disease. Special types of connective tissue, which is cartilage and bones, are designed to be stronger and more rigid than most connective tissue. What is tumor disease? We will see the definition of tumor from Muzaffar. Welcome Muzaffar for the next presentation.
Okay, thank you, Shakir, for your part. For my part is the disease of cell that I choose is a tumor. What is a tumor? A tumor is an abnormal lump or growth of cell. When the cell in the tumor are normal, it is called benign. Something just went wrong and they overgrow and produce a lump. When the cell are abnormal and can grow uncontrollably, they are called cancer cell, and the tumor is also called malignant. There are two types of tumor. The first is benign tumor and second is malignant tumor. For benign tumor, if the cell are not involving cancer, the tumor is called benign. It won't invade nearby tissue or spread to other area of the body. A benign tumor is less worrisome unless it is pressing on a nearby tissue, nerve, or blood vessel and causing damage. For malignant tumor, a malignant means that the tumor is made of cancer cell and it can invade nearby tissue. Some cancer cell can move into a bloodstream where they can spread to other tissue within the body. Cancer can occur anywhere in the body, including breast, intestines, lung, blood, and skin. For example, the breast cancer begin in the breast tissue and may spread to the lymph node in the armpit if it not caught early enough and threatened. One breast cancer has spread to the lymph node, the cancer cell can travel to the other area of the body like the liver or bones. For the symptom of the disease is most patients with a bone tumor will experience pain in the area of the tumor. The pain is generally described as dull and itchy. It may or may not get worse with activity. The pain often awakens the patient at night. Although tumors are not caused by trauma, occasionally injury can cause a tumor to begin hurting. Injury can cause a bone weakness by tumor to break, leading to severe pain. Some tumor can also cause fever and night sweat. For the diagnosis, if a suspect that you might have a bone tumor, see your doctor as soon as possible for diagnosis and treatment. The doctor will collect the details, information about your medical history. Be sure to include any medication you take, any history of tumor or cancer that you and your family member may have had, and the symptom you are expressing. And your doctor will also perform a physical exam. And your doctor will probably obtain X-ray for further information. Each type of tumor can exhibit different character on X-ray. In other cases, it may be difficult to tell what kind of tumor is involving, and additionally imaging studies such as MRI. MRI is magnetic resonance imaging, or CT scan, that is compute tomography could be called for. For the treatment, we have two treatment of benign tumor and treatment of malignant tumor. For treatment of benign tumor, in many cases, benign tumor can be close monitored with no immediate treatment. Some can actually disappear over time. This is particularly true for some benign tumor that occur in a child. Other benign tumor can spread. They can sometimes be treated effectively with medication, or your doctor may recommend removing the tumor. The second is treatment of malignant tumor. If you are diagnosed with malignant bone cancer, your treatment team may include several specialists. Your team of doctor will aim to cure the cancer and preserve the function of your body. The treatment plan we often combine several methods and depends upon various factors, including whether the cancer is localized or has spread. Thank you. For my part, I will give my part to my next partner, that is Muhammad Daniel.
Hi guys, thank you Muzaffar. With me, I'm gonna talk about plant cell. What is plant cell? Plant cell are the basic unit of organism of the kingdom Plantae. They are eukaryotic cells which have a true nucleus along with specialized structure called organelles that carry out different function. For the first one, we go for the plant cell have a special organelles. Plant cell have a special organelles. They have a special organelles called chloroplast, which create sugar via photosynthesis and also keep the plant green in color. So chloroplast makes every plant green in color. Next slide. Second one is differentiate from the cells of other organisms. What makes plant cell different from the other cell is they have one cell that are not found in other organism cells, which is cell wall. This provides structural support for the plant to grow up and also maintaining the shape of the plant. We go for the next slide. Cells use carbon dioxide and they release oxygen. Plant cells have uh, they have a photosynthesis. So the cell will use the carbon dioxide and release the oxygen. At the same time, chloroplasts are organelles that are crucial for plant for this function. Move on to the next slide. Plant cell also considered as an autotrophic. This is because plant cell they produce their own food. Not like the other cells, they need from the other sources for the food, but different for the plant cell, they make their own food by the process of photosynthesis. As a conclusion, cells are the basic building blocks of all living things. The number of cells in plant and animals varies from species to species. Cells of various types have different function because cell structure and function are closely related. Human contains somewhere around 40 trillion cells. The human brain accounts for around 80 billion of these cells. Disease caused by cell can be avoided by keeping healthy lifestyle, proper diet, go to screening program, and etc. So our advice is keep healthy, guys, and mind your food intake, and that's all from us. Thank you.
Okay, we open for Q&A question.
Hello.
Okay, I'm here. You.
My name is Muhammad Iqmal from BEU. Thank you for your informative presentation about cell. I have two questions. The first one is, can a begin tumor turn a malignant? And second question is, what is the biggest cell? Thank you.
Okay, thank you, Iqmal.
Okay, thank you, Kimal, for your question. The question is, can a benign tumor turn malignant? For the answer is some type of benign tumor only very rarely transform into malignant tumor, but some type, such as adenomas in the colon, have a greater risk of transforming into cancer. That is why polyps, which are benign, are removed during colonoscopy or removing them in one way of preventing colon cancer.
Okay, for the second question is, what is the bigger cell? Cells are different shape and size. Different shape and size are due to different function performed by different cells. The largest cell is ovum in human body. The ovum, also called egg cell, is a reproductive cell in female body. Ovum is 20 times bigger than the sperm cell. The smallest cell is microplasma. It is about 10 micrometer in size, and the longest cell is a nerve cell.
Did you get the answer, Iqmal?
Yes. Thank you for answering my question.
Okay, thank
welcome,
you.
Thank you for asking. That's all from us. Daniel?
So we're coming for the next presenter with the topic of blood.
Thank you.
Thank you.
All right. Can you see?
Yes.
Yes.
All right. Okay. Assalamualaikum warahmatullahi wabarakatuh, and very good morning to our beloved lecturer, Ms. Sharon, and to my fellow friends. Today, we will talk about blood, or specific topic of our speech is let's get to know our own blood. Before that, I have to introduce our group, which is me is Muhammad Iqmal Biramli, and my partner is Muhammad Lokman Mijakaria.
My name is Lukman.
Okay. Okay. Have you wondered why we choose this topic? It is because for me, this is an interesting topic to discuss, and we also can relate to our own body. Without wasting our time, let's dive into our topic today. Please lend your eyes, ears, and 200% of your concentration during this 50 minutes of speech. Okay. In our modern society, we have all the access like our own smartphone and high-speed internet connection to do our own research to know about human body, especially blood. Today, let me and my partner Lokman share some important knowledge about blood in our body. Before we dig deeper in our topic today, let's know what our blood is made of. Blood is combination of a plasma and cell that circulate through entire body. It is a specialized bodily fluid that supplies essential substance around the body, such as sugar, oxygen, and hormone. It also removes waste from the cell in the body. Blood is most liquid, with numerous cells and protein suspended in it, making blood thicker than pure water. The average person has 5 liters, which is more than a gallon of blood. Okay, now we already know what our blood is made of. Next, I will share with you fast fact about blood. Our blood carry oxygen and nutrition to all the cells in our body. Blood cells also fight infection and control bleeding. Most of cells are made in our bone marrow. They are constantly being made and replaced. How long a blood cell lasts before being replaced is called lifespan. Our blood is made up of 4 parts. First part is plasma, or scientific name is plasmacyte, which is constitute approximately 55% of blood fluid in human. Plasma is 92% of water, and the content of the remaining 8% include carbon dioxide, glucose, hormone, protein, mineral salt, fat, and vitamin. The remaining 45% of blood mainly consists of red and white blood cells and platelets. Each of these has vital role to play in keeping the blood functioning effectively. Plus help move water, nutrition, mineral, medication, and hormone throughout our body. It also carries waste product to our kidney. Then our kidney filter out the waste product from our blood. Plasma is made of water, protein, lipids, which is fat. It carry water, fat soluble nutrition, and other substance to and from the different organ. Okay. Second part is platelet, or scientific name is thrombocyte. Platelets are small part of cell. These interact with clotting protein to prevent or stop bleeding. There should be between 150,000 and 4,000 and 4,000 platelet, 400,000 platelet per microliter of blood. They make up a very small part of our blood, which is less than 1%. Lifespan of platelet is about 9 to 12 days. Okay, the next knowledge I will pass to Lokman to give information about blood.
Okay, thank you, Kamal. And right now, I will continue to the third part, which is red blood cell, or its scientific name is erythrocyte. Okay, they are shaped slightly indent, flanted disc, and it function as to transport oxygen to form the lungs. Okay, inside the red blood cell, we have as function to retain the oxygen until it arrive to its destination. Okay, the lifespan of red blood cell is about 4 months. and our body keep replacing them regularly. Okay, amazingly, our body produce around 2 million blood cell every second. The expected number of red blood cell in a single drop or microliter of blood is about 4.5 million to 6.2 million in a man, and 4.0 to 5.2 million in a woman. Okay, for the last part is white blood cell. Okay, or its scientific name is leukocyte. Okay, like white blood cell make up less than 1% of our blood content, and they are vital defense against the disease and infection. Okay, the normal range of blood number of white blood cell in and 10,500. Okay, lower and high level of white blood cell can indicate infection and can cause us disease. Okay, next. Next. Okay, the next one is function of blood cell. Okay, like a car that function to bring us from our uh, point right now, that is point A, and bring us to our destination, point B. Same as blood cell. They function as a transport that carry oxygen that we inhale into our body, and send the oxygen to other cell of our body. Okay, other function of blood is providing essential nutrient to cells, such as amino acid, fatty acid, and glucose. Removing waste material like carbon from infection and foreign bodies through the white blood cell. Okay, next, transporting hormone, one part of our body to another, transmitting message and completing important process. And lastly, regulating acidic pH level that and our body temperature. Okay, another important function of the blood is function as the blood protective against disease. White blood cell defend our body against infection, foreign material, and abnormal cell. Okay, the platelet of our blood cell in our blood enable the clotting and coagulating of blood. When we bleeding, the platelet group together and create a clot. The clot became scrap and stop bleeding, as well as helping protecting the wound from get infection. Okay, next. Categorize blood based on the presence and absence of certain antibodies. The grouping intake into account antigens on the surface of the blood, antibodies and protein plasma that alert in immune system to presence of a potential harmful foreign substance. The immune system will attack the threat of the disease infection. Okay, and antigens are protein molecule that on the surface of red blood cell when giving or receiving organ donation or blood transfusion. Our blood group play an extremely important role. Antibodies will attack new blood cells that they don't recognize antigen and can lead life-threatening complication. For example, anti-A antibody will attack cell that have antigen A. Okay, red blood cells sometimes contain other our blood group. Positive blood group means RHD present. Okay, human can have one of the main four group. Each of main group can be RHD positive and negative, which is forming into 8 main categories. The first category is group A positive or A negative. A antigens are found on the surface of blood cells, and anti-B bodies are found in the plasma. Second group is group B positive or B negative. B antigens are found on the surface of blood cell, and anti-A antibodies are found on the plasma. The third group is AB positive and AB negative. A and B antigens are found on the surface of the blood cell, and there are no antibodies are found in the plasma. Okay, the last group is a group O positive and group O negative. Okay, there are no antibody and anti-B, anti-A antibodies are found in the plasma. Okay, next. Okay, this is the blood type compatibility. If a donor is type A, the recipients only they can only give to recipient that have type A and AB. If the donor is type B, the recipient is only the recipient is only B type and AB type. If AB, you can only give into AB blood type. If you are O blood type, you can give into all of the type of the blood. Okay, next. Okay, for conclusion, now let's wrap up our speech. Okay, even though the blood cells are tiny, but it play one of the main role important in our body. They are as important as other long as we live a healthy lifestyle. Okay. Okay, that's all from us today. Okay, thank you. Any question from you guys?
Okay, my name is Muhammad Shakil Hakim from BEU.
Yes, okay.
Yes.
Thank you for the presentation. As you mentioned earlier, red blood cells contain any antigen which is called RHD. For my first question is, what is the meaning of RHD and what is the risk for if we have RHD positive or negative?
Okay, good question. Thank you, Shakil. Okay, what is the meaning of RHD? RHD is stand for rhesus factor. It is an inherited protein found on the surface of red blood cell. If your body has the protein, you are Rh positive. If your blood is lack of protein, you are Rh negative. So Rh positive is the most common blood type. Having an Rh negative blood type is not illness and usually does not affect your life, your health. However, it can affect your pregnancy. Your pregnancy needs special care if you are Rh negative and your baby is Rh positive. So the Rh incompatibility. A baby can inherit the Rh factor from either parent. So I will pass the Lokman to explain the risk of Rh positive or negative.
Okay, thank you, Ikmal. Okay, like Ikmal said just now, if the mother have a Rh negative, it will likely bring the child a risk. Okay, like this. If a mother factor is Rh positive and the father Rh positive, the baby will likely get Rh positive and there is none precaution that is needed. Like negative, mother negative, father negative, the baby will also be negative. Then both of the negative and the father is positive, the child can be either negative or positive. If the child is positive, then the doctor will take precaution to and will inject Rh immune globulin. Okay, that's all I think. Can you understand that?
Yes, thank you.
Okay. I think that's all from us. Okay, thank you. Okay, for the next group, I think is it? Okay, next group is group 11, which is we will get to know the effect of the stress on our body. With the presenter will be Nur Azlina and Nurul Iman, and I will pass it to them. Okay, the stage is yours. Thank you.
Okay, good job, guys.
Okay, thank you for group 10. Okay, let me start. Okay. In this modern world, you know,
Sorry.
oh yeah, it's okay. Okay, all right. So can you start now? Okay.
Why?
Okay, are we ready to go? Yeah.
Can you see my face?
Yeah, you're upside down.
Oh wait, sorry. Sorry, I don't know how to turn the upside down the camera. How did you do it?
Your screen.
How did you do the camera upside down? I tried earlier, it's okay. But now I open the screen, it's all upside down.
Okay. Nah, just proceed. It's
I'm
okay.
sorry. Okay, you may continue, Iman.
Okay. In this modern world where COVID-19 cases are still growing rapidly from time to time, there is concerns people all around the world. People are worried about their family. People are worried about their children, and people also worries about their friends. That is making people stress on how to take care of themselves and how to take care of their loved one. So people are afraid of losing the job. Students are stressed about on how to continue their educations. So this is really stressful on how we need to think about how to survive in this chaotic world of pandemic COVID-19. Good morning to everyone. My name is Nuraima binti Ahmad Mota and my friend
Norazina binti Roslan.
So we are here to inform you about what is the effect of stress on our body. Do all of you know that your body is affected by stress? So we will talk about what stress is, and then we will tell you about the effect of stress on your body. And lastly, we will give you some advice on how to manage stress. According to medlineplus.gov, stress is a feeling of emotional or physical tension. It can come from any event or talk that makes you feel frustrated, feel angry, or feel nervous. Everyone expresses stress from time to time. Anything from everyday responsibility like work or family to a serious life event that can trigger stress, such as a war, a new diagnosis, or a death of your loved one. Some stress can be a good thing that can help us to stay focused. However, if you constantly under stress for a long of period times, you may be experiencing a chronic stress, which has a negative effect on your body. Jim Rohn once says, take care of your body. It is the only place you have to live. So how can stress affect our body? Stress can increase your risk for heart disease. Your body response to stress is supposed to protect you, but if it is constant, it can harm you. The hormone cortisol is released to respond to stress. Studies suggest that the high level of cortisol from long-term stress can increase blood cholesterol, blood sugar, and blood pressure. These are the common risk factors for heart disease. Even a minor stress can trigger heart problems like poor blood flow to the heart muscle. This is a condition in which the heart doesn't get enough blood or oxygen, and long-term stress can affect how the blood clots. This makes the blood stickier and increase the risk of stroke. So next, Azina will tell you more about the effect stress on our body.
Okay, thank you, Nuriman. I will talk about the next rest of effect stress on our body. Okay, stress and strong emotions can present with respiratory symptoms. The respiratory system responds to stress by speeding up breathing. When the body rapidly breathing, hyperventilation, which is abnormally rapid breathing, will occur, causing panic attacks in some people. And so too much stress can thus trigger an asthma attack. Stress can also lead to other chronic lung diseases, such as chronic obstructive pulmonary disease, also known as COPD, which is characterized by a long-term poor airflow. Okay, there is also the effect of stress on the digestive system. If your life is stressful, it can be difficult to lead a healthy lifestyle. Evidence from longitudinal studies suggests that chronic life stress may be linked to overeating. When you are under high levels of stress, the hormone cortisol becomes stimulated. Instead of being physically active to release stress, you may respond by overeating, and eating unhealthy food can lead to weight gain and obesity.
So now that we know what stress is and how much it can affect our body and life, it is good to know on how to manage or how to prevent stress. There is a variety of way that to help reduce stress for different people because it is different for everyone. Everyone have their own method. So we need to find what is the best for it. So Azina, can you give some advice on how to manage stress?
Okay, for me, listening to music and just closing my eyes is a great way to help me relax. Studies has found that listening to music can lower your body's level of cortisol, a hormone that can contribute to feelings of stress and anxiety. According to unr.edu, music can have a profound effect on both the emotions and the body. Faster music can make you feel more alert and concentrate better. Upbeat music can make you feel more optimistic and positive about life. A slower tempo can quiet your mind and relax your muscles, making you feel soothed while releasing the stress of the day. Music is effective for relaxation and stress management. Music is something that almost anybody can access and make it an easy stress reduction tool. Another thing that I find beneficial for exercising, exercise can reduce level of the body stress hormones such as adrenaline and cortisol. A few other ideas could be by eating right, drinking tea, or meditating like doing yoga or breathing exercises. So, in conclusion, if you ask what is the single most important key to longevity, I will have to say it is avoiding worry, stress, and tension. And if you didn't ask me, I still have to say it. This is said by George Burns. As the quote from George Burns said, we should manage our stress because of the effect of stress on our body, where stress can be a silent killer in our life. We know what stress is, how can it affect our body, our health, or our life, so that We need to prevent it before it's too late. Prevention is better than a cure. Last but not least, I hope that all of us have been taking care of your health in this pandemic situation. Okay, that's all from us. Thank you. Does someone have any question?
Okay, hello.
Okay.
Okay, my name is Lukman. Okay, thank you for the awesome presentation just now. Okay, I want to ask you a question that is playing a game is it playing a game or also can reduce stress?
Okay, thank you for the question, Lokman.
Okay.
Is it playing a game can reduce stress? For those people who love playing a game, yes, some games were actually created to help players learn to manage stress more efficiently. While these games are necessary as mainstream, as some of others, they can be especially helpful for stress relief. Some games train players in meditation, while others can even train in biofeedback, helping players build skills in these powerful stress management techniques that can be used in virtually any stressful situation. But we need to make sure we have enough sleep, exercising, and eat a proper meal at least twice a day.
So anyone else have another questions?
Hello, can you hear me?
Yeah, I can hear you. Yes.
Okay, my name is Septianis. Thank you for the informative presentation. May I ask you, what is other effect of stress that we don't know other than you talking about?
Okay, Sophia, thank you for your questions. So the other three effects that I've talked about are heart disease, lung disease, but respiratory system and digestive systems. As we know, actually, stress can trigger so much effects that we may have encountered it, but we just do not aware about it. Stress can trigger these pressures or anxiety. Well, stress effect can make us uh, cannot sleep at night. Also, stress can make for a woman, a menstrual cycle is abnormal. Actually, there is a lot of stress effect that we may know, but we didn't take precaution about it. So that's all I can say about it. So thank you for the questions. Okay, so that's all from us. Next, will we move to the group 12? So I can not wait about the topic is reproduction system. So let's move to the group 12 and their presentations.
Where? Let's see. I see. Ay, di keluar. Yeah. Where's Hansi? Hansi.
I yet.
Okay,
Yeah,
guys. All good?
hmm? Okay, contact Haziq. Can you wait for 5 minutes?
5 minutes is too long.
Oh yeah.
Can I
I
give you
will.
1 minute?
Yes, I will call him.
All right.
Okay, madam.
Oh, okay.
Hello, can you see the screen? The slide. Hello, Assalamualaikum and I have an issue with. Sorry, madam. So I will start the presentation. Assalamualaikum and good afternoon, everyone. And today I want to make a presentation about the speech. And my group mate is Muhammad Aikal bin Abdul Rashid.
Hello.
So today I want to make a speech about the informative speech about the reproductive system. So what is reproductive system? Reproductive system is, let's start by asking what is it? It's basically a system in our bodies that includes our sex organs, certain parts of our brain. You can see the sex organ. You can see the sex organ here on male and here in two place on a female. So this is a system within our bodies allows us to reproduce. It allows us to make babies, and to make babies, what we are doing is combining genetic material from a biological mother's egg and a biological father's sperm to make our offspring. And we typically do this by sexual intercourse. So let's first take brief a look at a couple of most important sex organs that males and the females have in their reproductive systems. So the male have the testes, and these are most important structures, sort of the structures that everything else is built around in male. And that's because the testes produce his contribution to a baby. They make these small mobile cells that carry his genetic material into female to fuse with her genetic material to cause a pregnancy. And these small mobile cells are his sperm. Another important male organ is the penis. And the penis is used to deliver his sperm inside the female mate to increase the chance that it meets her egg. So these are really the major male organs. Now on the female side, one of major organ is the ovary, and she has two just like how male have two testes. And in fact, the ovaries have testes are homologous. They came from the same precursor in development. Now in the ovaries, are responsible for producing the female genetic contribution to a baby, that is the egg. The ovaries talk a lot of different to the testes. In that testes are constantly producing a lots and lots of sperm to the tune of millions per day, whereas the ovaries only release one egg per month. So the next really important female organ uh, so the next really important female organ is uterus, a really thick muscular organ that's capable of stretching out, and that's capable it's actually where the baby actually developing. It's really important female structure are the next really important female structure are the breasts. And breasts are important because they produce milk during the pregnancy, and afterwards there are a process called lactation. Lactation happens due to a series hormones that generally get released around pregnancy. So the breast milk that gets produced can feed and nourish the growing baby, and it actually plays a role in creating a strong immune system for the baby. So we have seen of this major structure for both male and female reproductive system. But is that all of the is that all the reproductive system are? Actually, no. Besides reproducing the sperm and egg, the producing system produce chemicals whose signal have a really strong influence over activities in our bodies. We call these chemical hormones, and because they come from our reproductive system, we refer to them as our sex hormones. For example, the male major sex hormone is testosterone, which is actually produced in testes. Is responsible for many masculine traits, such as body hair and deepening of your voice. Muscle growth and there possibly even a link to level of aggression in males. On the female side of things, the ovary is the primary producer of some major female hormone, like estrogen and progesterone. Estrogen and progesterone play a major role in the timing of egg release from the ovaries. Estrogen is also responsible for the development of a lot of feminine traits. For example, breast development. So this, the making of the sperm and the egg. This is the production of the major sex hormone. So what else does the reproductive system do? For next further about the reproductive system, we'll give to the Haikal to explain more.
Okay, thank you, Amahazi, for the explanation. Okay, what else does the reproductive system do? Okay, well, it does one more really important thing, and that's coordinate the meeting of the sperm and the eggs. And it does that by the male's penis and the female vagina. These two organs are used to ensure that the sperm and the egg meet each other. So the penis actually deposits sperm within the vagina. So that sperm has a better chance of reaching and fertilizing the egg release inside her reproductive trait. Okay, next slide. Okay, so you might be thinking, does the reproductive system do all this stuff on its own? I mean, what tells it what to do? And that's a good question. Okay, the reproduction system is actually controlled by the brain. There's an area in the brain called the hypothalamus that sits just about there on the side of the brain, just about in the middle. and the hypothalamus actually release a hormone called gonadotropin. Gonadotropin releasing hormone of GnRH. GnRH affects another part of the brain called anterior pituitary, which sit right about there, just under the hypothalamus. And anterior pituitary, in response to GnRH release to hormone, luteinizing hormone or LH and follicle stimulating hormone or FSH. And it's the luteinizing hormone and the follicle stimulating hormone that primarily affect the male and female sex organ. So the male's testes and the female's ovary to control their function. Finally, a word on pregnancy. Please like good. Finally, a word on pregnancy. As pregnancy is a huge part of reproduction and certainly the most long-lasting part. So pregnancy results when a sperm successfully fertilizes an egg to create a zygote. A zygote is the first cell in a new organism that has genetic material from both mom and dad. And the genetic material has come from the sperm and the egg that has fused. The zygote goes through a series of development and eventually implants itself within the inner wall of a woman's uterus to grow. So that's in here. Remember that muscular organ we talked about? The third step is what we really broadly call gestation. Gestation is basically the development of the fetus into a baby. So the development of all the fetus organ system, including their brain, spinal cord, lungs, cardiovascular system, their reproductive system, all the system in your body. Gestation reaches the developing infant to be born, and it takes about 9 months when the baby ready to come out of the uterus and into a world of a number of hormonal change that place in the mother's body. This signals her to start getting ready to push the baby out of her body, in other words, give birth to the baby. She then goes through a process called labor, also known as parturition, to give birth to the baby. After the baby, the last step is to give her or him a name. Okay, that's all. Thank you. Do you have any questions so far?
Thank you for the informative presentation. I'm Nur Azlina. May I ask, how do twins happen?
Okay, Azlina, may I answer your question about how do twins happen? So there are two types of twins, identical and fraternal. Identical twins are created when a sperm joins with an egg and the fertilized egg split into. Identical twins with twins look almost exactly the same. They are always either two boys or two girls. Identical twins are more rare and we really don't know why they occur. Identical fraternal twins are more common if two eggs are released and each is fertilized by a sperm. When two babies begin to develop, fraternal twins may look similar like other siblings, but not exactly alike. They can be a boy and a girl, or two boys or two girls.
Okay, thank you.
Hello, Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Abdul Aziz bin Shemat. Okay, I want to ask for Haikal. How long that testes take to take time to reproduce new sperm after the sperm are out from a penis? That's all for me. How long? How time?
How long? How long? What?
Time. Take time to reproduce new sperm after the sperm out from the penis.
How long does it? Oh, Okay, tak ini.
How long does it take for the you mean the question is how long does it take for the sperm to go to the egg, right?
Reproduce new sperm.
Or reproduce new sperm.
How long it does take? Apa cakap? Use sperm to reproduce. For who asked the question again?
Yeah. Okay, I ask again. How long that testis take time to reproduce new sperm?
About your question, your testicle are constantly producing new sperm in spermatogenesis. The full process takes about 64 days. During spermatogenesis, your testicle makes several million sperm day, about 1,500 per second. By the end of the full sperm production cycle, you can regenerate up to 8 million sperm. I hope that can answer your question.
Okay, so 1,500 per second.
Yes.
Okay, all right. Okay, thank you for answer the question.
Okay, thank you.
Okay, any other question? Okay, I think that will conclude our presentation today about the reproductive formative speech on reproductive system. Thank you. That's all from us.
Okay. Yes. Okay, for the next group, they will talk about the health benefits of dark chocolate, featuring Ahmad Rafiki and Safia Hanis. Okay.
Thank you.
Okay, thank you for the previous group. Okay, Assalamualaikum warahmatullahi wabarakatuh, and a very good morning. Yeah, still morning. Okay, good morning to Miss Sharon and to all my fellow fans. Okay, today I'm gonna present about information space about the health benefits of dark chocolate. Before we go any further, I would like to introduce ourselves. Okay, my name is Ahmad Rafiki bin Muhammad Sazali. My partner names Wan Nur Safia Hanis binti Wan Muhammad Zulkarnain.
Alright, for the introduction for this topic is dark chocolate is produced by adding fat and sugar to cocoa. It differs from milk chocolate in that it contains little to no milk solid. Dark chocolate is rich in minerals such as iron, magnesium, and zinc. The cocoa in dark chocolate also contains antioxidants called flavonoids, which may provide several health benefits. Chocolate comes from cocoa, which is a plant with high levels of minerals and antioxidants. Commercial milk chocolate contains cocoa butter, sugar, milk, and small quantities of cocoa.
In contrast, dark chocolate has much larger amounts of cocoa and less sugar than milk chocolate.
Okay, for the first point of the health benefits of dark chocolate is the dark chocolate is very nutritious. Okay. If you buy quality dark chocolate with a high cocoa content, then it is actually quite nutritious. It contains a decent amount of soluble fiber and it's loaded with minerals. 100-gram bar of a dark chocolate with 70 to 85% cocoa contain 11 grams of fiber, 67% of the RDI for iron, 58% for the RDI for magnesium, 89% of the RDI for copper, 98% of the RDI for magnesium. It is also plenty of potassium, phosphorus, zinc, and selenium. Of course, 100 grams is a fairly large amount and not something you should be consumed daily. All these nutrients also come with 600 calories and moderate amount of sugar. For this reason, the dark chocolate is best consumed in moderation. The fatty acid profile of cocoa and dark chocolate is also excellent. The fat are mostly saturated and monounsaturated with small amount of polyunsaturated fat. It also contains stimulant like caffeine and theobromine, but is unlikely to keep you awake at night as the amount of caffeine is very small compared to coffee.
For the second point is powerful source of antioxidants. ORAC stands for oxygen radical absorbance capacity. It is measure of the antioxidant activity of food. Basically, research set a bunch of the radicals back against a sample of a food and see how well the antioxidant in the food can disarm the radicals. The biological relevance of ORAC values is questioned because it's measured in a test tube and may not have the same effects in the body. However, it is worth mentioning that raw, unprocessed cocoa beans are among the highest scoring foods that have been tested. Dark chocolate is loaded with organic compounds that are biologically active and function as antioxidants. These include polyphenols, flavonoids, and catechins, among others. One study showed that cocoa and dark chocolate had more antioxidant activity, polyphenols, and flavonoids than any other fruits tested, which include blueberries and acai berries.
Next, dark chocolate may improve blood flow and lower blood pressure. The flavonols in dark chocolate can stimulate the endothelium, the lining of arteries, to produce nitric oxide, NO. One of the functions of nitric oxide is to send signals to the arteries to relax, which lowers the resistance to blood flow and therefore reduce blood pressure. Many controlled studies show that cocoa and dark chocolate can improve blood flow and lower blood pressure, though the effects are usually mild. However, one study in people with high blood pressure showed no effect. So take all this with a grain of salt.
For the next point is raises HDL and protects LDL from oxidation. Consuming dark chocolate can improve several important risk factors of heart disease. In a controlled study, cocoa powder was found to significantly decrease oxidized LDL cholesterol in men. It also increased HDL and lowered total LDL for those
with high cholesterol, positive free radicals. This makes the LDL particle itself reactive and capable of damaging other tissues such as the lining of the arteries in your heart. It makes perfect sense that cocoa lowers oxidized LDL. It contains an abundance of powerful antioxidants that do make it into the bloodstream and protect lipoproteins against oxidative damage. Dark chocolate can also reduce insulin resistance, which is another common risk factor for many diseases like heart disease and diabetes.
Next, dark chocolate may reduce heart disease risk. The compounds in dark chocolate appear to be highly protective against the oxidation of LDL. In the long term, this should cause much less cholesterol to lodge in the arteries, resulting in a lower risk of heart disease. In fact, several long-term observational studies show a fairly drastic improvement. In a study of 470 elderly men, cocoa was found to reduce the risk of death from heart disease by a whopping 50% over a 50 years period. Another study revealed that eating chocolate 2 or more times per week lowered the risk of having calcified plaque in the arteries by 32%. Eating chocolate less frequently had no effect. Yet another study showed that eating dark chocolate more than 5 times per week lowered the risk of heart disease by 57%. Of course, these 3 studies are observational studies, so can't prove that it was the chocolate that reduced the risk. However, since the biological process is known, lower blood pressure and oxidized LDL, it is plausible that regularly eating dark chocolate may reduce the risk of heart disease.
Okay, the sixth point for this topic is may protect your skin from the sun. The bioactive compound in dark chocolate may also be great for your skin. The flavonoids can protect against sun damage, improve blood flow to the skin, and increase skin density and hydration. The minimal erythritol dose (MED) is the minimum amount of UVB rays required to cause redness in the skin 24 hours after exposure. In one study of 30 people, the MED more than doubled after consuming dark chocolate high in flavonol for 12 weeks. If you are planning a beach vacation, consider loading up on dark chocolate in the prior week and months.
What's happening? Why the pause?
Oh, sorry. Last one is the dark chocolate could improve brain function. The good news isn't over yet. Dark chocolate may also improve the function of the brain. One study of healthy volunteers showed that eating high flavonoid cocoa for 5 days improved blood flow to the brain. Cocoa may also significantly improve cognitive function in elderly people with mental impairment. It may improve verbal fluency and several risk factors for disease as well. Additionally, cocoa contains stimulant substances like caffeine and theobromine, which may be a key reason why it can improve brain function in the short terms.
So the conclusion that we all can get from the health of benefit of the dark chocolate is there is considerable evidence that cocoa can provide powerful health benefit, being especially protective against heart disease. Of course, this doesn't mean you should go all out and consume lots of chocolate every day. It is still loaded with calories and easy to overeat. Maybe have a square or two after dinner and try to really savor them. If you want the benefit of cocoa with consider making a hot cocoa without any cream or sugar. Also be aware that a lot of the chocolate on the market is not healthy too. Choose quality stuff like dark chocolate with 70% or higher cocoa content. You might want to check out this guide on how to find the best dark chocolate. Dark chocolate typically contains some sugar, but the amounts are usually small, and the darker the chocolate, the less sugar it will contain. Chocolate is one of the few foods that taste awesome while providing significant health benefits. You can go shop for dark chocolate at local groceries or online. Okay, that's all from us.
Is there a question? Anyone?
Yeah. Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Abdul Aziz bin Chemat from BEU 3, from group 3. Okay. Actually, my brain cannot think about RDI. It stand for what? So I want to ask for Ahmad Rafiki. RDI stand for what? That's all for me.
Okay, thank you, Muhammad Aziz from Group 3. Okay, RDI stands for Recommended Dietary Intake, and sometimes it refer to recommended daily intake. Is the average daily intake level of particular nutrient that is likely to meet the nutrient requirements of 97 to 98% of healthy individuals in a particular life stage or gender group. Is it I answer your question?
Oh, so RDI stand for recommended dietary intake. Okay.
Yeah.
I understand. Okay, thank you, Ahmad Rafiki, for answer my question.
Yeah, thank you for answering. So there's any?
Hi, my name is Nuriman. I have a question to Safia. So earlier you have mentioned about HDL and LDL in your presentation, but can you explain what is HDL and LDL means for?
Okay, thank you, Iman, for the question. HDL and LDL have different purpose. HDL stands for high density lipoproteins. It is sometimes called the good cholesterol because it carries cholesterol from other parts of your body back to your liver. Your liver then removes the cholesterol from your body, and LDL stands for low density lipoproteins. It's for bad cholesterol. Okay, I hope I can answer your question, Nur Iman.
Oh, okay, thank you for answering. I will keep it in mind. Okay, thank you.
Okay, thank you everyone who asking. I think there's no time to continue. I think that's all from us. Thank you everyone. Okay, we are the last group from BEU class. So next group it will be from the BFM class. Thank you.
Okay, thank you so much. the last group. Okay, that wraps up our presentation from BEU 3 students. So give a round of applause. Okay, thank you so much. Okay.
Congratulations, guys.
Thank you so much for all your wonderful presentations. Okay, so just a little bit of note before we move to the next session. So before moving on to the next class to present, we are just going to take perhaps a 20 minutes break, especially when I need it. All right. But before that, can I just elaborate a little bit? Okay, overall, I feel that BU, you have the flair, but I'm hoping and I'm still waiting to see one with really Okay, and when you're up here presenting, you should be the one who knows best of your content. So if that's the case, then mispronunciation of words, then uh, uncertainty of your content should not be tolerated because you're the master of your content. Okay, I still feel that the whole class lacks enthusiasm in your presentation, and I hope that the following class, okay, will exhibit more energy and more presentation um, when you are presenting. All right, so just a reminder, I'm not going to touch more on the overall feedback because we're going to do that after the next class. Okay, um, just a reminder, for BEU, those who have not submitted your preparation outline and your slides, okay, on Microsoft Teams, please do that. Okay, so group 1, okay. Group 2, you haven't submitted your slides. Group 3, okay. Group 4, no preparation outline. Group 5, slides is okay. Group 6, nothing submitted yet on Teams. Group 7, okay. Group 8, okay. Group 9, no preparation outline. Group 10, okay. Group 11 and 12, okay, nothing submitted yet. And group 13, nothing submitted because I just created the folder I missed out. All right. So for BU, because this is a collaboration with your department for anatomic and physiology topic, okay, especially group 6 on food consumption on health, okay, and group 13 on the health benefits of dark chocolate, you will have to state your purpose very strongly in your preparation outline. Okay, if your presentation were to be presented in your anatomy class, do you think that would be accepted? Okay, so this is a question that you have to think of. And how are you going to make it relevant to anatomy and physiology? Okay, you have to think. I don't know how you're going to do that. All right, and put it in your preparation outline. Okay, so overall, thank you for your presentation. I feel that the strongest purpose that draw me to really want to listen would come from Iqmal's group, because he came up with a very strong purpose statement on why we should listen to the presentation. But the rest, I am still, waving on, why should I listen? I don't have any background and it doesn't interest me on diabetes mellitus. I don't have diabetes, for instance, why should I listen to you? So the purpose is not that strong. When purpose is not that strong, you will lose the touch on being audience centered. Okay, so I think overall a little feedback from BEU class would be this. And I feel that as degree students, you can still ask more challenging questions. Okay, pointer for BFM, I'm expecting more from you. Okay, questions like is it, can, what, okay, those are very low level. But questions like why, how, those are very high level questions, and I hope to expect more of this kind of questions from BFM students. Okay, so BU, wonderfully tried. Okay, um, yeah, and I look forward to your persuasive presentation tomorrow. So since you know a little bit of heads up already on what should go better, then hopefully you will include that in your presentation for persuasive tomorrow. Okay, all right. So it is 12:17 p.m. over here. We shall now break for a 20 minutes break. and we will come back at 12:40. Okay, 12:40 p.m. and we will begin with BFM. All right.
Thank you, Miss.
Okay.
Thank
Thank
you,
you so
Miss.
much. Bye.
Thank you,
Have a good
Miss.
break. Okay. Bye.
Thank you.
Okay.
Thank you,
Okay,
Miss.
Miss.
Sure. Okay. See all of you.
Kansas that were very pleasant today. However, we are looking for a new front to begin to drift south and eastward. The central and eastern parts of Kansas will very probably be cloudy in the morning, and then western Kansas will begin to get increasing cloudiness by tomorrow afternoon. Today, however, very, very pleasant reading. 73 up in the Goodland area, 72 at Garden City, 70 reported by Dodge City and Liberal, 72 over by the good folks of and in the Ponca City Blackwell area, 68 degrees today. Winds southerly at about 15 with gusts of 25 miles an hour. Barometric pressure 30.00 and is rising. And no precipitation. We're about a half inch behind, correction, half inch ahead for the year, and 1 5300ths behind for the year so far. We'll be looking for a little bit of a change tomorrow, and of course the possibility of some scattered showers. Today, of course, there's nothing showing up on the radar. However, the satellite photo was pretty interesting for the western half of the U.S. Rain showers and thunder showers along that frontal system, and that wide band of fairly heavy snows. Now, what will happen each time that you see the frontal system on there, that begins at 6 o'clock in the morning, and then you'll see the cloud pattern move until 2 o'clock this afternoon. So as of that time, of course, the front was way off in the northwest. Now, however, it's moving into the central part of the nation with a couple of high-pressure cells behind it. Cells behind it, and a few pockets of low pressure, and a fairly heavy band of rain showers and snow all the way from the eastern portions of Montana down to western sections of Nevada. And of course the massive high picking up more moist air from the south, bringing it northward. So when the two masses collide over Kansas, we are looking for some precipitation, and we'll talk about that.
Okay, everyone. We are all back to our second half of the presentation by BFM. All right. So thank you so much for still staying tuned to the presentation. Okay, everyone. Okay, looks like the group is ready. So everyone's ready for the presentation? Yeah.
Yes.
Okay,
Yes.
all right. So PFM, I hope you're all geared for this informative presentation and I look forward to what you can do. Okay, so let us now invite the first group from BFM Facility Management class to deliver their informative presentation on how COVID-19 spread all over Malaysia. So perhaps this is a very recent thing and it has been we have been balked by this thing for almost a year and a half already. So do we know enough how COVID-19 spread all over Malaysia? All right, so let us tune in to listen what this group has to say. All right, so to you.
Okay, thank you, Miss Sherry. First of all, I will start. Good morning to Miss Sherry. Good afternoon to Miss Sherry and my fellow friends. My name is Muhammad Shahmi bin Mazlan. As a speaker number 1,
And my name is Muhammad Ikon bin Khairuddin as number 2 speaker.
Muhammad Rashidi bin Rustam. I am speaker number 3.
today we are going to talk about how COVID-19 spread all over Malaysia. Before I start, I want to ask some questions. You have probably heard dozens of news that COVID-19 cases rise increasingly in Malaysia. But do you know how COVID-19 spread among us? Anyone?
No.
Okay. Do you really think if you were close contact with an infected person, something awful would happen? No answer. Okay. Perceived as ferocious and frightening, COVID-19 are people's worst nightmare to encounter. Many people don't realize they have been infected by COVID-19 because the symptoms are just the same as normal fever. COVID-19 has been incorrectly defined by some people who really think that this is just an agenda or conspiracy. Next slide. So you can see there are so many conspiracy around us. So some people incorrectly defined by some, they think that this is just an agenda and conspiracy. So this is for some example. So next, we have been studying an infographic about how COVID-19 spread all over Malaysia. As you can see, this is the statistic about first wave and the second wave of COVID-19 in Malaysia. So for the next 10 minutes, we would like to share important points about how COVID-19 spread all over Malaysia. My research on COVID-19 begins with their history. For the first point, first case of COVID-19 was detected in Malaysia and traced back to 3 Chinese nationals who previously had close contact with an infected person in Singapore on 25th January 2020. As you can see, this is the first start of first wave in Malaysia. So on 4th February 2020, the first Malaysian was confirmed with COVID-19. The 41 years old man had recently returned from Singapore when he started to develop a fever and a cough. He was quarantined at Sungai Buloh Hospital in Selangor. So let's take a look on 6 February 2020. A old female Malaysian was reported positive for COVID-19. How he got COVID-19? It is because that she was the younger sister of the 41-year-old man confirmed as positive with the virus. On 12 March 2020, Malaysia reported its first sporadic case of COVID-19 where the infected person neither traveled to an infected area nor had a contact with an infected person. In March 2020, the number of reported COVID-19 cases grew relatively slowly until a religious event took place at Sri Petaling, Kuala Lumpur, which led to an exponential rise in cases and led to a second wave COVID-19 in Malaysia. Next, I will pass to the next presenter, Muhammad Ikhwan.
Okay, hello guys. I am the second speaker. So I will tell about you guys about how the COVID-19 spread and why is it so dangerous? What is the effect to our economy in Malaysia? So, have you guys any wondered how COVID-19 spread? Okay, it is spread via physical contacts and body fluids such as coughing and sneezing. For example, if you guys go at the crowded place such as shopping mall or in public transport, if there only one person that positive or infected with COVID-19, he or she will make all the people around him as a close contact. So why is this virus COVID-19 is so dangerous? It is because this is a new virus and nobody is immune towards the virus. And to add it up, it also spread so rapidly and swiftly. So this is the symptoms that you will get if you are a positive COVID-19 patient. The first symptom is you will cough a lot, and then you will have a fever, and then you will feel uncomfortable at your throat, sore throat, and lastly the shortness of breath. Other than these symptoms, there are also muscle pain and hard to breathe. Okay, so who is the most vulnerable groups of people towards this virus? The most vulnerable people is elders, children, and pregnant ladies. And then this COVID-19 affected our countries, our Malaysia economies because of this virus is so dangerous. So our government has taken action to implement the MCO, the Movement Control Order towards all citizens. So that means anybody who wants to go outside must have an essential reasons for any urgent things only. So that's make our economy that's make our economy downward spiral because if nobody go outside, so how to roll our money back to buy things or support any local business or anything. So next slide, I will pass the speech next slide to next presenter, Muhammad Rashidi.
Okay, thank you, Ikhwan. Good afternoon, everyone. Ikhwan and Shami has present to you about the first wave and the second wave and how the virus transmit. So I will explain the third wave, how COVID-19 spread all over Malaysia again. Okay, starting from May until August 2020, the number of cases of COVID-19 has decreased, and government implement CMCO and RMCO, which is conditional movement control order and recovery movement control order. But in September 2020, the government made a state elections in Sabah, and as we know, election involve many people to vote, and these people who are involved will be placed in the crowded areas. Next. Okay, so how the virus can be spread? While in the crowded area, not everyone implement SOP, which is there are some people may not wearing a mask and no social distancing between them. Next. Okay, so without being realized, the virus will be spread almost to everyone because they have physical contact and no social distancing. Okay, next. And because of that, many people in Sabah were affected, and the virus spread firstly in Sabah, and after the voting is done, voters from Peninsular Malaysia will go back to their home, and without being realized, the virus spread around Malaysia again. Okay, so that is from me for the third wave, how this coronavirus increase again after we have recovery for a while. Okay, and for the conclusion, everyone knows how this virus spread. So we have to implement SOP in our daily life, which is always wearing a mask and keep the distance between other people. And secondly, we are now at the third wave and of pandemic and has been almost a year. As we know, we started MCO on 18th of March 2020 until now. So it has been almost a year, which is next month. The pandemic or the movement control order will reach 1 year. Lastly, follow SOP to stop the spread of the virus, which is you need to always wash your hands, and you just need to go outside if you are really needed to. So that's all from us. Any questions?
Yeah, I got one question. Okay. Hello.
Who do want to
Can you hear
ask?
me? All right. I am Nurmaira Shafika from BFM.
Oh yeah, I recognize your voice.
Okay. Thank you for informative presentation. May I ask, what do you think? Is it necessary to do election in Sabah, especially during pandemic season? Is it necessary?
First of all, thank you to our to Umaira because she asked a very brilliant question. So, in my opinion, the election at Sabah isn't necessary because they already have their own chief minister that wants the general election, the past general election, the general election 14, if I'm not mistaken. And then if the politicians urge to do that, to do the election at Sabah, so I think they're supposed to use online voting system, such as at Belgium, if I'm not mistaken. So Rashidi or Shami, anyone to any input?
Yes, I agree with Ikwan, which is the election during the pandemic is unnecessary because, as we know, election involve many people. So if there are too many people and they will be placed in, like I said before, they will be placed in a crowded area, and which mean Iquan has explained that crowded area is one of the risks is one of the risks that the virus can be spread without being realized. So Shami, do you have any input?
Yes, I strongly agree with both of you, Ikwan and Rashidi, because it was very unnecessary to do an election during this pandemic outbreak, because people simply, it's hard to follow the SOP rules, such as social distancing especially, and also wearing a mask. So this is will lead to new cases rising, and can the group of cluster in Sabah and also in Malaysia, in Semenanjung. And I think government should implement some new method ways to do an election, such as online voting, postal voting. So there's
Time's up,
other way.
guys. You can wrap up the question.
Okay. Last but not least, we just wasted half of a year to go square back one, to go square back one, and I think all just stay safe and make
Okay.
sure follow the SOP. Thank you.
Stay safe, everyone.
So I hope this will answer your question, okay, Humaira?
Okay, so I will invite the next group to deliver their speech. The next speaker, I guess the topic is about the dangers texting while driving, I guess.
Yeah.
Okay, thank
Okay,
you.
good job. Thank you so much, Group 1. I think we are all headed for a great start. Thanks to all of you. And for everyone's information, the first speaker's name is Shahmi. He is also the winner for Race of Loud Leaders challenge a while
Maman, there you
ago.
go,
All
my
right,
man.
so that's Shahmi. All right, the winner for role. All right, so next to the second group. All right, the screen is all yours.
Okay. All right. Okay. Okay. All right. Good afternoon to Mishrin and everyone. Today I will talk about how dangerous texting and driving could be. So before that, I am speaker number 1. I am Nur Maira Shafiq. Speaker number 2, Anis Sofia binti Muhammad Fuadi. Number 3 is speaker number 3, Afif Farhan bin Adnan. So, okay. Texting while driving has become one of the most popular styles of modern communication for adults and teens. Texting while driving also have, as we know, become the biggest distraction and not only dangerous to everyone, which is most of the car accidents happen for nowadays are happens because of the distracted driver. Okay, hence to reduce the number of car accidents from these cases, Police Diraja Malaysia or PDRM has issued a statement which confirmed that guilty offenders can be charged with texting while driving.
Is everything okay? Okay, timekeeper, just pause the time a while. Is everything okay?
The net problem is.
Internet problem.
Networking
Yeah.
problem.
Can already? Umaira's internet, is it?
Yes, miss.
Okay, this happens. Do you need some time to resolve it? If yes, then I will call group 3 up to present first. Umaira, are you there? Okay, so group 2, we will keep you for the next one. Can we have group 3 now to present? All right, group 3. Okay. Okay, so I know this is the time where it is impossible to travel, right? But nonetheless, let us be informed on the safety procedures during travel. So now I'd like to invite group 3, consisting of Azri, Anas, and Akmal Rizki, to deliver their informative presentation on how to ensure safety during travel. Okay? All right, so group 2, we will get back to you.
Okay, a warm welcome to Miss Sherin and all the audience. Okay, today my name is Anas Batia Bembari and my friend Muhammad Akmal and Muhammad Azri will present to you about safety when travel. So, travel can be a exciting, eye-opening experience. Ladies and gentlemen, sorry miss, can you pause first? I cannot go to other slide.
Oh, okay. What should I do to help you?
Oh, oh okay.
I can, huh? All right.
Yeah,
Okay,
okay.
nice lights, by the way.
Okay.
Okay.
Okay, I start again. Okay, sorry. Ladies and gentlemen, first, please close your eyes. Now, imagine you at beautiful private beach having a vacation. Feel the water touch your feet and warm sand beneath your feet. It's mesmerizing, isn't it? Yeah. Suddenly, you're being ambushed by a group of gangsters blackmailing that they want to kidnap you. Luckily, you see a police officer nearby and you run to them seek for help. But your face turns gloomy again when you know that they are corrupted cops that are also receive bribe from the gangster. And that moment, you know that you're in big trouble. So, why is this happen? That's right. Safety precautions are the most important thing to take consideration when you go travel. So please take your seat and make yourself comfortable. We will give you some tips on how to ensure safety when traveling. So, to ensure you get a quality trip, it starts before you travel. So first of all, do your research. Do research on the current situation in the country you want to travel. Try to avoid these kind of places. Places that are in war or crisis, places that are known as high crime rate, and place that only you know the attraction of the place. It mean like isolated place. Yeah. For example, Jerusalem in Israel, there are several main attractions like Masjidil Haram and Via Dolorosa. This place might be recognized as holy place in the world, but this place also recognized as time bomb, where war can erupt at any time. The second one, Los Cabos in Mexico are recognized as one of the best places to visit in 2020. Warm, dry weather year round and magnificent scenery make Los Cabos one of the leading destination that make you vacation a dream that you will never forget. But you are recommended to delay your vacation if you plan to go to Los Cabos. This is because considering the past recent year, this past recent year, the Baja Peninsula, that the state where Los Cabos added, has suffered from a higher per capita homicide rate than any other region in the world. From Statista.com, Los Cabos lead the ranking of the most dangerous cities in the world in 2020 by murder rate per 100,000 per capita, which is 111.3. In September 2020, a United States tourist was found dead in Ensenada, nearby Los Cabos, a city that same state with Los Cabos. Yeah. So try to avoid traveling to this destination. How to do research about this? You can start your research by visiting the United States of America travelstate.com official website, where they advise which country you can or recommend it to not to visit. It can help you up to date with current issue in the country you want to go. And secondly, do research on transportation. Bear in mind, try not to drive yourself when traveling. This is because you may get behind the wheel in the foreign country without being generally informed of local traffic law. You may not familiar with driving on the left, or you may be driving vehicle that you do not know how to operate properly. This will risk your vacation or at worst, cost your life. Try to use common transportation that people usually use to avoid any fraud. Then do research on schedule to avoid you cannot return to your accommodation. If the transport offer you transportation insurance, take it, as it can cover if anything happen to you, as we cannot predict our future. You can do research by asking your clique that have been there. If they're not, search inside the YouTube, or you also can search in Wikitravel. If you already arrived at the place, ask the staff of your hotel, as they also can offer tips on how to get around the city and what to do while you are there. So you just sit tight and enjoy your vacation trip calmly. And the third one, do research on culture. Learn how to communicate with local people. This to avoid any unpleasant situation where you do think that local culture can accept. Also, learn how to communicate with local. You can do research by watching documentary, learn from YouTube, and you might buy a translation book from a bookstore. This is more preferable, as you can just put it in the pocket and bring it anywhere you go. Like the quote say, when in Rome, do as the Rome did. Okay, thank you. So the second point I give to Azri. I give to Akmal, sorry.
Okay, good afternoon, everyone, and peace be upon you. Now I will present about the tips about travel. Watch out for your personal belongings. For my first point is lock your travel backpack. Okay, lock it, don't lose it. It means padlocks can be indispensable for locking luggage to luggage racks on long train journeys. Locking valuables in safety deposits locker if your hotel has no safe, or even locking hotel room, as is common in South Asia. Bring your own secure padlocks. Combination locks are most convenient, as they don't involve keys you might lose. If you are traveling with a laptop, you might like to invest in a cable lock to keep it secure in public areas. Okay, for the next slide. Next slide. Next slide, please.
Sorry, a little bit lag.
Oh, okay, okay.
It's okay. Continue first.
Okay, for the second point, is always be aware of your valuables. It means be alert for your belongings. Keep your belonging close to you, your shut, and stay alert while you're waiting. Report anyone loitering without good reason to staff or the authorities when you are traveling. And lastly, for my third point, is find secure storage. Find secure storage. Keep your stuff safe in a safe. Many hotel chains include in-room safe deposit box secure with an electronic code as standard. If your hotel room has a safe, use it to stash your valuables when you head out for the day. Passports, any cash you don't need, any jewelry you are not wearing, and any electronic device you don't need with you should all go in here. If your hotel has no in-room safe, ask the front desk if they can hold your valuables in a locked drawer.
Mal,
So
can you please switch on your camera?
yes, uh, that's that's my point for the third point. Next, I will give to my next presenter.
Okay, thank you, Akmal. Can you hear me?
Yes.
Okay. What are the kind things that to ensure safety during travel? First, make sure you are in good health before you travel. Going a road trip in Malaysia is something that we have aside for a few months due to the pandemic situation. Soon, if the interstate travel is allowed in Malaysia, we bet you excited to balik kampung and visit your parent or grandparents again. In the midst of excitement, it is important to note that traveling during the pandemic has changed. We have to practice good hygiene and social distancing when we are out and about. If you are concerned with staying safe on a road trip during COVID-19, we have some tips to help you. So before you're driving, if you are experiencing minor symptoms such as headache, cough, and mild fever, it is best uh, to stay home and self-isolate until you recover, according to the WHO, World Health Organization. You may be excited to meet your parents, grandparents, as well as your niece or nephews, but they are part of the high risk groups that are more vulnerable to getting COVID-19. The high risk groups include senior citizens above 60 years old, as well as anyone with a weak immune system or underlying health condition such as lung or heart disease or diabetes. So for the second point is know your road. Plan where you are going before you leave. Are restriction in place your destination, or do you need to be quarantined if you are arriving from the COVID-19 hotspot? Planning a road trip give you the opportunity to map out of out of the site and attraction you want to see. And during the
3
pandemic,
minutes left.
it is important to find out if these tourist attraction are open for the visitors, and what measures they are have in place to keep people safe. So, in conclusion, uh, if you want to go travel, you cannot avoid this. There is no way to be 100% safe from any trip in any part of life. So that doesn't mean you have to follow these tips. You will have to be safe trip, but we can ensure you when you follow these tips, your chances to experience a good trip is high. Because my teacher always said that risk is unavoidable, but it can be minimized. So that's all from us. Thank you. Any question?
I have a question. My name is Ani Sophia. Can you give some tips for those who travel alone, especially women?
Okay. Good question, Anis. So, okay. Solo travel is the best way for women to explore the world and to become more confident and empowered travelers. There is no doubt solo travel is usually an amazing life experience. However, this doesn't mean that you have to be reckless or do things that you wouldn't do at home. So find a balance between those amazing experience and staying safe is vital. So for the first tip is try to avoid traveling at night. Nighttime can be an intimidating time for travelers in a new area, especially as a solo female traveler. While it is normally fine to visit an area where there is plenty of other visitors, you may want to arrange a taxi back rather than walking back to your hotel. Also, as well possible, try to avoid using overnight transportation unless you are able to secure your belongings, as they also tend to be more prone and to be more prone to crime than traveling by day. Do you get it, Anis?
Yes, thank you.
Okay, welcome.
Okay, you want to know about Eiffel Tower? Stay tuned because next group will speak about the topic. That's all from group 3. Stay safe. Thank you.
Thank you, Group 3. Shall we have Group
Thank you.
2 or Group 4? Group 2, are you ready?
Group 2, Miss.
Group 2, okay,
Yeah.
Group 2, then only Group 4.
All right.
All right, so we will now move back to the danger of texting and driving before we get on to Eiffel Tower. Okay, so let's hear from Umaira and friends. Okay, thanks to Anas and friends for the presentation.
All right. Okay. Sorry for earlier disruption. Okay. Okay. All right. Today, good afternoon, Miss Shireen and everyone. Today I will talk about how dangerous texting and driving could be. But first, my name is Nur Maira Shafika binti Azmi. My next speaker is Ani Sofia, and my third speaker is Afif Farhan. All right. By the way. Okay, as we know, texting while driving has become one of the most style of modern communication for adults and teens, and we know it is a popular among them. So I know how hard it is to put phone down and concentrated on the road. Even for me, sometimes I'm struggling with avoiding distraction while I'm driving. However, texting while driving has become vital and not only dangerous. Hence, to reduce the number of car accidents from these cases, Police Diraja Malaysia or PDRM has issued a statement which is confirm the guilty offenders of Rule 17A, which is using phones while driving, will be subjected fines up to 1,000 ringgit Malaysia and jail up to 3 months. Okay, next slide. Okay. Um, it is alright. Okay, it is no wonder why texting feel worse. Our eyes are averted when we text, and we need to see the road, of course, to drive. By saying this, I do need to tell you that it is not a good idea to drive and wear a blindfold. Even some researcher using a real car and not simulator found that hands-free phone calls are similarly distracting as conversation with another person in the car. The more complex the conversation, the more the driver's attention was strained and their driving ability impaired. Okay, next slide. Okay. All right. When we talk about the authorities, especially police, they know whether you are texting and driving in a variety of ways. If they see you texting while driving, that's the first and most evident it is. Other times, the way you drive, such as drifting lanes or getting into an accident, may cause them to seek evidence from your telephone records and could could prove you were texting and driving at that time. All right. For next point, I will let my friend Afi Farhan to explain bad effect of texting and driving to a passenger and other people.
Okay, thank you. When we talk about bad effect of texting and driving, there's a lot of them, but there's a few I wanted to highlight. Distracted driving can be extremely dangerous and could impact passengers and other people. The reason why texting while driving is considered extremely dangerous by many people, including authorities, and some places have either been outlawed or restricted. Road accident can be classified based on the category of victim involved, namely pedestrians and driver and passengers. Each category of victim usually suffers from different level of injury. For pedestrian, injuries suffered by pedestrian can be generally be divided into three types. Primary injury occurs during the first impact of a direct collision with a pedestrian. First impact, the victim will usually be thrown and hit any part of vehicle. This injury is called a secondary injury. Tertiary injury resulted from the victim being thrown onto the road surface. Pedestrian injury depends on the speed and the part of the vehicle that violated it. The second one, they classify for driver and passenger. Collision between vehicle driven either with other vehicle or structure located on the side of the road can result in injuries to drivers and passengers. Injuries can occur when the driver and passengers are hit hard by the interior of the car during a collision. In addition, injuries also occur if the victim is thrown out of the vehicle. The driver can suffer serious injuries when his chest is hit by the steering wheel of a car. However, the driver's seatbelt can prevent it from hitting the steering wheel, hitting the windshield, and being thrown out of the car, which can lead to severe trauma. The abrasion effect caused by the compression of the seatbelt during the accident can help to track the victim position in the vehicle, which in turn determines the actual driver during the accident. This is effect of a car accident injuries can be long lasting, which is why compensation must take into account future expenses and suffering. We can take a look at the long-term emotional and physical effect of a car accident. In physical car accident effect, the most severe physical injuries associated with a car accident commonly include brain and head trauma, such as traumatic brain injury, neck injury, neck strains or disc damage, and back or spine injuries such as sprains, strains, fractures, or disc injuries. Physical injuries, they are associated with the long-term effects are usually permanent disabilities such as amputations, paralysis, or TBI, which create diminished mental capacity. But soft tissue injuries that affect the tissue surrounding and connecting tendon muscles and ligament are also usually long-term. Emotional effect of a car accident. Some injury are not immediately apparent after an accident, but regardless of when an injury first appears, it can have a long-term effect. One of the areas which in car accident injuries typically are long-lasting is those related to psychological or emotional trauma. The mental and emotional injuries after a car accident can include emotional distress, fear, anger, humiliation, anxiety, shock, embarrassment, random episode of crying, loss of appetite. Studies indicate that one third of those individuals involved in a non-fatal accident continue to have above mentioned symptoms of emotional trauma a year after accident, including traumatic stress disorder, depression, and phobias. Recovering for the long-term emotional and mental injuries after a car accident should be calculated into the pain and suffering damage. I will pass to my next speaker, Anis Sofia.
Okay. Next, I will talk about what is distracted driving. There are three main types of distractions. The manual distraction means you take one or both of your hands off the wheel. For example, to grab a drink from the cup holder or help your kids fasten their seatbelts. The visual distraction implies taking your eyes off the road to look at an accident site or check your phone display to see who is calling. Finally, the cognitive distraction means taking your mind off driving. This happens when you daydream about a holiday or talk to someone using a hand-free device. Okay, all three take your attention away from what you're doing, driving, and places it elsewhere. As a result, this makes you less likely to notice a hazard, slow your reaction time, and reduce your ability to avoid a crash. Okay, firstly, the visual distraction implies taking your eyes off the road to look at an accident site or check your phone display to see who is calling. Chances are, when you think about distracted driving, you are thinking about visual distracted driving. It's what most people associate with distracted driving because it's what makes the most sense. When a driver takes their eyes off the road, even if it's just for a split second, they take their focus off the road as well. It makes this distraction especially dangerous because drivers can consistently assess their surrounding. For example, like they are looking at the GPS device, looking at the entertainment center, or maybe looking at their passenger. Okay, second point is a manual distraction. A manual distraction is when a driver takes their hands off the wheel for any reason, for any amount of time, without both hands on the wheel. Your reaction time suffers, and so does your ability to steer. Let's say you have one hand on a knob and suddenly a deer out in front of you. It takes at least full second to bring your hand back, and in that instant you could crash right into the deer. Not driving with two hands can cause you to veer off the road or into oncoming traffic. Okay, for example, like you eating, drinking, or smoking, or maybe you're just adjusting the radio temperature. Okay, the third point is cognitive distractions occur when a driver's attention or concentration is hindered by some sort of mental distraction. It's when part of your mind is on something else instead of solely on the road. Cognitive distraction and deceivingly dangerous because you can look like you are doing everything right. You can have your eyes on the road and your hand on the wheel, but if your mind is drifting, you are still distracted. To put it simply, when something else captured your attention, you will probably have a hard time concentrating. You won't be as alert, which means you won't be safe. Okay. So as a conclusion, as you can see, texting and driving is unsafe and may result in serious and even deadly consequences. It is so dangerous that texting in cars is oftentimes compared to drunk driving or driving under influence of drugs. Stay focused on defensive driving. Keep 100% of your attention on driving at all time. Don't use a cell phone or any other electronic device while driving. Okay. Any question?
Sorry.
Yeah.
Okay. Thank you for the informative speech. My name is Batia. I have a question. Texting is so dangerous, but why do people do it? Okay, thank you.
Okay, thank you, Anas, for the question. Okay, for answer those question is, all right. Some people still don't know how dangerous this distracted driver could be. There is a lot of risk when driving and texting, but anyway, people still choose to do it. So they make mistake of thinking that statistics don't apply to them and they can defy the odds. Still, others simply lead busy, stressful life and use a cell phone and smartphone to stay connected with their families, friends, and workplace. So they forget or choose not to shut these devices off when they get behind the wheel. So anyway, is they answer your question?
Oh, yeah, yeah. Definitely. Thank you.
All right, thank you. So all right, thank you. Okay, I think our time is up already. So we proceed to the next group that will be present about um
Okay, let's proceed to the next group. Would you like to introduce the next group?
Okay, let's continue to our group. So before that, okay. Assalamualaikum warahmatullahi wabarakatuh and a very good afternoon to everyone, especially to Miss Sherin and my fellow friends who are listening to our speech. So today, our group will give informative speech presentation about the Eiffel Tower, the symbol of France. Before that, let me introduce about myself. My name is Nurul Zahirah binti Muhammad Naim with my two others member which is Eva Hamiza and Nizawati. So let's continue about the introduction about the Eiffel Tower. So first, have you ever want to travel the world and see the most significant structure that our world has? Thousands of people around the world, around the planet spend their childhood dreaming of seeing this structure in the flesh one day. Once, I took my first glimpse of its grandeur. That's when I really know all my dreams had come true. So here's a clip of me, which I'm at the second floor of the Eiffel Tower. Luckily that I have been to Eiffel Tower, which is around October 2019. So let's continue about the history of the Eiffel Tower. The tallest made structure in the world, Eiffel Tower believed it is built for the Universal Exposition in the year 1889 in commemoration of French Revolution and the birth of democracy. Before this, a fair held a contest for the most impressive monument to honor France's greatness. Next, the Eiffel Tower, Gustave's most famous utilitarian project for symbolized man's ability to overcome the faults and difficulties the nature and life put in his way. Lots of designers were submitted, but commercials already one design of famous architecture, which is Gustav Eiffel. This non-masterpiece is his most famous design, his most famous utilitarian project based on Hatton, Vogt, and Steffel in 1986. The Eiffel Tower is primarily a symbol of Paris. It is image of France to mass of the tourists. The tower initially called the pylon of 320 meters, the Tower of Mr. Eiffel, the Eiffel Tower, which we always call La Tour Eiffel. So for the conclusion for my point is Gustav Eiffel was designed and has been chosen and become the most famous monument in the world. So next, Eiffel will be continue about the construction of the Eiffel Tower. So Eiffel, you may continue. So thank you.
Thank you, Zahira. So before I start, my name is Nur Ifara Miza binti Zahiri. So do you guys know, the Eiffel Tower is 324 meters tall, included the antenna spire that is over 3 times the height of Big Bang. Next. Did you guys know or wondering how the Eiffel Tower was built? Anyone? So today, I will share it with you. So construction was started on the tower in early 1887. Next. Okay, first, they had to lay the foundation and build involved 2-meter concrete slab under each of the feet and putting them 7 meters underground. So because 2 of the feet bordered on the river Seine, the engineers were worried that water would seep in. So they created the metal shoe structure which keep the water at bay. So next. Next, they constructed the legs, but they need to make sure that build them simultaneously. Otherwise, they could have ended up with the Leaning Tower of Paris. Okay, next. So because of that, they have to use hydraulic jacks under each of different legs, lowering and raising them to make sure that the first floor was completely horizontal. Okay, next. Finally, to create the main body of the tower, they shipped 18,000 different parts that were prefabricated in the factory, and they put them together on site using 2.5 million rebar. Next. Finally, they created the main body of the tower and, now as the body of the tower grew up in size, they actually had to get them up there somehow. So they're using creeper cranes which run up the legs of the tower. Interestingly, the guide shaft of the creeper cranes actually the ones that are used today in elevator to zip you up on the top, like Zahira did. Okay, next. So, just over the 2 years after the construction was started, the tower was complete on 31st March 1889. Gustav Eiffel was the first person to climb all the 1,710 steps all the way to the top when he had furled the French flag, the tricolor. Fair enough, he was the first person to do that because he also actually invested using of his own money. Okay, next. Okay, Parisian initially does not really like the Eiffel Tower. They saw it a bit of an eyesore on the Paris landscape. Some of them thought it would be toppled over and crashed down on top of their homes. This tower was supposed to be dismantled, but it lasted pretty well. Now, the Eiffel, and it was actually the tallest structure in the world for 40 years. Now, the Eiffel Tower is a real icon of Paris. So, in conclusion, I hope you gain some knowledge on how the Eiffel Tower was built. So, next, I will pass it to my teammate, Lisa Wati.
All right, thank you very much, Ifa. Okay, now I'm talking about the cultural of the Eiffel Tower. So we'll continue about the tourism of the Eiffel Tower also. Okay, it is popularity all over the world. The Eiffel Tower was seen as proof of the decidal character of contemporary secular culture. This is based on Burton 2001 said. And then during its first 10 years, the tower drew millions of visitors. Despite a small group who opposed the tower, it was admired even by socialists who denounced the economic system it was to preserve. Okay, next. The Eiffel Tower, now considered as the most familiar structures in the world, it was renovated in 1986, if I'm not mistaken, to welcome more visitors around the globe. According to studies made by researchers everywhere, the Eiffel Tower receives the most number of visitors than any of other popular and paid monuments in the planet. Let's say like this example is Taj Mahal. With this regard, the tower has more than 500 employees to host and manage the daily operation of the Eiffel Tower. Okay, next. Okay, according to Rosenwicks, Holzman, Saborin, and Belanger, in 2000, the nighttime view from the Eiffel Tower with the wonderfully illuminated landscape of exhibitions grounds, palaces, and fountains spread out below, with all the lights and shadow of nocturnal Paris framing it in. The Eiffel Tower is a must-see tourist attraction, and every individual should visit at least once during their lifetime. Today, the Eiffel Tower is always crowded with visitors from all over the world. Okay, next. Okay, now everybody talking about COVID-19, and Corona everywhere. So same goes to Eiffel Tower, where sees dizzying drop in visitor number. The Eiffel Tower is experiencing a collapse in visitor numbers as foreign tourists stay away and tight coronavirus measures, including a curfew, take their toll, as the Paris landmark operator said. Based on France tourism's statistic in October 2020, ticket sales have fallen by 80% compared to 2019, where my friend first speaker had gone. According to the operator, Sita, and also their revenue also down by 70%. Because 2,500 visitors per day for a monument then can accommodate up to 25K of visitors. Since the end of the summer, number of visitors down to between 10 and 20% of usual attendance because of COVID-19. Okay, next slide. Okay, we can see that social distancing rules allow lifts going up the tower to carry only half the usual number of people. The Eiffel Tower has also cancelled its night operation hours, as curfew rules in Paris are banning people from being out after 9 p.m. of the day. Okay, now we can go for the conclusion of this topic. Okay, we hope we hope that we have shown all of you some of the reasons why the Eiffel Tower has long been an icon of Paris. And one of the first things that come to mind when people think about France. It is a symbol of the French genius in the sense of civil engineering. So the next time you are really in Paris, the next time you see the Eiffel Tower on your television, in movies, in magazines, just remember, here's a lot more to it than meets the eye. All right, thank you very much, everybody. We hope that all of you enjoy our presentations. Now we are open for the Q&A session.
Hello.
Yes.
Can you hear me?
Yes.
Okay. Thank you for the informative presentation. I have two questions. First is, other than Gustav Eiffel, is there other people who are contribute for monument? And second question is, how many workers needed to build the Eiffel Tower?
Okay, thank you, Rashidi, for your question. For the first question, I will answer. The Eiffel Tower was designed of Alexander Gustav Eiffel with two assistant of engineer, which is Maurice Koechlin and Emily Noguer, with architect Stephen Sylvester. So next, Eva will be answer for your question.
Okay, for the second question, can you imagine to build the tower 324 meter? So that's require almost 300 workers to build it. That's all. So is it clear? Any other
Yes. Okay.
question?
Thank you. Thank you for answering.
I have a question. During this pandemic time, is it have visitors or tourists visited the Eiffel Tower?
Sorry, pardon?
Currently, during this pandemic time, is it have visitor or tourists visit the Eiffel Tower?
Oh, okay. Let me answer the question because I think this is about the culture. Thank you very much to the Husna who's giving us the question. Okay. Yes, absolutely. Yes, still have now, even the pandemic, but the amount is dropping down. It's only about the 50 visitors, something like that, but mainly French, because as you know, Paris, as well as several other French cities, it also has been placed on the highest of coronavirus alert. Almost 41,000 new cases reported daily, where the operator of Eiffel Tower is concentrating on people only who live close nearby of the Eiffel Tower and who are interested in family outings only. But they are a special area for children with historical information about the tower has been added, and a vast camps area is to allow. Okay, that's all.
Thank you for the answers.
All right, welcome.
Okay, I think that's all from our group. Okay, now we will see the next group, which is about eating healthy with a busy schedule. So that's all from us. Thank you.
Okay, good job, Parisians. Okay, hopefully one day I get to go to visit the Eiffel Tower also and
Let's
take
go to the
some pictures. Yeah, Lisa, have you been?
Coming soon, Miss.
Coming
After
soon.
the pandemic.
Same. Miss actually went to the same version but China version in Shenzhen, Windows of the world they call it. So
Oh.
it's much cheaper, but they built exactly the same China one. They built exactly the same like Eiffel Tower, just that the material is not the same and the environment around it.
Oh, actually
Yeah.
already bought the ticket and also paid the agent, but because of the pandemic, ticket
Postpone.
postpone. But then because the going back to Malaysia, will on the MCO already last year's.
Okay, but that's good. At least you will have better health next to go, Lisa. Yeah.
Yeah.
Yeah. Okay, so
Right. Thank you very much, Miss.
yeah, thank you so much. Okay, next let's hear the next group.
Yeah.
Okay. Thank you to Kak Iza. Hello and good afternoon, ladies and gentlemen. Thank you for having me today. First, let me introduce our group members. My name is Nur Asma Balkis. as a presenter one, and the other presenter is Nurul Fadlin and Siti Juwairah. Now, we are going presenting you about eating healthy with busy schedule. How many do you want to be healthy? Many students have a hectic schedule and often lack time to sit down to have a proper meal. As a student myself, I often rush through meals, eat processed food to save time and even forget about eating. Unfortunately, those poor eating habits lead to feeling tired, increased stress, and weaken the immune system. Through my own experience, I learned how to incorporate healthy eating habits with a restless agenda. Today, we will discuss ways you can incorporate healthy eating into your lifestyle even if you are always on the go. Packing a lunch, choosing restaurant wisely, and keeping nutritious snacks on hand are just a few the way you can still manage to eat something decent while maintaining a healthy pace. Firstly is you can keep healthy snacks easily accessible to stave off hunger of your lunch, such as you can pack fruits, vegetable, or nuts to during day. Besides, some snack ideas are apple slice with almond butter, pizza with hummus or trail mix are also can be used because it's also a good snack to eat when you don't have enough time to eat heavy food. This snack only take a few minutes to pack it and you can save your time. Most importantly, snacking throughout the day can also prevent overeating or eating less nutrient dense meal. Nutrition outreach worker Lucy Yu also had her opinion that we need to sit down and eat a healthy meal. Furthermore, we also can eat a whole grain carrier bar. When our mornings are busy, we can grab a carrier bar. It's a quick, convenient, and tasty way to have breakfast on the go. The nutrients in the bar are not enough to make our body function well, but these bars are more like snacks that offer a source to quick source of energy when the body is low of energy. They are easy to eat, not too pricey, and are often seen as a healthy option when it comes to snack time. Healthy Span nutritionist Rob Hobson explains that on the whole, any shop book carrier bar I would treat a sweet snack. They often they often they often contain with a bit of sugar, which is normally in the form of honey. However, this is normally less sugar than chocolate bar. The plus size of carrier bar. The plus size of carrier bar compared to other sweet treats is that they usually contain healthy ingredients such as nuts, seeds, oats, and dried fruit. These offer healthy fats and minerals such as magnesium and iron. We also need to drink plenty of water to stay hydrated. People often forget to drink water when they are busy. However, the body need water to carry out appropriate function, especially our brain function. When hydrated, our continuous function will be declined and our brain will not be working efficiently. Carry a reusable water bottle with you all the time and refill it at the water station around campus or your place. Different application on the market can remind us to drink water throughout the day, such as water reminder app in the Google Play Store or App Store. Now, I will pass to the next presenter.
Okay, next. One healthy choices. Make your own meals. Eating healthy does not have to be expensive. Usually less expensive than eating out, and many convenient options available. For people who are busy studying, busy working, and survive in hectic days, weekly planning saves time and money. Next slide. Planning includes the step below. First, plan and write down your breakfast, lunch, dinner, and snacks for the week. List down the wet and dry groceries you need to buy for the week. Second, buying dry groceries in bulk and wet groceries in the local market will make your wallet happy. This list is partial to make sure you don't end up buying more than you need and overspend. Third, pre-cook your meals whenever possible. You can sort your snacks into food containers, freeze your fruits, and refrigerate your stew, soup, or curry. In the long run, preparing meals at home may save your money. A group of basic ingredients often comes in at a lower price tag than a single restaurant dish. You can also end up getting more meals out of a recipe you make at home than if you order takeout or have leftover to take the next day. After just 2 weeks, you could see noticeable savings start to pile up. Next slide. Many convenience options available, such as for breakfast, smoothie drinks is one of the healthy and so easy for us to make. It just need a blender, some fruits such as apple, banana, or maybe can put a few leaves of spinach and water or some honey. I bet it's so delicious and everyone would love it. For lunch, you can try to make rice with stir-fried chicken and blanched broccoli. This recipe and ingredients one of the easiest meals to cook at home. The cost for this meal, if you make them at home, is just 6 ringgit for one plate. Making a meal yourself means you can make sure the portion sizes and calorie counts are where you want them to be. Recipes often come with nutritional information and serving size suggestions, which makes that even easier. For dinner, you can try healthy soup such as tomato soup, pumpkin soup, or maybe mushroom soup, possibly with a slice of freshly baked bread. They all packed with nutritious vegetables, high fiber beans, hearty grains, and plenty of flavor as well. Next slide. Plus, if you are looking to seriously reduce your cooking time, there are microwavable frozen healthy meals such as brand from Ayam Brand that require minimal effort to cook. Many of these healthy meals can be ready in as little as 15 minutes and less, which makes them ideal for busy people and busy days. Next slide. According to the Malaysia's Healthiest Workplace by AIA Vitality 2018 survey, 91.7% people do not eat a balanced diet that include fruits, vegetables, and whole grain, and 16.6% of the employees surveyed are obese. But stress and binge eating are said to have contributed to the poor health of nations. Next slide. Next slide. There are quotes from Herodotus from Greek physicians said, when health is absent, wisdom cannot reveal itself, art cannot manifest, strength cannot fight, wealth becomes useless, and intelligence cannot be applied. That's all from me. Next to the Juwairia.
Okay, thank you guys. Assalamualaikum and hi to my lecturer, Mushari, and all my fellow friends. Now I will continue this presentation about dining out.
Okay, next. Next slide. Okay, eating healthy outside is not really difficult, okay? But what we need to do is choose wisely if eating out, okay? Because as we know, in Malaysia, we have many restaurants from the fast food or other restaurants like Subway or any restaurant incorporating healthier choose into their menu, like salad, bake and grill, uh, also low carbo option and fruit and yogurt. Okay, as we know, salad is very good for our healthy. Fruit can give our body is vitamin. Okay, next. Okay, you can make choose that are healthier. As a customer, we can request what the menus we want to eat. Okay, what we want to eat that. Okay, so as a customer, we should ask them to hold the mayo and other fattening sauce. Because as we know, mayo and other sauce have very high fats. Okay, then it's not really good for our healthy lah. So the next point is choose raw or grill instead of fried. Okay, fried is very have oily. And the last point is leave of the French fries. What I want to highlight here is junk food. Okay, next. Okay, this one is lead automat period PhD assistant professor of epidemiology. Okay, it's extremely difficult to eat in a healthy way at fast food restaurant despite some of their recent helpful offers. The menu tend to include food high in fat, sugar, and calories, and low in fiber and nutrition. So I want to ask you guys, do you love fast food? This is normally I can say is everyone love fast food. Everyone love junk food because it's more tasty and easy. But what we need to know, eating junk food on a regular basis can lead to an increased risk of obesity and also chronic disease like heart problem, diabetes, and also some cancer. Okay, next. Okay, this one for the conclusion. Today we have looked at variation option for eating healthy on to go. We learn how to packing a lunch, choose a restaurant, and also keeping nutrition snack. Okay, so everything has decision in our hand if you want to choose healthy food or not. Okay, I think next slide. Okay, uh, this just statement. Okay, maybe you can read this. Okay, I can't control everything in my body, but I can control what I put in my body. So that's all from us. I hope everyone enjoyed this presentation and get some knowledge from us. Thank you, Ms. Sherin, as my lecturer and all my fellow friends. So don't forget, stay safe and stay healthy. That's all.
I have a question.
Okay.
Okay. My name is Bahtia, and I
Alright.
have a question. Can you eat healthy food and still be overweight? Okay. Thank you. Thank you for informative speech. Thank you.
Okay. Thank you so much. Thank you so
Okay, I
much.
have a question. Can you still eat healthy food if you are on a budget?
Alright. Okay. Okay. I will answer Anna's question first. Okay. Anna's question is, can you eat healthy food and still be overweight? Right. My
Yes.
answer is yes, because it depends portion size you take. Okay, you cannot say a healthy food don't have any calories. No, all food, healthy food or not, that still have calories. So if you have a large portion of those healthy food that are high in calories and you do not expend the energy, it is likely you will still gain weight. Okay, is it clear?
Yeah, thank you.
Right, thank you,
Okay,
Anas.
for Darshan, Darshan answer. I will answer. Can you still eat healthy food if you are on a budget? Yes, you definitely can eat healthy food if you are on a budget. You can buy fresh fruits and veggies when they are in season. It's usually the cheapest option. Don't forget when you go to shopping, have a prepared grocery list and stick to it. Try to resist the temptation to buy cheap, easy food in the long run, and an unhealthy diet can be very costly. Okay, that's all from us.
Right, thank you so much.
I have question.
Okay,
I
last
have
one.
question.
Okay, my name is Azri. My
So
question
many
is,
questions.
in your opinion, what are good midnight snack food option you can share with us? Okay,
Sorry?
thank you. What are good midnight snack food opinion that you can share with us?
Thank you. Thank you.
I will answer the question. The question and the answer is food which protein are the best option for midnight snacks. A cup of milk to until a cup of probiotic plain yogurt and even casein protein. Even is a slow release protein supplement are a few good option too. That's all.
Thank you.
Thank you.
Okay, that's all from our group. Next group. Your children need your presence more than your present. Welcome the next group to give a talk about single parents and its effect on children.
Uh, okay, a very good morning to Miss Shereen and my fellow friends. So, myself name is Darshan, and my team members Irfan Aikal and Muhammad Irfan. We are going to give a talk about impact of single parent and its effect on the children. All right. So first, are your parents divorced, never married, co-parenting, or lost a spouse? Life can never remain the same once you have to take up the responsibilities of being a single parent. This doesn't make them less of a parent than others. They just have to face a completely different set of challenges that those married might not have faced. So, once again, a very good morning to me, Shireen, and my fellow friends. Today, I'll be focusing on the impact of single parent and its effect on the children. First, let's have a better understanding of who single parents are. A single parent, most of us may know as an uncoupled individual who shoulders most or all the day. Next slide, please. Most or all the day today responsibility of raising a child or children. This is from based on Wikipedia. So mothers are more often the primary caregiver in a single parent structure. According to the US, okay, next slide. Okay, according to the US Census Bureau, out of 12 million single parents in 2015, more than 80% were headed by single mothers, with just less than 20% headed by men. According to the research done by Chloe Bird, shows that across Europe, single parents headed 10.4% of households with children. The lowest rate, 3.5%, was in Romania, with the highest rate of 20.4% was in the UK. Some 16% of children live in a single parent's home, ranking from 5.3 in Greece to 28.1% in the UK, and 2.1 lives in a single father home, ranking 0.7% in the Cyprus and 15.1% in Belgium. Okay, so now let's take a look at some of the effects of single parents, paying attention first to the negative effect, then the positive effect. Some of the negative effect included emotional problem, financial trouble, and mostly the fact that there's never enough time. Right. First, I'm going to talk about the emotional effect. Single parent, whether caused by separation, divorce, or the loss of a parent, would always have an effect on the family as well as the children. It might be just though the first year or a much longer period after that. The separation from one parent can cause different emotional effects, such as feeling abandoned, sadness, loneliness. Loneliness like such felt both by the kids and the parents as well, and difficulty socializing and connecting with others. Your children are likely to suffer on self-esteem problems. They may crave for affection, which they will not get enough because of your busy schedule. Thus, they may lose expectation in their relationship later in life, or they will actually have more expectation for affection and company down the road, but that will not create a healthy dynamic. They will take all the blame, they will take all the blame for their living condition. It may be difficult for you to stop them from drowning comparison, but you can help your children build self-regard. Things like acknowledging her when she was done something good and posting a card in her room about her worth will help build self-esteem. Another way to help children build self-esteem is to let them take the lead in completing tasks with some challenges. Some single parents have to tender to jump into quick to help their children. Being a single parent is not that easy. For example, the quote, being a single parent is twice the work, twice the stress, twice the tears, but also twice the hugs, twice the love, and twice the pride. So I welcome the next presentator, Haikal, to present about the adjustment issues.
Okay, thank you, Deshan. For the second point is the adjustment issue. With the present parent gone, both parent and the children would have to work together to make the things work from finance down to an everyday scenario. The parent must get to understand that he or she might never get enough time to take care of the personal issue, social life, and even enough time to bond with your kids as they enough to juggle between works and maintaining the home. This is where the adjustments start, the planning, the organization to try to make sure the things planning don't get out of the control. It took a while before everyone in the family could adjust the fact that they no longer had a dad or mom. Parents got so busy with work then they did not get enough bonding time. However, with effort from every children got to find ways to make things work to make sure that whole adjustment and getting busy is did not make it seem like they lost the mom or dad too. Okay. The third point is financial trouble. Financial trouble is the most single parents put more effort at work in order earn more. Being a single parent, the financial burden become heavier. Yes, you must be opportune to get financial help. You're exposed, but it just can't be the same due to the gender inequality. Some women earn less than the effort they put in. Like I got the according to the momentum report chart, according to the report momentum on the single parenting as the at 2012 in the US or United States, median income for the single mother family was around 25 US dollar, 13% of the 81,000 US dollar median income for the two parent families. Median income for the single father family was around 36,000 US dollar, 45% of the median for the two parent family. The report stated that the poverty rate of the children from the chart 3, poverty rate for the children in the single parent family is a triple the rate for the children in the two parent family. In 2012, 42% of the children in the single parent family were poor compared to 13% of the children in two parent family. Also, as a result of the financial trouble, there may be chances when they have no deny their kids certain things in order to make expensive. Single parenting is not all a bad, yes. It has a bad part, but it also a good part. So some positive effects such as maturity in the children. We show the last point, the positive effect of the single parenting. Okay.
Hello guys, so I'm the last presenter, Muhammad Ifan. I will present about the last point. I hope you guys in a good condition and in blessing as well. Uh, so the single parent also bring the positive effect, such as maturity effect. The maturity effect occurs when the kids or the children are in a single parent see or watch their parent trying their best to do the thing works, and then the teamwork make the children become less to complain and learn how to deal issue with itself and take decision for certain things by its own. A single parent child become mature by learning the hardship that he encounter, which will give him experience when handling the later disappointment. For example, a single parent child learn how to make a wise relationship decision to avoid the undergoing same problem as he witnessed from his single mother or single father before. Then a single parent child also learn how to be a responsibility at an early age, because he see and he watch their mother or their single father run a family by itself only, and he see their single mother or single father make the effort and make him as a priority. So at the end, he don't be egocentric and realize that he need to help their parent with certain tasks. When grow up, the child or the kid in a single parent know how to maximum their resources whatever in single parent available. The child in a single parent also know how to manage financial when the single mother or their single father provide to make sure them were not stranded. At the end, the kid or the child in a single parent gain a sense of responsibility and learn how to act maturely. So the next, uh, enjoy this video.
Child is okay and whole in their ordinariness. The child doesn't need more to feel more of themselves. They didn't come with this egoic desire to attach to PhDs or labels or judgments or wealth to feel themselves. Children feel themselves just by who it is they are. They have the simplest access to wholeness. We rob them of this. To truly love someone, it's truly loving the other for who it is they are, with no you in the picture. They don't have to love you back. They don't have to need you. They don't have to agree with you. They don't have to adhere to you. Now try loving your child for who it is they are.
So So for the summary or clincher, all we have through, we can conclude that a single parent may have its negative side or challenge such as financial trouble uh, and emotional effect. Always remember, single parenting also brings its positive effects such as bonding, share of responsibility, and maturity effect. Are you working or in relationship or close friend in a single parent or single parent home? Always keep encourage them and give them a warm smile so maybe it can lighten up their day. Whether you are divorced or widow or never been married, running a single parent family can be rewarded, as we know it's difficult and stresses at times. So keep trying to rise up the challenge and rise up the children and do the best as you can. Whether you are, stay positive and stay strong, and you know you have a full support in your back. For that's all from us. Thank you. So proceed to Q&A session.
Hi. Thank you for your informative speech. I just have one question for you guys.
Okay.
Whether single mother or single father bring biggest impact to children?
Okay, I'll answer these questions. Okay, for me, single father brings a bigger impact to the children because raising a children as a father is not that easy as a mother, because not everyone can be a mother to a children, because children mostly crave for love and affection, while father, mostly guys are very busy with their working schedule. So for me, I would say that a biggest impact would be a single parents, like a single father, for raising up a child.
Hi, thank you for the informative presentation. May I ask, what is the most factors of single parenting?
Okay, the most factor that cause the single parenting have a variety type. The first is divorce and separation, and last is death of parent. That's all for answer.
Okay,
Okay,
thank
by
you
the way,
everyone.
thank you, Darshan, for the answer.
Okay, so next we would welcome the next group. Families are like branches on a tree. We grow in different direction, yet our roots remains as one. So next, welcome the next group to give a talk about the importance of family.
Okay, good job. All right, I would just like to compliment Darshan's group. Okay, good job. Irfan and Irfan, the Irfans and Darshan. I believe there might be many of us here who come from single parenting homes, but
Yeah.
at the same time, if we don't, then we must have known either our relatives, cousins, or
Correct.
family and friends who are also single parenting. So it is not easy. Okay, and at the same time, it also addresses how complicated how complicated relationships are, especially today. Yeah, so this will be good for everyone actually. Okay. All right. Thank you.
Welcome.
Okay. Next on family. Can't wait.
Okay, can you guys hear me?
Yes.
All right, I will start, okay? Okay, hi, Assalamualaikum, and very good evening to my beautiful lecturer and my fellow friend. My name is Nur Arisha Naswa binti Muhammad Nur Azman, and my friend Nur Fitra binti Safik. Today, we would like to talk about the importance of family. Okay, this is our outline of presentation. Okay, ladies and gentlemen, boy and girl, greeting to you all. I deem it a pleasure and a privilege to say a few words on this class. When we say it's important, and what does it mean to you? Okay, family is the most important and valuable gift that God has given us. It is a first lesson in relationship with others. Family is a really an important word. It means to feel secure, to have someone who you can count on, whom you can share your problem with. But it also means to have respect for each other and responsibility. John Warden said, the most important thing in the world is family and love. What family means to me is love and someone that will always be there for you through the good time and the bad. It is about encouragement, understanding, hope, and fun. These things are all important to me because it makes me feel secure and happy inside, regardless of what is going on in my life. This is one of the main reasons why the family is important in our life. Here in this page, it is important to emphasize on the importance of family in our everyday life. First and foremost, a family is always there for our support and security. Whenever there are any kind of problems in our life, whether it is going for a job interview or a bad performance in the examination or getting over a breakup, our family is always beside us and none face all the difficulties in life when we have our family beside us for support with their care and love. Our family help boost up our self-confidence with the help of the self-love provided by our family. Also, not to forget about the feeling of security that the family provide us with. The strength of the family does not matter here. It is actually the unity of the family staying together that give a secure feeling that the family is going to stand by us regardless of anything. Second is, our family loves and understands us, which are extremely necessary. Just like other basic requirements, a human being also has some emotional needs, as well as a person. The family provides us with the required affection, understanding, and a feeling of love, belonging, and several others. Our family, the only one that understand us the best and know about us, even the minute detail which gives us a feeling and satisfaction. Third, aid to make decisions. Family comes to rescue. Family comes to the rescue when we have to take any vital decision of our life, such as changing of a job, buying some property, for example, which might be very this is where family comes to our rescue in helping us to take a decision. Okay, my conclusion, family is an important person who is always there for us no matter what. There we make sure that we are in a good and a safe condition. They are always there to help us when we are in trouble and can give the best advice in making the right decision. In addition, our family will also and understand the problem we face. So the most important thing is to appreciate the family and love them. Okay, next I will pass to the next presenter, Nur Fitra.
Hello and good evening to Ms. Sharon and my friends. First of all, I would like to thank to Arisha for the wonderful meaning of family and her informative on the importance of family. For me, another great importance of family is that our family protect us from all kinds of external influences. The outside pressure or peer pressure might have a significant impact on the teenager as the adults. This might create an external influence on the person. They might be forced to do something which morally not correct. This is where the family values come into play and prevent the person from doing anything incorrectly. This actually means if one has a strong perception to differentiate what is correct and what is not due to the values that are inculcated in them by their families. Next, family basically give us a center in this big earth. No matter wherever we go, we always have in our mind that we ultimately have to go back to our family at the end of the day, thus providing a center. And it means that we are not alone in this world. And finally, they help to make you who you are, whether by providing you with your first step education, like learning to read and write, or instilling you with moral values. Your family can help. Your family can shape your personality and belief for many years ahead. Many people say that the kind and wise word of their family help to make them a better human being. As conclusion, our family can be whatever we make it. It can consist only of blood relatives, or it can also include close friends. From promoting your inner growth to giving your financial support, your family will help you to achieve all of your goals. When you have your family by your side, you never need to feel that you are alone as you step out into the world. There is always a whole team of people behind you who want the best for you and who will always be there to call upon when you need someone to talk to or helping hand. Before I end this speech, I would like you to reflect on this quotation. Family is not important, they are everything, by Michael J. Fox. I think that's all from us. Thank you. Now I open for Q&A session. Anyone has a question to ask?
I have a question.
Okay.
Thank you for the informative presentation. I would like to ask, what should I do if I have a problem with my family?
Okay, thank you for the question. Let me explain. No matter what your problem with your family, we should never hate each other. So take time to discuss and solve the problem as best you can. Okay, next question.
Okay, I think we can move to another speech presentation. Their topic is mental illness awareness. We are welcoming you, Group 8. Thank you.
Okay, thanks to the previous group. All right. Let's hear next. This is very important topic, especially when we are all into so many stages and phases of lockdown. Okay, so what is it about mental illness? All right.
Good afternoon to Ms. Shireen, my fellow BFM classmates, my Babat EU friends, and all the viewers who are watching this through YouTube Live. Thank you so much for participating in this occasion. First of all, I would like to introduce myself. My name is Naatira binti Azhar, and this is my friend Nur Husna. On this lovely evening, our group will be presenting about mental health awareness. So, what is mental health? Mental health includes our emotional, psychological, and social well-being. It affects how we think, how we feel, and how we act. It also helps to determine how can we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. Over the course of your life, if you experience mental health problems, your thinking, mood, and behavior could be affected. Many factors could contribute to mental health problems, including biological factors such as genes or brain chemistry, or maybe life experience such as trauma of abuses that affected from you were little, or it could be a family history of mental health problems. Mental health problems are common, but help is always available. People with mental health problems can get better, and many of them are recovering completely. This is especially important for mental health as opposed to more physical ailments because mental health problems often affect people's mind and understanding rather than their bodies. Basically, someone experiencing a mental health problem or crisis may need help and assistance to even accept they have an issue that requires dealing with. And the more there are people around them who are aware of mental health problems and how they could manifest, the more likely this assistance is. If you end up with depression, anxiety, PTSD, or OCD, or any other condition, it can be hugely debilitating, often consuming your daily existence. Having someone, let it be a family member, friends, or your partners, or a total stranger, dismiss it outright or accuse you for faking it or similar can only make it worse, could compounding the problem. In addition, there is a great misconception for the mentally ill. Many people think that these people are lazy or just making it up. There is also the attitude that these people are either possessed by demons, violent, out of control, or dangerous. These are the negative labels that have been attached due to the lack of awareness. Raising awareness can reduce the misconception. Although the general perception of mental health problems has improved over the past decade, studies show that stigma against mental health problems are still powerful, largely due to the media stereotypes and the lack of education, and that people tend to attach negative perception to or stigma to their mental health conditions at a far higher rate than to the other diseases such as cancer, diabetes, and other diseases. It is important to take care of yourself and get the most from your life. Most people believe that mental health conditions are rare and happen to someone else. In fact, mental health conditions are common and widespread. Most families are not prepared to cope with learning their loved one has a mental health problem. It can be physically and emotionally trying and can make us feel vulnerable to the opinions and the judgments of the society. So, the question is how to cope with mental health problems. My friend here knows now will tell you a few tips on how to overcome mental health problems.
Thank you, Akira. Take a break, the first step. A change of pace is good for your mental health. It could be a 5-minute pause from cleaning your kitchen, a half-hour lunch break at work, or a weekend exploring somewhere new. Taking a break may mean being very active. It may mean not doing very much at all. Take a deep breath and relax. Try yoga or meditation or just putting your feet up. Listen to your body. If you're really tired, give yourself time to sleep. Without a good sleep, our mental health suffer and our concentration goes downhill. Sometimes the world can wait. Secondly, talking about your feeling. Talking about your feeling can help you stay in good mental health and deal with times when you feel troubled. Talking about your feeling isn't a sign of weakness. It's part of taking charge of your well-being and doing what you can do to stay healthy. Talking can be a way to cope with a problem you've been carrying around in your head for a while. Just being listened to can help you to feel supported and less alone. And if you work both ways, if you open up, it might encourage others to do the same. It's not always easy to describe how you're feeling. If it feels awkward at first, give it a time. Make talking about your feelings something that you do. The next step was accept who you are. Some of us make people laugh. Some are good at math. Others cook fantastic meals. Some of us share our lifestyle with the people who live close to us. Others live very differently. The point is, we're all different. It's been healthier to accept that you're unique than to wish you were more like someone else. Feeling good about yourself boosts your confidence to learn new skill, read more books, or making new friends. Good self-esteem help you cope when life takes a difficult turn. Be proud of who you are. Recognize and accept what you are not good at, but focus on what you can do well. Lastly, keep in touch. Strong family ties and uh, strong family ties and a supportive friend can help you deal with the stresses of life. Friends and family can make you feel included and cared for. They can offer different views from whatever going on inside your own head. They can help keep you active, keep you grounded, and help you solve practical problems. There's nothing better than catching up with someone face to face, but that's not always possible. Considering our situation right now, give them a call, drop them a note, or chat to them online instead. Keep the lines communication open. It's good for your mental health. Awareness is a form of education. The more you know, the more power you have. Knowledge is power. The power can cause positive effect in our community. Awareness is key for understanding what mental health is and how families can receive the help they need. Public knowledge is important in assessing community resources. A lack of awareness of mental health is not just their problem, it is our problem as a community. Awareness does not just end here. Attend health fair, resources fair, read more, listen to it. You could even get more information about the resources and services offered in local hospitals. And overall, pass it on. Don't be scared to talk about it. It's hard work, but the power to teach and reach the community is well worth it. Actually, there's are two common type of mental health condition, which is anxiety disorder and mood disorder. Disorder must commonly consist of PTSD, is it a post-traumatic stress disorder, OCD, obsessive compulsive disorder, panic attack, generalized anxiety disorder, and specific phobias. While mood disorder, uh, de- including depression and bipolar depression. That's all. Thank you. And is there any question?
Hi, thank you for the informative presentation. May I ask, what are common mental health condition?
Um, there are two common type of mental health condition, which is anxiety disorder and mood disorder. Anxiety disorder must commonly consist of PTSD, is post-traumatic stress disorder, panic attack, generalized anxiety disorder, and specific phobias, while mood disorder, including depression and bipolar depression. And is there any other question?
Yes. My name is Noifa from BFM. Thank you for the informative presentation. That's a very interesting topic. So may I ask, what are the early signs of mental health problem? Thank you.
Thank you for the question. Okay, the early sign was feeling sad or down, confused thinking or reduced ability to concentrate, excessive fears or worries or extreme feeling of guilt, extreme mood changes of high and lows, withdrawal from friends and activities, significant tiredness or fatigue, low energy or problem sleeping. And is there any other question? So that's all for our group. We can proceed to the next group. Thank you.
Okay, thank you. Just an additional information to everyone here and those watching as well. If you need a friend to talk to, there's always plenty of helplines available in Malaysia. One of it is Befrienders. Okay, so you can always check Befrienders out, Google, and you can always either write or call them, and you will be you can rest assured that they will definitely get back to you. Okay. All right, can't wait for the next one. We have how many more to go? Oh, we have 3 more to go. And with this, we have 2 more to go. All right. Okay, all the best, Group 9.
Okay, thank you, Ms. Sharon. Assalamualaikum and a very good evening to Ms. Sharon and all my fellow friends. So today we are going to give a speech about the feral children. So my group mate is me, myself, Shahri Shazili, Aizat and Tan Lun Chuan. So this is the example that I think everyone knows that about the film of Tarzan and Mowgli. We often heard of feral animals, but how often do you hear about feral children? Tales of children living and surviving forever fascinated us for centuries. Tales of children living and surviving forever. Feral children have been isolated from human contact from a very young ages and grow up wild. Sometimes they are being taken care of by animals. In other cases, feral children have been confined by people, usually their own parents. But here, we will discussing some cases of children raised by animals in the wild. Are these stories fact or fiction? Could a child really survive alone in the forest? Will animal care for rather than eat a human baby? Be prepared for some amazing and bizarre stories from us. Many cases of feral children have occurred over several centuries. These children were isolated for so long and to a point where they do not know any language or have ever seen another human being. Tales of children living and surviving in the wild, brought up by animals, are almost too unbelievable to be true. Feral children are kids who have been confined with little to no human contact. Sometimes they live and survive on their own, or they have been raised up by animals. Many cases prove that these feral children are not just some made up tale, but real life children living without any speech or knowledge of what is happening to them. What I can conclude from this, there are many effects that occur to these children from being cut off from real world. They include learning animals' behaviors and possibly never learning to speak. Some of the children became super fast runners at times on all fours. That means they walk with their hand and legs. Some even covered with hair. Fairy children's sense were often more developed than of children living with humans, particularly their sense of smell and hearing. Various children found in the wild could adapt easily to changes of temperature and tolerate more pain. So, speaker 2 will explain to you about a story of children, feral children. Please, Isaac.
Okay, thank you for presenter one. Okay, my name is Aizat Isamuddin Azmi. I will tell with you all about Marcos Rodriguez Pantoja, El Nino Lobo. Do you know what meaning of El Nino Lobo? El Nino Lobo is, its meaning is wolf boy or the boy live with wolf. This word is in, sorry, got someone enter the room. Okay. Ni tak
Oh,
suka
you don't
sebab
have
ni
to
kan.
worry about that, Aizat. You just present.
No, sorry. Sebab bila screen dekat handset, dia akan keluar nama mereka, tutup dia punya screen.
Okay, okay.
Okay, kita buka komputer. Okay, what's meaning of Enino Lobo? Okay, Enino Lobo is a boy live with a wolf. This word is in Spain. So this is meaning Marcos Pantoja live in Spain. He was born in Andalusia, which is the not the southwest of the Spain. Okay. He also he was born around 1946 in the northeast. So when this happening is around when he aged at 7 until 19 years old. This is happening when you can see this is happening at a Sierra Morena. This is at south on the hill around Andalusia. The Sierra Morena has highest peak of this mountain is 1,332 meters high. Not only that, this part is mostly like a jungle space and where the wildlife live in there so many. So Marcos Pandoja also when we found her at his age 90, he cannot able to being a human behavior. He also cannot speak frequently because he already too long left in jungle. Not only that, Pandoja also have been adopted by a family where Esther and Mirena. They adopt her and become his foster family after they found out that Pandoja cannot be live alone because he's become incapability. Pandoja also have tried to become a military, but he has been suspended because he is very slow learner, and he has been claimed as a disability person. Okay, next slide. Okay, next, as we can see, this Marcos Pandoja is very famous. Somebody has made his story become a book, and his story also has been in the news. Not only that, his this book also has been translated to many other language, with not only in Spain, but it also has other language like is English and German. So when we see Marcos Pandoja story have been read out by a person where he wrote by Manila. The Manila wrote for his PhD thesis. Not only that, we can see the story also have become others person to make a movie, such as when his story established, many story about him also has been developed. Okay, that's all for me. Okay, I give to next presenter to take over. Okay, thank you.
Okay, thank you. And once again, a very good afternoon to Miss Shirin and all my fellow friends. Today, I will be talking about a toddler that kept alive by cats. So let me walk you down through the memory lane. So Walt Disney, The Jungle Book, the picture on your left. If since your childhood, if you have not watched this full movie, but at least I know that you will know about this movie. It's basically a child living with animals, which is we call feral children. And the picture on your right, there's a child cuddling a panther or a wildcat. So the first thought comes to your mind, will this happen in real life? Will a panther living with a human peacefully? If for the panther, the child is like a fresh meat to eat. So today I would like to inform you that there is an example of fellow children that a child live with wildcats. Next. Not just I'm saying, there are a lot of articles about it. You can see on our internet that the article's title begins with like this: 1-year-old Argentine Mowgli kept alive by cats on the streets. So the Mowgli here refer to the child in the Jungle Book movie. So in real life, this incident truly happens. Not just that, we have China Daily from China website, and also from the UK also, all over the news about this child survived with these feral cats. Next. And how this happened back in 2008 December, a homeless father left a child during the winter season, and one day a policewoman found out this child along the street, and it is surrounding by 8 wildcats. So we found it very rare that 8 wildcats surround this child, and this policewoman quickly approached to this child in order to save, but this wild cat begins to be very aggressive and very protective in order to protect the child. And the policewoman also noticed that these wildcats are keeping alive the child by consistently licking the child, and also sat on top of it to like a living blanket in order to let the child be warm, because during that time in Argentina is a winter season, very cold. And also the wildcats also give scraps of food to the child. If wasn't the wildcat, I think this child will not able to survive during the harsh winter season in Argentina. And the homeless father also told to the policewoman that he has no clue about where about their current, and he at least know that there are roof over their heads. So therefore, these wildcat are willingly giving compassion upon a member that is unrelated to its species. But why not the human itself? Okay, next. To sum up the full topic, there are a lot of cases about feral children, and it is actually hard to know what actually happened to them. And here we have explained to you few examples of the feral cases. It is important to note that there are few child they will enable to integrate with human society, because human society is not a one size that fit all kinds of things. If clearly really one is unable to integrate or assassinate with human society, then they should be returned to the begin where the family heart is, if not also in the species itself. That's all from us, and now we will proceed to Q&A session. Thank you.
Hello. Hello.
Yes, we can
Yes,
hear
can
you.
hear.
Thank you. My name is Afif Farhan from BFM class. Thank you for the informative presentation. May I ask you, based on the cases that you have mentioned, what will happen to the them in the future? Will they be back living in the jungle?
Thank you for the question. For me, like Pandoja case, in March 2018, he have an interview with Aplius News of Spain. In his interview, he said he's very disappointed with the human nature, and he wish if he can, he could return to the mountain and live society. Why he said like that? Because his word in those news, he say they laugh at me because I don't know about politics or soccer. Not only that, because his lack of capabilities and his in behavior not very much like a human, they're doing something bad to him. Like he's when he's enter the military. In military, where they give a training, but he also then cannot catch up with the lesson. So when that happen, he think he very believe he can live in Jaga again. What about you, Shahrin?
Um, I think to answer the question is they are able to live as a normal people, just like others, because doesn't mean they started to grow in the jungle or not a suitable place, but it's about how they can survive to for their future. I can give you a few examples for a fairy children, like Ozana Malaya from Ukraine in 1991, which is after she grew up, she already became a nurse at the animals hospital. So the second example I can give you like Marina Chapman. She was a fairy children too, and she right now she successfully living with her family. She married with a scientist. She have a lot of children, and she also have a grandchildren right now. So my answer for this question that everyone can these fairy children have a future just like us normal people. What do you think, Tan?
I would like to add, which is sometimes it depends on the person itself whether he wanted to be where, because it is his happiness. But I can assure you that once they found a fellow children, they won't be living back in the jungle. So I hope that we have answered your question, and that's all from us. Thank you. Next, let me introduce Group 10. And Group 10 will be bring us a journey to the most famous city in the world, which is Dubai. So Dubai, before then, have nothing but sand. But now Dubai has everything. You have the great city, great place for vacation. And Group 10 will be talking about their building. What is the tallest building in Dubai? The screen is yours, Group 10.
Okay, thank you so much, Denzel, for the interesting introduction of Group 10. And yes, talking about Dubai, Miss always recall back this famous YouTuber by the name of Khalid Al Ameri. Do you know him? He and his wife doing a lot of YouTubes and all that.
Yes, Miss.
Yes, do you know? Yeah. Okay, so they are also
Yes,
from
Miss.
Dubai. Okay, so yes, it's a very modern place now. All right, so Miss would just like to put in a note. Okay, very good train of answers by the team. I think this is the one of the strongest team that continuously add on answers. Okay, among their team members. Okay, so great job. All right. Okay, so without further ado, hang on. Group 10, would you mind stop sharing the screen for a while? Okay. All right, without further ado, people, can you hear? Can you hear?
Yes.
Is someone's birthday today, though?
To you.
Happy birthday,
Happy
Denzel.
birthday to you.
Happy
birthday.
Happy birthday, Denzel.
Happy birthday time.
Happy birthday to you.
May all your wish come true, huh?
To you.
Not expecting it. Was not expecting it.
I hope the date is correct. Denzel, is today your birthday?
Yeah, it is.
Happy birthday to you. Happy birthday to you. Happy birthday. Happy birthday. Happy birthday to you.
Thank you,
Okay,
thank you.
happy birthday, Denzel.
Happy
May
birthday,
God bless you
Tan.
all with good health.
Hey, may God bless you with better health.
Thank you,
Okay?
thank you.
And all wonderful tidings. Many happy returns of the day, eh?
Same goes to you, Denzel.
Thank you very much.
Ketan, open table.
Be a good boy, ah. Denzel, be a good boy, ah.
Always be.
Below profile,
That one speaking is Denzel special someone.
Wow.
Okay. All right, let's continue with group 10. We have 2 more to go. Okay, sorry, Miss took some leeway over here. So giving back the time to group 10.
Okay, good evening to my lecturer and my friends from BFM and BU. We are from Group 10, will presenting informative presentation. So, before we started, I would like to take all of you to imagine when you in one desert, there are vast desert stretches. You go to the street and you walk and walk, you see there are one country and one city that full of technology and luxury places and has an exciting places to visit such as like Palm Jumeirah, one of the largest man-created island in the world, and the others. You see there are many buildings, and I would like ask all of you, do you have been go to Dubai?
No.
So if yes, or you don't go to Dubai, you will see this skyscraper, this giant building that is very well known all of the people. It is the Burj Khalifa. Oh, wait a minute. Sorry, I forgot to introduce myself and my teammate. So my name is Muhammad Aiman Anik bin Hazazun, and my teammate is Muhammad Alif bin Kamalisa. So we will presenting you about skyscraper, the Burj Khalifa. So I will pass next to my next presenter is Alif.
Thank to the presenter Aiman Anik. How tall Burj Khalifa? Burj Khalifa is the tallest building in the world. The height of Burj Khalifa is 830 meters from base to tip of Burj Khalifa. The most upper part on Burj Khalifa, the level floor Burj Khalifa, this mega tall building has 163 floors. Make Burj Khalifa hold as the tallest building in the world. Okay, so move on the next slide. I will explain one by one the level of Burj Khalifa. As you can see there, is hotel in Burj Khalifa? Yes, Burj Khalifa has hotel. The name of hotel is Armani Hotel Dubai. The world first Armani Hotel Dubai opened door to the world on April 27 April in 2010. From the room design to the carefully selected textile and fabric to the impressible service, every aspect of the Armani Hotel experience will hear the signature of fashion legend Giorgio Armani, offering 160 guest room and suite, restaurant and spa. Armani Hotel Dubai bring to life the stay which Armani promise, and especially lifestyle experience defined by the highest standard of aesthetic and service excellence. Burj Khalifa also have resident place, the world's most prestigious address, with 900 residents including studio and 4-bedroom apartment. The resident Burj Khalifa are spread over level 19 until 108 of the tower, and the first residents are currently moving in. There are several famous persons on it. One of the famous designer Giorgio Armani, after helping design the interior of building, designer Jeremy Amari reported on an apartment in Burj Khalifa. Another famous person who owned a resident of Burj Khalifa is David Beckham. Power couple David and Victoria Beckham also own a 7-bedroom villa in Palm Jumeirah Perth at 960 million USD back in 2008. The following years, the Beckham purchased another property, this time in one of the south after location Burj Khalifa. The couple home in the UAE iconic skyscraper cost about 4.9 million USD. Next, restaurant. The restaurant at Burj Khalifa was named as Atmosphere, the world's highest restaurant in ever as one on the fitness, luxury dining, and longest experience in the world, and it has 4 floors in Burj Khalifa. Okay, so move at the next slide. Okay, I want to tell about the history of Burj Khalifa. Okay, can move the next slide. The building was original named Burj Dubai, but at the time, the original emerged for apprehension facility problem and Burj Khalifa project were once on the rest of healthy and they required more money and economic funding. Sheikh Khalifa, the rule of the United Arab Emirates, granted monetary and funding, hence resulting in the changing of the name of Burj Khalifa. The word Khalifa also has significance in Islamic. It means Islamic world supreme leader. The duration construction of Burj Khalifa is 6 years. And so the skyscraper, the Burj Khalifa, was officially opened up to all people January 4, 2010. Okay, next. Okay, I can move to the timeline of Burj Khalifa construction. Of course, you cannot leave out how the material and manpower made up when talking about interesting. It took more than 100 ton of concrete, 100 ton of steel rebar and 22 million men per hour to complete the Burj Khalifa. About 12,000 workers work on the building per day, started evacuation and piling on January 2004. Superstructure started in 2005. Superstructure that part of the building which is nearly above the ground, level 10 until 150 reached in 2007 at level 141. Burj Khalifa was raised as world's tallest building at the time. At level 150, Burj Khalifa also was the world's tallest freestanding structure. Level 160 reached level world tallest man structure in 2008. On January 2009, the Burj Khalifa was completed and ready to interior work. Finally, on January 2010, Burj Khalifa was launched and ready to operate. Okay, the next slide. Do you know who the designer of the Burj Khalifa? Designer is by Adrian Smith. He was American popular architect which he contributed to manage design the another Ashworth Tower, such as Moa Tower in Shanghai, which is a popular tower in Shanghai. He also the leader architect of Jeddah Tower and of the most advanced technology and located at Jeddah, which affected the most taller building in the world in 2022 once all are done. He also was been the senior architect of Trump Tower that's owned by former American President Donald Trump. That's all for me. I can repass to my second presenter is Ayman Ani.
So now let's move on to the fact of Burj Khalifa. So as we all know that Burj Khalifa is a mega tall skyscraper in Dubai. This building is best known for being a current world's tallest skyscraper in the most popular tourist attraction in Dubai. The Burj Khalifa height is a staggering 838 meters or 2,717 feet tall, soaring over Dubai. It's twice as tall as Petronas Twin Tower and it's also 3 times tall as the Eiffel Tower. And for your information, nearly about 25 times tall at the statue of the Statue Liberty, New York. As you can see, even Empire State Building in New York also need 2 buildings stand up and down each other to complete the tallest Burj Khalifa. Laid end to end, it is stretched over a quarter of the way around the world. Its cloud-piercing height is certainly one of the most impressive facts about Burj Khalifa. So next, we move to how much weight of material Burj Khalifa. One of the most mind-blowing Burj Khalifa fact is how much material weight. This mega project involved more than 380 skilled engineers and on-site technicians. Over 45,000 of concrete weight more than 110,000 tons were used to construct the concrete and steel foundation. To put this thing to perspective, the weight of the concrete is equivalent to 100,000 male elephant. Meanwhile, the total weight aluminium used on the Burj Khalifa is equivalent to that of 5 Airbus 380 aircraft full passenger. Airbus 380 is the most larger jumbo jet commercial airliner in the world, just for aluminium only. It's amazing, right? So next, it might be debate whether you can see the Great Wall from space, but there's no doubt that from land, the tip of the building, Sapphire can be seen from up to 95 kilometers per way. Whether exploring the desert done on safari or drifting along the cool water on nearby bay, the skyscraper seems to follow you. Absolutely outstanding. So next, we all know that Dubai hot, humid climate and combined with the building. So its requirement the building cooling create the significant amount of condensation. This water is collected and drained in a separate piping system to a cooling tank in the basement car park. The condensate collection system provide about 15 million gallons of supplement water per year, equal to about 20 Olympic sizes state swimming pool. The tower water system supply on average of I think about 900,000 liter per watt of water daily. At peak cooling, Burj Khalifa will require about 10,000 ton of cooling, equal to cooling capacity provide about 10,000 ton of melting ice. So it is awesome. Next, this mega tall skyscraper in Dubai, United Arab Emirates, standing at 828 meters. This building is best known for the title world tallest building. Burj Khalifa has observation deck named at the top at 148th floor. Due to the tower tapering from, none of these observation close that is close to the peak of tower, as the floor plate of upper front are too small, but still the observation deck on 148th floor is currently the tallest observation deck that open to public. Even you can see your ex-boyfriend or ex-girlfriend with someone else. Believe me. Next, this marvelous building stands over 2,760 feet tall in height, around 828 meters, one of the huge skyscraper in the world. It has 160 stories. This building is the tallest freestanding structure on the planet and has numerous stories of any building in existence. So next, some Burj Khalifa trivia about the elevator. The building has the longest single running elevator, which is 140 floor. The Burj Khalifa elevator speed is 10 meters per second, making the elevator among the fastest in the world. Burj Khalifa elevator speed is 10 meters, so they're making the elevator among the fastest in the world. The Burj Khalifa elevator time to reach the observation deck on 134th floor just take only 1 minute. Imagine how fast is that. Did you know that the Burj Khalifa is so tall that you can watch two sunsets on the same days? So here the fact that I will blow your mind. The Burj Khalifa, the largest work in the world, it's so tall that you can watch the sunset from the base of the building, get into an elevator right on the top, and watch the sunset all over again. In fact, if you are the Muslim living on top of the Burj Khalifa, you will have to fast longer during Ramadan because of this time difference, about 3 minutes between the time of the sunset on the ground and the sunset on the top. So finally, for the conclusion, what is the Burj Khalifa used for anyway? It's actually multi-use building that has restaurant, a hotel, resident, apartment, office space, and tourist attraction with its observation deck. There are many several times skyscraper in the world whether complete in service or in the middle of the construction. So as you can see, Burj Khalifa right now is a major tourist attraction and the most famous city point of the interest. So that's all for our group. We would like to thanks for all audience for listen our presentation. So for the next question and answer.
Hello. Okay, my name is Nur Asma Balkis. I want to ask, did someone die during construction of Burj Khalifa?
For this question, thank you for asking for this question. For this question, unfortunately, there are 4 people died during the construction of the Burj Khalifa. One are from the local and 3 are from the Indian, which is 2009. But luckily, Aima Properties has compensated their heads of the victim. So that's for the answer.
Hi, thank you for the informative presentation. May I ask how much money that it costs to build the Burj Khalifa?
Okay, I can give the answer. Cost of Burj Khalifa is estimate 1.5 billion US dollar. Okay, that is the answer. It's fun.
Wow, so many. Okay.
All right.
Hello, my name is Afif. Thank you for your informative presentation. May I ask something?
Yes. Go ahead.
Who own a whole Burj Khalifa?
So for that question, thank you for the asking. The owner and the whole of Burj Khalifa and properties are by to Aima Properties, including a tower that Alif said earlier. So I think that's the question and answer for this presentation. So I would like to thank you for all of you. So last one, we honored to introduce last group presenter, Group 11, will present about tourists in Malaysia as income to economic. Please welcome.
Hello. Test, test. Anyone here?
Yes,
Okay,
we
you're
can
good,
hear you.
Happy. Miss can hear.
Yes, good. Okay, can you guys see the slide?
Yes.
Okay, thank you. Okay, we would like to start. Okay, the timer ready? Okay.
The timer is already.
Okay. Sorry, I don't know. Okay, Assalamualaikum warahmatullahi taala wabarakatuh. My name is Nur Azri bin Muhammad Azli. Nomometrik 08 BFN 20F 3004. Okay. With my friend Takif.
My name is Ahmad Takif bin Muhammad Nizam. Number matric 08 BFM 20F 3010 as speaker 2.
Hey, my name is Muhammad Afi bin Hisham. My number metric is 08 BFM 20F 3002 as presenter number 3.
Okay, thank you. So for today, we are going to present about the informative speech, which the title is tourism in Malaysia. Okay, so we want to invite you guys to see the video. Okay, so this is Malaysia. Okay. The topic is tourism in Malaysia as income to economy. We would like to inform about this topic because we have done our research for this topic. According to Ministry of Tourism and Culture of Malaysia, the tourists in Malaysia have contributed a lot of economic growth to the Malaysia in terms of financial. The increase of income from tourists contribute due to many factors, such as job opportunity, tax revenue. Okay, this is because Malaysia have a best place for traveller. Okay, next slide is. Okay, as you can see, figure 1 shows employment in the tourist industry, number of person, annual percentage change, and percentage share. Okay. Okay. Okay, in Malaysia, tourist industry contribute a lot of job opportunity. It's create around 2.8 million job opportunity in 2015, which include 20.6% in total employment. And in 2016, 3 million job filled by 22.5% of total employment in Malaysia. This include the increase by 9.8% from 2015 to 2016 by 9.8%. So in 2017, 3.3 million job is filled in the total employment Malaysia 22.9. Okay, this include increase by 4% from previous year. Okay. Next is 3.5 million job in 2018, which include 23.5% in total employment. This increased by 4.9% from 2017 and 2018. And for the last one is in 2019, 3.5 million jobs have been filled in this industry. which include 23.6% only from the tourist industry. This means the tourist industry have do a lot of contribute in the term of job opportunity. Okay. Last is food and beverage service, service and retail trade, where the main industry in tourist employment with a share of 34.7% and 32.5% respectively. Both subsectors have cumulatively contribute 67.2% in total tourism employment. So how tourism contribute job opportunity? Okay. Tourist industry contribute a lot of job opportunity. As the economy grow, the tourist sector such as hotel, restaurant, theme park, travel agency, and others, they will hire more workers to fulfill their requirement. So tourist is a more seasonal industry because they have peak season and should season in a year. When peak season, many tourist sector will hire more workers or want their worker work overtime, and they will increase their work and salary. So next I will pass to second speaker, Muhammad Akif. Thank you.
Thank you, Azri. So now I will present about the second factor. According to figure 2, this bar chart shows the total tourist arrivals and receipts to Malaysia from 2007 to 2018. The highest tourist arrivals in Malaysia is on 2014 with 27.44 million of arrivals, while in 2018 it shows the highest receipts with 84.1 billion ringgit Malaysia. From all the years, there are increase in the receipts amount made by tourists, but not in tourist arrivals. The tourist arrivals show the fluctuation amount. 2015 showed a decrease of tourist arrivals with 25.72 million compared to 27.44 million in 2014. It reaches to peak again in 2016 with 26.76 million, but slowly turned down in 2017 and 2018 respectively. So how? How can this happen? The reason of increase of income by the tourism contribution is the tax. According to New Straits Times 2019, Asian governments are increasingly turning to integrated results for tax revenues, including Malaysia. Malaysia also have many of interesting facilities as to encourage tourists to spend amount of money. Malaysia have fabulous shopping centers which are associated with some magnificent hotels by Alam 2015. So next, I will pass to next presenter, Muhammad Hafi, for continue the presentation.
Thank you, Ahmad Takif. A reminder, my name is Muhammad Hafi and I will continue for the figure number 3. As we can see, this graph shows the Malaysian income from the tourism contribution based on major state. We can see Selangor, Wilayah Persekutuan, Johor, Penang, Perak, and Sarawak. Okay, Selangor show the highest tourism contribution to Malaysia economy. There was a lot of tourism contribution to Malaysia during 2018. The highest amount with 50,1977.9 million at 30.7% of contribution is gained from tourism in Selangor. And why? Anyone know why Selangor is the highest contribute to economy? Okay, I will tell to you why Selangor is the highest. Selangor is the best place
for traveler because it has much of water theme park, fruit farm, mall, and many of attraction. Recorded by Chin 2018, the venue ranged from a water theme park to a fruit farm and an outlet mall like Royal Klang, Heritage Walk, Sky Mirror, Gudamai Extreme Park, Bangi Wonderland, Tanjung Sepat, Selangor Fruit Valley, and Mitsui Outlet Park, KLLIA. That is why the Selangor is the highest contribute to economy Malaysia. Okay, for the next, okay, we jump to our conclusion. The simple conclusion. As we can see, all the graph bar chart show the tourism industry contribution to Malaysia. There are many factors increase of economic growth to Malaysia. For recommendation, to keep the increased amount of income to Malaysia, the government need to provide much of facility that may attract the tourists to come to Malaysia, such as transportation and building. This can be done by manage the government financial in order to finance the construction or refurbish of facility in focus state, especially in Selangor. Okay, next. Okay, this is our reference we use to this presentation. Okay, now we are going to Q&A station.
Hello, hello.
Hello, yes.
Thank you for splendid information speech. So my name is Bahtia. I want to ask a question. How does tourism contribute to economy, in your opinion? Okay, thank you.
Thank you, Bahtia. Nice question. How does tourism contribute to economy? Tourists may contribute to the Malaysian economy by the tax and expenditure. For the tax, they might pay them when they are entering any theme park or hotel for check-in. They need to pay some extra money. That is the tax paid by them. While the expenditure made by them is when they are spending their money for food or beverage along their trip in Malaysia. I hope my answer will answering your question. Yeah.
Okay. Okay, thank you.
Okay, another one.
Hello. Hello.
Okay, yes.
Thank you for the great presentation about tourism. My name is Natsua Balkis from BFM. I want to ask what the positive and negative effect from tourism. That's all.
Okay,
For
thank you,
positive and
Asma, for
negative,
the...
my friend will answer this question.
Okay, thank you, Asma, for the question. So the question is, what are the positive and negative effects of tourism on the economy, isn't it? Okay, for the positive effect, tourism on the economy will get more revenue from tourism industry, which is more money to come in. And another positive effect is improvement in construction industry and facilities. It is because people will start invest in this industry in order to provide a good facilities for people outside. And Azri, can you give the negative effects? Your mic is mute.
Okay. Thank you, Muhammad Takif. So I will explain about the negative effect from tourists. So I have 2 points, which is, first one is some foreigner will come to Malaysia to work with passport illegally and will monopolize job opportunity from local people that we say today. Second one is it will also damage to the natural environment, such as food patch erosion, little habitat destroyed to build some of the hotel that need to attract the tourists. Okay, thank you.
I think that's all from us. Thank you.
Okay. All right. Good job, everyone. Okay, so let's give a big round of applause. Wait, please change the lighting.
Almost 7 hours.
Thank you so much. Oh my gosh, it has been a super long day. and I'm so happy that this has come to an end. Okay, so Miss was actually planning to, not to stream the debriefing session or to stream it, but I suppose if I stream this debriefing session, next time in the future when you like to look back to how you've come so far, or in your public speaking journey, you like to see, or measure yourself, I think you can always fall back onto the YouTube link. Okay, so thank you so much for the wonderful presentation. And for the last group, it's not easy to talk about tourism and how it helps with the economy, and it's rather technical and academic at the same time, but I believe we managed to do that well. Okay, so let us just debrief. Are all ready? Everyone's here? Can I see a show of hands?
Yes.
Be you, where you?
Yeah, I'm here.
Okay, nice. Thank you for the voices, people. BFM?
I'm here.
Hello, yo, yo, yo.
Okay. All right. Thank you so much.
Here for you, Miss.
Okay, thank you. Okay, so let's debrief. Overall, how do you think you have done for your presentation? And how do you think your friends or classmates have also done for the informative presentation? Okay, some responses.
BFM or PEU start?
Okay, you can either use slides to present, to talk about what you feel, or if you don't want, you just simply share. Okay, how do you think you have done, and how do you think your friends have done as well for today? Anyone like to hear from Shari? Okay, let's start with BU. Okay, the morning session is basically run by all of you. So how do you think that you've done for your informative presentation?
Hello, can you hear me? Can you
Yes,
hear me?
perfectly clear, Balkis.
Okay. So during the morning session, it was BEU students, and to inform to BFM students once again, we will talk about our topics, some of our topics in anatomy syllabus. So I think that because we need to stick on anatomy topic, and probably some of you might don't have the anatomy background, or it probably some people are struggling on what will we talking about, because it's something that some of the topics you can't clearly see it in the real life. It's because it's part of our body, inside our body. So for those who has not taken that anatomy background, probably you might have some hard time to imagine things about what we will be saying about. But overall, it was an interesting topic because we can share to you what actually the EU students are learning about. And one of it is about anatomy.
That's right. Okay, is that all, Balkis?
Yeah, I think my friends can edit more.
Okay, all right. Good reflection, Balkis. And yes, I have to agree with Balkis as well. BEU's presentation is rather very technical, and it is actually meant to tailor specific audience who has anatomy background knowledge. Okay, but since facility management students don't have as much background knowledge as BU students, including myself, okay, I'm going to throw a question to BU and ask. Since we do not have that background knowledge, how can you make the anatomy topic, okay, which you presented, interesting to us as well? Okay, so this is a very good question for all of you to ponder upon. Okay, how can you make us interested in listening about cells? How can you make us interested in listening or wanting to know more about our blood? Okay, so there are many more topics that you can actually think about. Yes, I agree it's rather technical, but how you relate to the audience and drawing from what they have already known, that is your art. Okay, and most of you did not manage to really capture that part. Okay, for instance, if you want to talk about blood, you can simply just throw a question. Okay, so thank you so much. We now are going to look about blood. Okay, the very important aspect that keeps us alive As if there's no blood, our heart won't be pumping, our brain cells, we won't be thinking, and our organs won't be moving. So can I just see a show of hands? Who over here is the type A blood? Raise hand. Type O, type AB, type B. Okay, so the moment you ask questions like this, you manage to draw people's attention. And when you manage to do that, people will be more interested to know what you're talking about because there's a reason. Okay, so the same with the rest of the topics as well. Lung capacity, you could have relate the topic to the pandemic on why we should know about lung capacity. Okay, not just that, how COVID-19 affects your respiratory system. Before going into the topic, ask them, do they sometimes feel difficulty breathing, and do they instantly think that they might have COVID? You know, relate to the audience. You can. I agree, the topics are very technical, but at the same time, you can find ways to tap the audience and meet them, not just in their hearts, but also on their mind. All right, the same with diabetes. Okay, you can ask people around, do all of you love sweets over here? What about candies? What about pengat pisang? What about pengat durian? A lot of things you can ask. Then drawing from their answers, you relate to diabetes. Okay, the same goes with our kidney, the same goes with food consumption on health, the same goes with respiratory system, the same goes with cell. Okay, the same goes with blood, stress, reproduction system even. Okay, I am sure everyone over here, okay, do have the wish to want to settle down, and this could be interesting for us to know. Or even if you do not have the desire to settle down, we being produced, you know how it works, how are we here? Okay, you can relate to that. And dark chocolate is a little bit off tangent, but I'm interested to see how the group draws back the topic to anatomy, okay, as a whole. Okay, so talking about that, yes, I agree, it's a very technical topic, but at the same time, can you actually tap your audience who doesn't have any background with your topic, even though it's technical? Can you? Can you? Be you?
What is it, miss? What was it? What was that about?
Can you actually tap your audience, okay, and meet them and draw them to be interested in your topic, although it's very technical, like what the examples I've given? Can you?
Can, but I think through online is quite a bit hard because we can see the audience, so it's really hard for us to communicate with them.
Definitely, but how are you going to make the best of it? Okay,
Problem.
and sometimes the communication, you don't even need their responses.
Okay, Miss, I
Okay,
will.
it is called rhetorical questions. You don't even need their responses. You just throw questions, they answer, and you sort of tailor your speech according to what they might answer in their head.
True. We relate to their basic life. We relate, so like some of respiratory like COVID-19, we already know that we have to wearing a mask, hand sanitizer, for example.
Correct.
So
You can even bring in a mask to your friends.
yeah, that is for example. I learned from the YouTube say like use more image is more people more capture than use words. Lots of words in
Definitely.
this slide.
I have no problem with your slides. I think they are all very good. Okay. And I have not much of a problem with the visuals you use as well. I think they are good. Okay. But I believe you have very big room of improvement in drawing your friends' attention and giving them a purpose to listen. Okay. So because it is a technical topic, you need to be even more specific and clear in letting them know why they have to listen to that. Okay, do you agree? BFM, do you agree with Miss? Or you have a different idea?
Yes, me, I agree.
Okay,
Yes.
did you manage to come in to listen to BEU's presentation?
Yes.
right? So how BU you can actually use this as an advantage, okay, is to relate it to what we already know and what we feel that is important. Okay, so I believe that is a very big lack in terms of BU's presentation. Okay, so as for BFM, I applaud you. You have the better edge of the informative presentation today, mainly because number one, your topics are worldwide and anything under the sky, so you can just freely choose. Okay, so anything that perhaps tap your interest, you feel like, oh, this is going to give you a better edge, then you use it. Okay, so for me, I believe today's informative presentation, BFM is at a better edge. BEU still can improve, albeit the subject or the materials are technical, but you still can improve. Okay, uh, but BFM, yes. And I see BFM, you come in, you don't straight away rush to the content. You take time to really ask questions, to really build, okay, audience interest, and to really grab what they want to hear. Okay, so from right from the start, we started very well with Shahmi's group until the end. Okay, you don't straight rush to the content. You take time and you ask questions first, and you show pictures, or you show quotes, or you show statistics, or you tell a story. Okay, so that actually strengthen the presentation. Okay, so is that acceptable?
Yes.
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 All right. Okay.
Yes.
So, any more responses from all of you on how you have done or performed for today? Okay. Does having the live session on YouTube push you to a more serious note to present?
Oh, yes. Probably yes.
Probably. Okay. So
Yes.
for
Because
tomorrow, do you still want it? Or Miss was thinking, to let go of the live, but we do it on Teams instead and see how we feel on persuasion.
Okay.
Or you still want the live?
Um, I doesn't matter. Either
it,
live or not.
it's up to
Either
you,
one.
Miss.
It's,
It's
it's, up,
your.
it's up to you. It's up to
Okay,
you, Miss.
I was thinking that we let go of the live. We do now on Teams for tomorrow, so we experience a different kind of experience and see, at least we have something to compare.
Yes, I agree.
Okay.
So tomorrow we will start presentation on Teams. Is that true?
No, tomorrow's presentation won't be on Zoom. It will be on Teams.
Okay.
What?
Okay.
On Zoom and Teams.
On Teams, yes. In general group, not in your class group.
We want team.
Oh, okay.
Same time, 8 a.m. sharp.
I might have to postpone the time 1 hour
Yes,
earlier and 1 hour later because Miss has to drive to work, and at the same time I need to pick something up along my way.
All right.
Okay. All right. So
see you
maybe
at
we
9.
start at 9, and we begin with PFM.
Ooh.
Okay. So before ending today's session, let me just wrap up lah. Overall, I believe all of you are good. You put in effort into your presentation, and that is very visible. I'm very happy. Okay. So all my notes from this point onwards is to push you further and to give you some space to think how you can even, amplify your presentation. Okay. So that you don't just be comfortable at whatever you are, but you continuously push yourself to be better, question yourself, challenge yourself, and you continuously take that challenge, okay, to progress, to improve, and to polish your presentation. Okay, so these are the good notes and points that I want to perhaps highlight. Okay, we begin with BEU, and I particularly like Iqmal's group, whereby they mention the purpose clearly on why we should listen before actually getting into the presentation. So that was really very good. You build a strong purpose in your audience to why they have to listen and why they have to give you that time to listen. Okay, so that's very good. Congratulations to your group.
Thank
Okay,
you, Miss.
perhaps what you can do further is um, Be clear and sound more convincing instead of scared, because you look a little bit scared when you do that. Okay, be more bold, be more confident, and just say it. All of you should listen to this because this. Okay, so when you're more bold, people are more convinced, okay, to be influenced by you. All right, so anyhow, very good, strong purpose. Second is, I love Feng Yi's group, okay, on the audience engagement, whereby they ask questions and their group members answer, and also they keep throwing questions to trigger our mind. Okay, so that's very good from Feng Yi's group, and I like it. Okay, that way. As for Balkis group was okay, but Balkis appear strong, and the last one, me still cannot hear, so I still have to check the recording to really give marks. Okay, Balkis one was okay, but because you started first. But let us compare with BFM's first group. Okay, which one do you think come stronger?
I think personally, because I was in the BFM session as well, I think BFM was a little bit greater than ours, because how they engage with the audience was so great, brilliant.
Gripping. Okay.
Yes.
Yeah. Okay. So yes, I have to agree. Okay. But you yourself, you were very fluent as well. You came in strong, but the momentum was not sustained and built up from there to end with a bang. Okay. Because the voice, I think there's some audio problem with your third friend. So we couldn't really hear. So you built it, it went down. All right.
Okay.
A good team presentation is you build upon another, and you end with a bang. You don't fall.
All right.
Okay? That will make a great team presentation. Okay.
Sure.
Next is I like the humor given by Aiman Anik's group. Okay, on Burj Khalifa, even when you even when you look from far with what you can even spot your former exes and all that. Okay, I thought it was very funny. So I think Aiman Anik's group is the only group that embed humor. Okay, at the same time, I love Darshan and Irfan's group on beautiful slides. Okay, so that was really great as well. And I have to applaud and praise all of you for all your beautiful slides. Okay, I think you really put a lot of effort, okay, to come up with strong visuals for your presentation. Okay, so good job on that, everyone. Next is Lisa's group did an amazing job by relating something so foreign, Eiffel Tower, okay, in Europe, a place which we have never been. Most of us have never been, to the pandemic. Okay, so I think it's a beautiful connection that you built upon there. So that's great as well. And Denzel's group introduced something rather new. Okay, which is on what reading? Can't remember. On yes, that's right. Correct. For feral children, not being. I was thinking about feral being. Okay, sorry, I lost it. Okay, correct. Feral children. Okay, children, we know it, but when it comes to feral, it's a great concept to talk about children, and you introduce something new at the same time drawing our experience. Okay, so those are the few which are memorable to me. Okay, but the rest who are not quoted doesn't mean that your presentation is not good. Okay, it's just that my memory has a limited space for things to be remembered, and those happen to come by. All right. So for your persuasive presentation, I hope tomorrow you will consider ways to engage audience. That is number one. Okay. And number two, your confidence and your energy and your enthusiasm, because confidence, enthusiasm, all 8 marks already, 1 4 marks. Okay. And your facial expression today a little bit dead still. Okay. You need more on your facial expression, because us Asians, we don't really express much. Okay. Using our face, but face gives a lot of meaning. Okay, face suggests a lot of meaning. So I hope tomorrow you will try looking at yourself and see, when you talk, how is it? All right, so facial expression, that one has marks as well. confidence, enthusiasm, articulation of words. Many of you still struggle with certain pronunciation of things. So hopefully you check using the dictionary on how to pronounce certain words. Okay, like dining, not dining, vehicle, and a lot more. Okay, I wouldn't want to mention. Obese, not obese. Okay, obese is Malay. Okay, obese is in English. All right. So number one is engage audience. Number two, don't hurry so much into your content. Slowly build. Once the audience get you, then you enter. All right. And number three, throw questions to the audience. Throw rhetorical questions. Even when they don't answer, it's fine. Okay. You build from there and then end with a bang. All right. And with something that we can remember by. So this is one great thing that BFM did. BFM put a lot of statistics. BFM put a lot of quotes. Okay. And BFM put a lot of data research. And someone said this, or quotation from ministry, from famous people, which I feel BEU can still do that. Even though it's anatomy, you should have told us, some quotes by certain doctors or certain TikTok doctors to make it cool, there wasn't any much of creativity in that sense. Okay, so I feel there can be some room for improvement. And yep, I think that's all. Okay. All right, so it's already 4:05. Any comments or any reflections from all of you? Denzel, Feng Yi, Ikwan, those active one, always talk one, Darshan.
Afif, Miss, Afif. Talk,
Afif.
talk, Ikwan.
Even Anas, no, Anas always smile only. Okay, Balkis already done. BU generally very, docile, sweet, and generally very controlled one, BU. Medic one. Okay, but BFM, the noisy bunch one. Okay, so any comments?
No lah, Miss.
I say, now show himself already.
BFM, the silence class lah.
Okay, any comments? So all acceptable?
Yes.
Yes,
So
all
Ikwan.
acceptable?
Ikwan.
BFM should close this session, Miss.
Yeah, okay. So if all acceptable people, I hope you will take into account the things I've said and try to apply it in your persuasive. Tomorrow we begin with BFM on Microsoft Teams general group. So please help me to record, okay, in case I forget. All right, please help me to do the recording. And I will see you tomorrow. Okay, so meanwhile, before that, let us take a group picture to end today's day. I think we've had a great, amazing day. Shall we take a picture together?
Wait, Miss.
Yes, of course.
Put on my shirt.
Yay. Okay. Hang on, not many switched on yet.
Ame mana Ame?
Adudu.
Adudu lah, Dudu.
Oh, cannot. I can't share screen. I share, cannot see. Okay, never mind. I stop, okay? All right. Okay, Sushan. Miss want take picture.
Miss, call Ame Isaac, Miss.
Why? He's not here.
He's sleeping. Open your camera, please, Ame Isaac. Ame Isaac, please.
Okay, ready?
Adudu.
Tak buka, tak ada attendance. Okay, 1, 2, 3. Okay, one more. This is first page only. Okay, the rest all please maintain. I'm going to go, got 3 pages altogether. Second page. Okay, Iqmal, smile, Iqmal.
Kak Liza kat Paris.
All right, nice, Fadlin. Okay, next. Third page. Batrisha is here. Amir is here. Okay, Amir buka already. Okay. All right, so I guess we have quite a good picture here. Okay, smile. All right, awesome. Okay, so thank you so much, people. Beside Denzel, anyone's birthday today?
Ikwan.
Lie. You bluff, huh? Anyone's birthday? No?
Adudu, Miss.
Okay, all right. I won't believe you. All right, so that's all. I'll call it a day. I will see you tomorrow. Okay, people?
Okay,
Okay,
Miss.
bye-bye. Thank you so
Bye.
much, people.
Okay, bye,
Thank
Miss.
you.
Thank you, Miss.
Thank
All right.
Thank you very
Take
much,
care.
Miss.
See you tomorrow.